Good afternoon, everyone. Madam Administrator, I assume we are all set to go.
We are all set, Madam Chair. Just one point of housekeeping. For those who are attending the hearing and wish to speak, you will need to accept our promotion to panelist. And if you have any issues at all getting on, everyone should have my email, so feel free to reach out.
Thank you for that very important announcement. We will dive right in. We have 155 people signed up to testify today. And with that, we will go directly to John Carl Casa. Welcome.
Thank you, Madam Chairman, members of the committee. I'm John Carl Casa. I'm President and CEO of the Connecticut Community Nonprofit Alliance. Thank you for the opportunity to speak to you today about the state budget and the needs of community nonprofits. And thank you for getting me in from my driveway. I appreciate that too. First, I want to thank both the General Assembly and the Governor for increases in funding for providers over the course of the biennium. Those increases will make a difference in people's lives. But two things can be true at the same time. And even with those increases, nonprofit buying power is as much as 30% behind where it was 20 years ago. And there are some services that have not benefited from the COLA increase. Nonprofits exist to do things so the government doesn't have to. They're the way in which government learns about the needs of our most vulnerable residents. They're also the mechanism it uses to reach into communities to help the more than 500,000 people a year served by community nonprofits. There are 118,000 nonprofit employees. They serve people with intellectual and developmental disabilities. They meet the behavioral health needs of both adults and children. They operate halfway houses for people restarting their lives after prison, and they provide our neighbors with housing, shelter, food, and much more. That's Connecticut's social safety net, and it faces new and unprecedented challenges in 2026. The question that needs to be answered by state government this year is whether that safety net will be strong enough to withstand the added pressures being put on it by the federal government's retreats from its traditional responsibilities. That doesn't just mean cuts to programs that directly fund nonprofits, because cuts to programs like SNAP or ACA will significantly increase demand, and thus it'll increase the cost that nonprofits have. You, as the Appropriations Committee and members of the General Assembly, can make sure that even if the safety net stretches, it will not break. We're asking that you increase funding by $155 million beyond that already in the biennial budget for 2027, as described in our written testimony and will be described by others today. Increasing funding for all community services to the same level as IDD providers are getting over the biennium. For those IDD providers, increases in room and board rates, and fully funding Medicaid rate increases so that Connecticut comes up to the level of comparable states. With a projected $2.5 billion surplus, Connecticut can meet the needs of its residents, it can stabilize community services, and still remain fiscally responsible. Through the years, nonprofits have been supported in a bipartisan way by you at the state capitol. Responding to new challenges posed by the national government need not be a partisan response. It should be a Connecticut response. And by standing together, folks on both sides of the aisle, nonprofits and state officials, we can be a model for how 49 other states can protect their own vulnerable residents. Thank you. Thank you for your consideration of my remarks and the remarks you'll hear from folks today.
Thank you very much, John Carl. It's nice to see you. Next, we have John Schwartz.
Good morning. Senator Austin, Representative Walker, esteemed members of the committee. My name is John Schwartz. I'm an East Haddam resident, a registered voter, and I guess more appropriate to this particular conversation, a man in long-term recovery from a substance use disorder. and a condition that separated me from all of the things and people that I love for over 30 years of my life. I'm also here as the manager of the Wyndham Recovery Community Center, the longest running recovery community center in the state of Connecticut, having just celebrated 22 years in continuous operation last Friday. I'm here to speak. I submitted written testimony, but I'm here really to speak about the things that a recovery community center provides that are not available anywhere else in the state of Connecticut. A recovery community center occupies an interesting role in that we're sort of inside the continuum of care, but outside as well, right? So we are contained within the trajectory of a normal recovery journey, treatment to withdrawal management to treatment to sober house and all the resources that are available and building people's recovery capital. But we're also available to and eager to engage with people who are on the margins, who maybe aren't quite so sure that they want recovery yet. And the center acts as an incubator where people are convinced to really address the human part of it, right? I mean, because we're the human connection part in the recovery sphere, what can be a really inhumane process for people. So we're trying to help people connect and build their own resources, internal and external resources, in order to really find their place. One of the reasons that people don't seek treatment for substance use disorder is because they really don't feel like they're worth it. Their self-worth and their self-esteem is so low, and their interactions with the system have led them to believe that this is something that is either not for them or they're not worthy of. So what we try and do is connect on a human level to convince people of their intrinsic value, right? So that they can engage in things that will help them to improve the quality of their own lives. And we always keep the recovery, the individual, in the driver's seat. In other words, instead of directing people as to what they should or shouldn't do, we ask them good questions and listen to what they're trying to tell them in order to help them get to where they want to go. Again, as you know, the Recovery Community Center and Connecticut Community for Addiction Recovery in general is an incredible bang for the buck in terms of investment. I have seen the most remarkable transformations occur in people in the space that I've been privileged to work in for almost 10 years now. I recommend wholeheartedly the increase of funding to DEMAS, to Connecticut Community for Addiction Recovery, and for other recovery community organizations, because we really are the people that provide the environment that help people to develop the willingness to engage in the recovery process. And in my experience, the willingness to engage and the ability to stay engaged in the recovery process is the single most important factor. When I was out there using, you could have showered me with resources, but I just didn't believe that I was worth it. I didn't think my life was worth saving. If I had a place like my center to come to at that point in my life, I might have changed things around a lot easier. And I certainly am more than willing to stand and hold space for anybody who's looking to do that kind of change. So again, I thank the
Thank
members of the
you.
committee. I thank you for your continued support. And again, just thank you so much.
Thank you so much, Mr. Schwartz, for your work and being here today. Next, we have Kevin Zingler. Welcome.
Good afternoon, Senator Austin, Representative Walker, and members of the Appropriations Committee. My name is Kevin Zingler, and I am the President and CEO of Mark Inc. of Manchester. We're a DDS provider supporting individuals with intellectual and developmental disabilities in our community for over 74 years. Next year is our 75th anniversary. I want to thank you for the opportunity to testify on this year's budget adjustments. I want to thank Governor Lamont for not reducing the DDS budget in his mid-year term adjustments. But by preserving that enacted funding provides important stability in a system that has operated under significant strain for many years. I also want to thank the legislature for including DDS-specific rental assistance program vouchers in the budget. Mark has a supportive housing project opening next year, and these vouchers will be critical to ensuring that individuals with disabilities can access safe, affordable housing. Housing is one of the fundamental pathways to independence and dignity. We appreciate the stabilization and funding, but I want to emphasize that stabilization is not the same as sustainability. Like providers across the state, we continue to struggle with recruitment and retention of direct support professionals. And I want to also thank all the DSPs out there working today, holding down the forts for all of us across the state. They're our backbone for our services. In previous years, I have testified that any gains we make in increasing DSP wages are quickly eroded by raising health insurance costs, utilities, transportation, and automatic annual increases in the state minimum wage. We support those wage increases, but provider reimbursement rates have not kept pace with those structural cost drivers. I also want to highlight the long-standing issue of DSS room and board rates. The rates have remained stagnant for decades and no longer reflect the true cost of housing, food, and utilities. As inflation impacts everyday expenses, this gap becomes increasingly unsustainable for many residential providers. When positions go unfilled or costs outpace funding, individuals experience service disruptions, and families, many of whom are aging caregivers, bear the stress. We respectfully ask that you continue protecting DDS funding, prioritize workforce stabilization, address room and board rate adequacy so providers continue to provide safe, person-centered services. Thank you for your continued leadership and your continued commitment to the people that we serve. Thanks for having me today.
Thank you very much, Mr. Zingler. We appreciate your time and your work today
Thank you.
and all the days. Next up, we have Adriana Ramirez.
Good afternoon, Senator Austin, Representative Walker, and distinguished members of the Appropriations Committee. My name is Adriana Ramirez, and I am a member of the DDS Council on Developmental Services. Thank you for the opportunity to speak today regarding the FY27 budget. The Council represents individuals with intellectual and developmental disabilities, their families, and the provider community that supports them. We appreciate the Governor's proposal to preserve the funding increases included in the enacted FY27 budget. Maintaining these investments is critical to stabilizing a system that remains under significant pressure. Connecticut's community provider network continues to face an unprecedented workforce crisis. Direct support professionals are the backbone of services, yet providers struggle daily with recruitment, retention due to wage competition in retail, healthcare, and other sectors. Although recent rate increases have helped, the intended direct support professionals' minimum wage differential is steadily eroding due to rising operating costs and mandated state minimum wage increases. As the general minimum wage rises, the gap between entry-level retail jobs and the highly skilled, high-responsibility work of direct support professionals continues to shrink. For individuals and families, this instability has real consequences: fewer opportunities for community engagement, limited employment supports, delayed residential placements, and increased stress on aging caregivers. We also urge careful consideration of the proposed phase out of the Community First Choice program. Many individuals rely on self-directed supports to remain independent in their homes. Any transition must protect continuity of care, preserve individual choice, and prevent service gaps. We appreciate the Governor's support for dental anesthesiology services within DDS clinics, ensuring access to essential care. We also encourage continued investment in competitive integrated employment initiatives and housing resources, including the DDS Rental Assistance Program vouchers. Employment and housing are foundational to dignity, independence, and full community inclusion. In addition, we respectfully highlight 3 points presented at Wednesday's information session with the Human Services Committee. SSI and Medicaid alignment. Connecticut ranks last in Medicaid asset limits. Aligning the limit with SSI, improving access to MedConnect, and fully implementing Connecticut's ABLE provisions will better support families pursuing employment and financial stability. Public safety, expanding the linked autism safety project statewide, and ensuring equitable distribution of the Yellow Envelope program. Transportation, reliable transportation is essential to sustaining employment. Inconsistent routes and limited service hours continue to jeopardize jobs for individuals with IDD. Practical low or no-cost regional solutions should be prioritized as recommended by the recent Department of Transportation study. As you deliberate the FY27 budget, we respectfully ask that you protect and maintain the enacted DDS rate increases, continue efforts towards long-term workforce stabilization, ensure that any Medicaid or waiver changes protect service continuity and individual choice, and support housing and employment investments that promote full community inclusion. Connecticut has long been a national leader in supporting people with individual and developmental disabilities. Thank you so much for allowing me to present today, and you will have a copy of our presentation from Wednesday. Thank you.
Thank you so much for being with us and for your good work. Next, we have Jennifer Chadukowicz. Did I get that right?
Yes, you did, Representative Vahey. So thank you so much. Good afternoon, Acting Chair Vahey and other members of the Appropriations Committee. My name is Jennifer Chadukowicz. I'm Chief Strategy Officer at SCAD, the Southeastern Council on Alcoholism and Drug Dependence, in its 60th year. And each year we serve more than 5,000 people across Connecticut living with substance use disorder, a chronic but treatable condition. We provide a full continuum of care with 165 residential beds, soon to be 177, including detox, high and low intensity residential treatment, a trauma treatment track, recovery housing, medically enhanced recovery housing, licensed methadone and medication assisted recovery, hepatitis C curative treatment, outpatient, inpatient, intensive outpatient services, recovery coaching, employment supports, primary care, nursing services, family therapy, and reentry case management. We also employ, very importantly, 225 residents of Eastern Connecticut in our agencies, which reside in Lebanon, Norwich, and New London. Having begun my own recovery in 1988, I am proud to be from Connecticut. DEMAS has long been at the forefront of innovative recovery services. Much of the literature cited nationwide and many SAMHSA initiatives were shaped right here in Connecticut by scientists and people with lived experience. SCAD continues that legacy, implementing DEMAS-funded programs and piloting new pathways to recovery ourselves. But additional funding is critical right now. In the last fiscal year alone, SCAD's food costs increased by more than $90,000, a 7% jump. These essential expenses are largely not covered by Medicaid. That increase outpaced general inflation and the nonprofit rate adjustment made last year, widening the gap between real operating costs and DEMAS funding levels. Increasing funding for community nonprofits by $155 million in fiscal year 27 would allow organizations just like SCAD to sustain and strengthen services that are not reimbursed but are essential to lasting recovery. It would allow us to pay wages that reflect the intensity and value of the work our staff provide. During this recent storm, many of our employees voluntarily slept overnight in offices to ensure people in crisis were safe and cared for. That level of commitment deserves stability and investment. With adequate funding, we can continue delivering care that truly meets people where they are, grounded in science, innovation, compassion, and lived experience, while absorbing rising operational costs within residential settings. At the same time, we are navigating significant uncertainty around federal funding, both for services and for the workforce that delivers them. Strengthening state investment now is not simply supportive, it will stabilize Connecticut's entire behavioral health system. Connecticut has long charted its own path. With bipartisan support from this committee in particular, we can ensure that even if the safety net stretches, it does not break. Please support increasing funding for community nonprofits by $155 million in fiscal year 27. Thank you so much.
Thank you. Thank you. Perfect timing. Thanks for being here with us today and your good work. Next, we have Sharon Tierney.
Good afternoon, Madam Chair, Senators, Representatives, and members of the Appropriations Committee. My name is Sharon Tierney. My son is supported via a residential and employment waiver through Horizons. In the spirit of paying it forward, I'm here to advocate for all other individuals who cannot. I truly appreciate the significant funding increases that the governor and legislature have approved in recent years, and also the increases included in the enacted budget for fiscal year 27. Nonprofits have benefited greatly from the bipartisan support of the members of this committee. I do know that our great work of advocacy is never finished, and Connecticut has the financial ability to fund and strengthen nonprofit services. Last year, the budget increased DDS rates, but provided a disproportionately large increase for residential services in both fiscal years. Our budget requests an equal rate increase, including day and employment services at DDS, and an increase to DDS room and board rates. Please increase funding for vital nonprofit programs like Horizons by $155 million in fiscal year 27, so a greater number of individuals can be served with meaningful programming and staff can then be paid a living wage greater than $19 an hour. Staff turnover is significant. My son must have a consistency to thrive and an appropriate trained qualified staff to implement his individual program. Our loved ones succeed when their individual programs work, and the program only works when they have trained qualified staff. Unfortunately, the cost of waiting over the years is greater than the funding, as nonprofits are still catching up from years in past of cost of living adjustments. Nonprofits like Horizons are facing unprecedented uncertainty in regard to federal funding for services and supports for whom they critically serve. Year over year, we testify many underserved individuals are still waiting for critical services like employment, residential, and day programs, but nonprofits cannot provide these services due to the lack of proper funding. Families and nonprofits can't do this alone. It takes a village. We need you. Nonprofits need funding at today's cost of living to implement individual programs so our loved ones can succeed and have a chance at a quality of life at home and in the community. Horizons continues to have to reimagine their strategic plan to serve and provide. This is resilience, but it is not sustainable. With equal rate increases, Horizons will be able to critically serve more individuals with greater needs and positively impact more lives. I know the appropriations can do their part, so please kindly approve increased funding for our community nonprofits by $155 million in fiscal year 27 and join the power of the positive people who are doing great work in our communities. Thank you so much for the opportunity to testify.
Thank you so much for being here with us today, Ms. Tierney. Next, we
welcome.
have Rebecca Allen.
Good afternoon, Madam Chair and members of the Appropriations Committee. My name is Rebecca Allen. I am a registered voter in Columbia and the Director of Recovery Advocacy for the Connecticut Community for Addiction Recovery. I'm also a woman in long-term recovery, and for me, that means it's been over 28 years since the last time I used heroin. I've already submitted written testimony, so I want to use my 3 minutes to talk about something we don't measure in spreadsheets. The recovery community in Connecticut is powerful, it is resilient, it is working, and yet it's largely unseen. When people think about substance use disorder, they picture crisis. They picture an overdose, they picture emergency rooms and incarceration. And yes, those things can happen, but what they don't picture is the thousands of people who quietly rebuilt their lives. They don't picture the parent who regained custody, the employee who shows up every day, the small business owner in long-term recovery, or the recovery coach sitting beside someone in an emergency department. We are not broken people being managed. We are capable people rebuilding. In fact, CCAR was founded in 1998 by people in recovery because there was little to no representation of recovery at the state level, nor any community-based recovery support services. Today, we operate 8 recovery community centers across the state, spaces where recovery is visible, is normalized, and is celebrated. Last year alone, our recovery coaches supported more than 6,000 individuals, and our centers welcomed more than 23,000 visitors. That is not a small fringe population. That is community. But here's the problem. When recovery works, it becomes invisible. Recovery success doesn't make headlines, failure does. And because recovery is unseen, it is often underfunded. We're asking for $1 million increase in state funding to DEMIS for recovery coaching and recovery community centers, not to create something new, but to sustain and strengthen what is already working. For every $1 invested, the state saves between $4 and $7 in healthcare and criminal justice costs. That matters, but here's what matters more. You cannot budget for hope if you refuse to see the people who carry it. The recovery community is not small, it is not fragile, and it is not failing. It's working quietly, powerfully every single day. We're your neighbors. We are your workforce. We are raising children, paying taxes, running businesses, and mentoring the next person who thinks they are beyond help. We are not damaged. We are disciplined, we are resilient, and we are proof that recovery works. The question is whether the state of Connecticut will fully see it and invest in it. Because when you invest in recovery, you are not funding a program, you are funding people, and we're worth it. Thank you for your leadership and your commitment to the well-being of our state.
Thank you for your power and effectiveness. Thank you, Ms. Allen. Next, we have Alex Duarte.
Good afternoon, Senator Austin, Representative Walker, and honorable members of the Appropriations Committee. My name is Alex Duarte, and I'm an epidemiologist too with the Connecticut Department of Public Health and the Health Statistics and Surveillance Branch, where I've worked in the survey unit for the past year. During that time, I've watched our office and our department struggle to keep up with growing demands because of a shrinking workforce. Our unit is responsible for reviewing and analyzing data from two major surveillance systems, the Behavioral Risk Factors Surveillance System Survey and the Youth Risk Behavior Surveillance System Survey, known in Connecticut as the Connecticut Schoolhouse Survey. These surveys are essential to understanding the health of our population. The Behavioral Risk Factors Surveillance System Survey is conducted annually across all states. It collects critical information on mental health, physical health, disability, obesity risk, insurance coverage, and chronic conditions such as high blood pressure and diabetes, just to name a few. This data provides one of the most comprehensive pictures of overall health trends, allowing us to monitor changes and identify emerging risk across our state. The Connecticut Schoolhouse Survey is conducted every other year in partnership with school systems and focuses on students in 8th grade through high school. It helps us understand the health and well-being of our youth, tracking issues such as mental health challenges, body image concerns, and self-esteem. This information is vital for identifying trends early and responding before small problems become larger public health crises. Despite the importance of this work, my unit consists of only 2 people, my supervisor and me. There are no other epidemiologists on our team. That means a tremendous amount of responsibility rests on just the 2 of us. When we are overwhelmed or unavailable, critical data simply waits to be processed. But health data is not something we can wait for. When trends begin to shift, when a community starts to show signs of worsening health outcomes, that information must be analyzed quickly so leaders can respond appropriately. Timely data allows government to act, prevent harm, and locate resources where they are most needed. Without trained professionals to analyze and interpret that data, opportunities to intervene early can be lost. Additional staffing in our unit is essential so we can process this information efficiently and responsibly. And this challenge is not unique to our team. It reflects a broader need across the Department of Public Health. Surveillance, monitoring, and data analysis must happen consistently and promptly to protect the health of residents across Connecticut. Providing additional funding for DPH is critical. We must make these public health positions competitive with the private sector so we can recruit and retain skilled professionals. That means offering salaries that reflect the value and expertise required for this work. It also means expanding staffing across units so we can keep pace with increasing demands, evolving health threats, and rapidly changing world. Because waiting comes with consequences, we never know when the next outbreak or the next pandemic will emerge. If we are not prepared, if we do not have the workforce and resources in place, it may be too late to respond effectively. Thank you.
Thank you very much, Alex, for your work in public health. We appreciate it. Next, we have Meg Gorman.
Hello, everyone. My name is Megan Gorman. I am the Government Relations Coordinator for CMHA, Community Mental Health Affiliates. I am here today to speak in regards to the biennium budget where it concerns funding for nonprofit health and human services. My agency is a very large behavioral health provider that serves over 7,500 individuals from across the state. And last I checked, we serve at least one individual from all 169 towns and municipalities. So that does include each and every one of your constituents in that way. While my organization and many nonprofits who are also going to be speaking today can say that we are glad for the modest funding increases that were approved in recent years, we do need to acknowledge the longstanding reality here that despite any current or recent adjustments, they do not overall compensate for the chronic and persistent underfunding that critical nonprofit behavioral health services in particular have experienced these past years. Bottom line, I urge the committee to approve the increase in funding for vital nonprofit providers in the amount of $155 million in fiscal year 27. And to state it plainly, it's people's lives and livelihood that are at stake. I encourage you all to please read the submitted written testimony by our agency's president and CEO, Grace Cavallo. We go into specific details, some of which I'll share here, about how the continued underfunding will only inevitably worsen the problems that we're already seeing in the behavioral health and the nonprofit world, and that we have a unique opportunity now with the funding climate, what it is, to correct it and make long-term stabilizing changes. as a nonprofit health organization, we have done all that we can to stabilize our funding through any means possible. In addition to the state contracts that we have with the Department of Mental Health and Addiction Services, DCF, or state programs or agencies that we can get small grant funding for, overall, federal funding has been historically a very stable source of funding for organizations like ours. However, the federal funding climate is unprecedented. Has become my least favorite word these past few months, but it goes to show that unprecedented cause for unprecedented changes. Some of the specific issues that nonprofits like us continue to have are considerable workforce shortages. That remains a critical issue. We can only do so much on our own to address the skyrocketing insurance costs as well as inflation and related expenditures. We have had to cap admissions to many of our programs and reduce consensus in that way. I also wanted to remind all of you that as an LMHA, a local mental health authority, my organization is responsible for serving those individuals who would go without care. There's no other way to put it. These individuals don't have access to services outside of organizations like us. And we continue to do all we can to serve them, but we have had to make incredibly hard decisions about capping our programs and services because we simply are not paid enough to provide the
Thank you.
services.
Ms.
Apologies, I
Thornton.
don't have a timer. I couldn't hear, but I thank you all for listening to my testimony today, and I encourage you to improve and increase funding for nonprofits. Thank you.
Thank you for being with us today and all your good work. Next, we have Karen Healy.
Hi, good afternoon. My name is Karen Healy. I'm a consumer out in the community. I live in Hartford, Connecticut. I'm a voter and I do a lot of testimonies every year. This is my third one since last week that I'm testifying, and I love in my behalf to do this. I do it for myself and I do to speak up for others who cannot speak up for themselves. I have at my own unit where I live in my own place in Hartford. I have a wall with 3 citations to legislators from the legislative building. I have a hard copy for Governor Lamont for being appointed by him for the DD Council of Developmental Disability. I had 3 plaques also from the Keep the Promise Coalition, and article that I was just put in 9 newspapers locally in the Hearst newspaper by being interviewed after doing a conference with Rosa DeLira about over a month and a half ago. I'm in a program. I have 24/7, well, how do you say it? 24/7 staffing. My program is granted by Demas. I was an patient at CVH a couple times in Middletown, Connecticut. Before I moved to Connecticut, I lived in Poughkeepsie, New York. So in August of 1989, basically into December 4th of 2014, when I was discharged from Connecticut Valley Hospital, I was institutionalized in state hospitals almost half of my life. I didn't learn how to do certain things. I didn't know how to use a phone. I didn't know how to cook. I didn't know other things. So I was discharged December 4th of 2014, 11:33 a.m. I signed my discharge papers that Thursday. The really messed up crazy part, as I was walking out my unit to go downstairs to leave for the rest of my leave, I had 3 people in the hallway saying to me, Karen, you'll be back in a week and a half. 2 weeks later, but guess what? I have never, ever been threatened or seen anybody or gone back to CVH. I've had a couple of admissions since I've been out at the Institute of Living. The last admission of inpatient or for anything was July 4th of 2018. After I lost my mom, I did something to myself that I regretted. It would never happen again. Having my program means the world to me, because if Demas didn't get me out and my mom didn't help fire an attorney, 11 and a half years later, I could still maybe sitting at CVH on either Battelle 3 South or Battelle 3 North, where you did nothing. You just sat there in a day room, listening to people bash you and make fun of you, from staff to clinical people into nursing and other people. So astounded from head to toe that I'll succeed because of my long history of inflicting harm to my own self. Guess what? I showed the whole entire Connecticut. I showed Demas. I showed the CEO of other places, the CVH, and some people from Connecticut and Demas. So I really think it's very important to have people with opportunities like me who've been told they'll never make it, have a grant to be out in the community, because it's so much easier to take care of us out here than to spend almost $2,000 a day, or maybe it's even more now, to have one day sitting on a unit where you get no freedom, no life, and no nothing. So when I was at CVH the first time, because I did something really bad to myself, I could not see the outside. I did not go outside except I had a medical appointment. I saw those 80
Really?
screen windows. Thank you.
Thank you so much for being here to share your experience. We're so glad you're here. Thank you for
Thank
taking the
you.
time today.
Bye-bye.
Next, we have Dr. Vincent Mace.
Hi, thank you for letting me speak today. Good afternoon, chairpersons and members of the committee. My name is Dr. Vincent Mace. I'm a thoracic surgeon and the Division of Thoracic Surgery at Yale and Chief of Thoracic Surgery at Bridgeport Hospital. Thank you for the opportunity to speak. I'm here to support continued funding for lung cancer screening. I treat lung cancer every day. When we catch it early, I operate and patients go home cured. When we don't, I sit with families and explain why surgery is no longer an option. The difference between those two outcomes is often lung cancer screening. Recently, I treated a 64-year-old woman whose cancer was found through these routine lung cancer screenings. She had no symptoms. The tumor was small. It was early stage. I performed a lobectomy and she recovered and is now cancer-free. That's exactly what screening is designed to do. In contrast, I cared for a 56-year-old man who qualified for screening but was never screened. By the time he developed symptoms and came to me, the cancer had already spread beyond surgical cure. He died, unfortunately, from his disease. The difference between those two patients wasn't biology, it was timing and it was access. In the past 5 years in the Bridgeport area alone, our screening program has detected 90 lung cancers. Many of those were early stage and surgically curable. That's 90 opportunities to intervene and before metastatic disease. I also practice in a community with real racial and socioeconomic disparities. Black patients and patients in underserved communities are more likely to be diagnosed at a later stage. They are less likely to receive screening and are more likely to present when surgery is no longer possible. Screening is one of the few tools we have with regards to lung cancer that actively reduces that disparity. This is also a fiscal issue. Treating early stage lung cancer with surgery is far less costly than years of immunotherapy, radiation, hospitalizations, and end-of-life care. Early detection saves lives and it reduces long-term healthcare spending, including Medicaid costs. The infrastructure that the Department of Public Health has built is working. We are seeing results. Now is not the time to slow down. Continued funding means more early-stage disease diagnosis, fewer disparities, and more Connecticut residents alive and productive. As a surgeon, I would much rather remove a small tumor than tell a family and the patient there's nothing I can do. Thank you very much for your time.
Thank you for your work and for being here to advocate today. Next, we have Chris McNabo. Not sure if I said that right. Welcome.
Thank you very much. Good afternoon, members of the Appropriations Committee. My name is Chris McNabo, CEO and founder of Horizons. We are in our 47th year and serve over 1,600 people statewide. We employ 270 year-round staff and an additional 130 seasonal staff. Thank you for the increases included in the enacted budget for FY27. We've been able to hire a few additional people over the previous years, and I have to say, we've also been quicker to let people go if they're not working out. The quality of candidates we get continue to overall be less capable to do the work we do in our agency than pre-pandemic. The workforce has changed. We're digging out of a 25-year period of chronic underfunding and need more funding. We do charitable work, but we must operate as a business. We cannot fundraise, have tag sales or bake sales to pay for our operation. That, frankly, is the job of state tax dollars. When the state ran these services, they were compensated fairly. We need the same treatment. My staff need to rent apartments that cost at a minimum of $1,400 a month without utilities for a one-bedroom, pay car payments of $400 or $500 a month so they have reliable transportation, and pay for groceries. A wage of $19.50 after taxes is about $580 a week, and it does not cover that. About a quarter of our staff have second and third jobs to try to make ends meet. Last year, there were large increases for residential services in both fiscal years. This creates a dilemma for agencies like Horizons, who offer both residential and day services, sometimes sharing staff between both. The proposed budget request provides an equal rate increase to all health and human services and an increase to the DDS room and board rates, which are some of the lowest rates in the nation. I have to say no 4 to 6 times each month to parents, grandparents, and siblings seeking residential day or employment services. Some of these families are at the end of their time on earth to care for their family member. Our waiting list continues to grow, and realistically, we do not believe we will be able to support many of the individuals currently waiting. We're funded about 32% less than we were in 2007. What other businesses that are still in business can operate at that kind of a loss? Financial support like the state nonprofit support bond program is much needed now. Please don't look at one or two flawed bond projects and paint us all with the same brush. Horizons has an excellent track record with previous bond programs, always shovel ready, completed on time, and with the paperwork to prove it. We are the safety net for Connecticut citizens with family members who have developmental disabilities, and the nonprofit bond fund is a wise and beneficial investment. Please support increasing funding for our community nonprofits by $155 million in FY, and thank you very much.
Thank you very much for your work and being with us today.
Thank you.
Next, we have Magaga Mbabali. Now, please tell me if I got that right.
Oh, you got it right. Spot on. Thank you. Good afternoon, Madam Chair, members of the committee. My name is Mugaga Mbabali, clinical behaviorist working with Horizons Programs, Inc., supporting individuals with intellectual and developmental disabilities. Every day, I witness moments that most people never see, moments where someone with an intellectual or developmental disability is trying their absolute best to navigate a world that wasn't built with them in mind. And I witnessed the staff who stand beside them, steadying them, believing in them, and helping them feel safe enough to try again. There's one moment I can't forget. A young man I support, someone with a long trauma history, was having a really hard day. He was overwhelmed, scared, and on the edge of shattering down. His breathing was fast, his hands were shaking, and he kept saying, "I don't know what to do." What changed everything was not a crisis team, not a restraint, not medication. It was one staff member, someone who knew them, someone who had been trained, someone who had stayed long enough to earn his trust. She sat beside him quietly and said, "You are not alone. I'm right here with you. We will get through this together." And he believed her. His breathing slowed, his shoulders dropped, he found his way back. That moment of safety, of dignity was possible because that staff was supported, trained, and able to stay in this field. But we are losing people like her every day, not because they don't care, but because they cannot afford to keep doing this work. When staff leave, the people who support feel it immediately. They lose their familiar faces that help them feel safe. They lose the relationships that help them grow. And the progress they've fought so hard for can disappear just overnight. Granting funding would mean something very simple, but very powerful. Opening up the bond fund would go a long way. People with disabilities would not have to rebuild their lives every time a staff member leaves. Think about that. Thank you for listening.
Thank you for your powerful testimony and for being here today. Next, we have Stacy Charpentier.
Good afternoon, Madam Chair and members of the Appropriations Committee. My name is Stacy Charpentier. I live in Bristol and am honored to serve as the Executive Director of the Connecticut Community for Addiction Recovery, otherwise known as CCAR. I did not come into this field as a professional. I came into it as a family member. Addiction entered my family long before I ever held this title. Loving someone through addiction brought fear, unpredictability, and trauma. I've experienced my own anxiety because of it, and the mental health toll on families is real, and it lingers long after the crisis moment has passed. Last July 4th weekend, addiction came for my family again. My husband's cousins, Justin and Danielle, overdosed within hours of each other. Danielle survived barely, and Justin did not. Justin was the same age as my daughter at the time, just 23. The holiday will never feel the same, and I will never forget standing with a family member burying someone who should have had decades more of life ahead of him. Danielle is alive today, working a program because someone met her without judgment, because support was there when she was ready to accept it. That is what recovery support services do. They keep people alive long enough for recovery to take hold. At CCAR, we operate 8 recovery community centers across Connecticut. We provide recovery coaching in all 32 emergency departments and within Department of Correction. No appointment is required, and if we're not the right resource, we provide a warm handoff to someone who is. Every day we meet individuals facing housing instability, unemployment, untreated mental health challenges, and stigma. Recovery is hard enough without those barriers, and yet we walk alongside people anyway. But we cannot sustain this work without investing in the workforce. These roles require training, professionalism, boundaries, resilience, and immense emotional labor. If we want recovery support to remain accessible statewide, we must fund it accordingly. So I'm here to implore you, please increase funding for DEMIS so they can continue to fund the vital recovery support services Connecticut residents deserve access to. And I will close with this. Addiction does not discriminate. It impacts families like mine and families in every district represented in this room. So when you review the appropriations, I ask you to see what they truly represent. They are not line items, they are lifelines. And sometimes they're the difference between recovery and a eulogy. Thank you.
Thank you so much, Stacy, for your important work and being with us today. Next up,
Thank you.
we have Stacy Lawton.
Good afternoon, distinguished members of the Appropriations Committee. First, my apologies that my camera is not working. Are you able to hear me okay?
Yes, we can. I was just
Okay.
going to ask if you were able to turn your camera on, but we would
I
love to
do-
hear from you.
I apologize. I have tried for the last 15 minutes and cannot get it to work. So we're going to go with what technology has dealt us for the day. My name is Stacy Lawton. I have the privilege of serving as the Chief Executive Officer for the Southeastern Council on Alcoholism and Drug Dependence, more commonly known as SCAD. And I have been in this work for 32 years, with the most recent as CEO for the last 6. SCAD is a nonprofit agency that provides mental health and substance use treatment to individuals who may not be able to afford treatment otherwise. Altogether, our agency provides 176 residential treatment beds, outpatient services, community outreach and education, medication-assisted treatment, primary care, recovery housing, and treatment for hepatitis C. Altogether, we provide services to about 5,000 people each year. Thank you for the opportunity to testify on House Bill 5032. I want to begin by expressing my sincere gratitude for your leadership and your commitment last year in securing increased funding for our sector. Your efforts were not symbolic, they made a real difference. They sent a message that the work of community-based nonprofits matters and that the people that we serve matter. For that, we are really thankful. And yet, despite these efforts, we are still operating at a significant disadvantage. The purchasing power of nonprofit providers remains at approximately 30% behind where it was 20 years ago. Even with recent increases, we have not caught up to inflation, rising operational costs, and the evolving demands of the populations that we serve. We are working harder than ever with resources that continue to shrink. There are many examples of the rising costs. You've heard a lot of them today. Utilities, insurance, transportation, food, technology, compliance requirements. But today I want to focus my appeal on one issue above all others, and it's been a recurring theme with the first 15 speakers: staffing. Our workforce is the backbone of our mission. Without qualified, compassionate professionals, we cannot deliver safe and effective care. And right now, we're struggling to recruit and retain the people that our very communities depend on. We're competing directly with hospitals, state agencies, and private practices for talent. These organizations are able to offer salaries, signing bonuses, tuition assistance programs, and benefit package that nonprofits simply cannot match under current reimbursement rates. When a nurse, a clinician, an APRN, or a physician can earn significantly more elsewhere, it becomes extraordinarily difficult to ask them to choose community-based care, even when their hearts are in it. The challenges exist at every level of our workforce. At the entry level, rising minimum wages in Connecticut have had an unintended consequence. While we support fair wages, state reimbursement structures have not kept pace. Positions that once offered a meaningful step above minimum wage now barely compete with retail or warehouse jobs that carry far less responsibility and emotional burden. We are asking individuals to take on high-stress, safety-sensitive roles serving vulnerable people for wages that they could earn if they worked at Target. At the professional level, the gap widens even further. We need nurses, licensed clinicians, APRNs, and physicians. These professionals carry enormous responsibility. They assess suicide risk. They manage complex psychiatric and medical conditions. They de-escalate crisis, and they make life-altering decisions every single day. And yet we're losing them to systems that can pay tens of thousands of dollars or more annually. The stakes could not be higher. The individuals that we serve are often facing profound life challenges, serious mental illness, substance use disorders, trauma, homelessness, and co-occurring medical conditions. Without timely, quality care, many are at risk for harming themselves or others. When we cannot adequately staff our programs, wait lists grow, crises escalate, emergency rooms fill up, and law enforcement becomes the default responder. Underfunded community care does not save money. It shifts costs to more expensive and less effective parts of our system. We are not asking for excess. We are not asking for excess. We are asking for sustainability. We are asking for the ability to offer competitive wages that reflect the skill, dedication, and responsibility that this work requires. We're asking for funding that keeps pace with the economic reality so that we can stabilize and strengthen the workforce that holds our safety net together. Last year, you demonstrated your commitment. Today, I'm asking you to build on that progress. Help us close that 30% gap. Help us to invest in the people who care for our most vulnerable neighbors. And help us to ensure that community-based nonprofits remain strong, reliable partners in protecting the health and safety of our state. Please support increasing the community nonprofits by $155 million in fiscal year 27. Thank you for your leadership and for your continued partnership in this critical work.
Thank you, Ms. Lawton, for being here and for the work you do daily. Next, we have Beth Chudnow.
Good afternoon. It's so nice to see all of you representatives and senators on this Zoom meeting. And I want to introduce myself. I'm Beth Chudnow. I live in Tallinn, and I'm a mother, a wife of David. We have 3 children. Our oldest is 49 years old and is severely handicapped. He lives in an Oak Hill group home. I also serve on Oak Hill's board. I want to talk to you about staff because the funding that we're asking for is all about them. I can tell you on a day-to-day basis what happens in his home and how he's cared for. He is wheelchair-bound, nonverbal, and requires 24/7 round-the-clock care. He can do nothing for himself. If he was left alone, he would die of starvation, of just not being able to survive. He cannot care for himself. And the work I see the direct care staff giving is absolutely amazing. And as some people have spoken about, I am one of those aging members of our society. David and I'm 75, David's 77. We cannot care for him ourselves. I can't lift him. He is, as I said, in a wheelchair. What staff does every day is they get him out of bed by supporting him, helping him lift himself up, pivoting him, helping him to get into his wheelchair, pushing the wheelchair into the bathroom, helping him transfer from his wheelchair onto the commode, taking him and showering him, washing his body, brushing his teeth. They do everything, and yet they still find time for him on a daily basis to offer him smiles and happiness and put his music on that he loves. And they make him a cup of afternoon tea every day because it's such a fond part of his day. I cannot tell you how wonderful they are and giving. It takes such an amazingly special person to do this kind of work. I want to see them be able to support themselves and their children. I want them to have winter coats for the kind of winter we've had and a roof over their head, meals that they can put on the table as well, because their care is giving, loving, nonstop. And I invite any one of you sincerely to come and visit my son to see what a group home is like in practice. It's one thing to say it's a group home. It's another thing to be inside and see what a family it is. It's our extended family. It allows my husband and I to have a fulfilling life and to know that our son is lovingly cared for. Thank you very much for your time today.
Thank you for coming and sharing your experience with us. Next, we have Sarah Fox.
Good afternoon, Senator Austin, Representative Walker, members of the Appropriations Committee. So happy to be here with you today. My name is Sarah Fox. I'm the Chief Executive Officer of the Connecticut Coalition to End Homelessness. Through the Connecticut Can End Homelessness campaign, we work alongside the coordinated access networks, outreach teams, providers, municipalities, hospitals, and state partners in every region of the state. And I really appreciate this opportunity to testify. As you know, right now, we are in the middle of a blizzard. Across Connecticut, our outreach teams and providers are making rapid, high-stakes decisions because when you are outside, the cold is not an inconvenience. It is a countdown. It is life or death. It comes down to pure risk management, locating people fast, getting them into safety, preventing a night outside, which could be a medical emergency. This is the clearest reminder to me of why our investments in outreach, crisis response, and supportive services are such a life-saving infrastructure. And the need is accelerating. We have seen an unprecedented increase in unsheltered homelessness, with a 45% increase this past year alone. Since 2020, it has been a 156% increase in people who are outside in tents across the state sleeping outdoors. And what this means is that we have people outside for long periods of time who have high levels of acuity. And that's why this falls straight in Demas's lane, and why all of the investments that we are asking for through the Connecticut Can End Homelessness campaign to prevent, respond, and house our neighbors are so critical. Unsheltered homelessness is not a housing problem. It's a behavioral health destabilizer. What we see is oftentimes people will say the unsheltered population, their acuity is increasing. What we know is that when you are outside, when you are unsheltered, the things that you're dealing with are so traumatic. It is destabilizing. It is dangerous. It is unhealthy. And yet we expect people to be able to turn their lives around. What people need is intensive case management, strong outreach, and the connections to be able to come inside. And so much of that we know is that this isn't about people who are lazy. It's not about people who are not willing to make it work. A lot of this is also a lack of affordability problem. Housing costs are far outpacing our ability to house our unsheltered neighbors. And so when the housing costs rise, it becomes near impossible to move people out of shelter and into housing. So what you're seeing on the ground across the state is you're seeing long lines to get into shelters. You're seeing people piling up on the waiting list, and you're seeing very few exits out of our shelter. And it's not because the system doesn't work. The system does work. What we do not have is the ability to keep pace with the level of need that's before us today. And so what we're asking for is plain and simple. It's investments. It's investments in outreach to the level of scale of the individuals who need to be connected to people who care, who are the helpers, who are out there helping people navigate to critical appointments, helping build rapport so that they trust to come inside, and connecting them to the housing resources at the other end of the housing spectrum. That takes work. It takes dedicated professionals, and Demas, through their work over the past decade, has really proven that with housing and supports, we can stabilize our neighbors. We also know that case management is critical. So housing focused and centered case management, it saves lives and it keeps people housed. So when people have housing and they have the right supports, they stay housed. And in a time like this, with increasing federal uncertainty, when we know that perhaps.
Thank you, Sarah.
Well, thanks so much for having me, and
There's-
just let's continue to prevent, respond, and house our neighbors across the state, and please ensure these investments.
Thank you for your work, especially on a day like today. We're thinking about you and all the people who are in the cold.
Thank you.
Next, we have Jim Williams.
Yes, good afternoon. My name is Jim Williams. I'm the Government Relations Director for the American Heart Association, and I would like to thank the leadership and members of the Appropriations Committee for providing me with the opportunity to provide brief comments today on House Bill 5032, which contains $12 million in tobacco control funding. We support this continued amount of funding as it continues to get us closer to the current CDC recommendation for Connecticut, which is that the state spend $32 million annually on its tobacco education, prevention, and cessation efforts. As many of you might be aware, Connecticut spent $0 on tobacco control between 2016 and 2021. Then in 2022 and again in 2023, Connecticut invested $12 million. This funding was then paused in 2024, but restored in 2025. The governor's most recent proposed budget, this bill, includes the $12 million in annual funding. The CDC currently recommends that Connecticut spend $32 million annually on tobacco control, which is what we are advocating for today. This increase is sorely needed to combat the impact of tobacco industry marketing in Connecticut, which is over $57 million annually. Please keep in mind that Connecticut receives annually more than $400 million from the multi-state master settlement and from tobacco sales revenue. State tobacco prevention and cessation programs save states money. Here are some examples. States that offer comprehensive smoking cessation therapy to their employees in their public health programs or in their tobacco control programs can save $1.10 to $1.40 on healthcare expenditures and productivity for every dollar spent. It has been proven that cost savings are the result from established state tobacco prevention and cessation programs. A recent American Journal of Public Health study found that for every dollar spent by Washington State's tobacco prevention and control program between 2000 and 2009, more than $5 were saved by reducing hospitalizations for heart disease, stroke, respiratory disease, and cancer caused by tobacco use. A 2013 study published in PLOS One found that between 1989 and 2008, California's tobacco control program reduced healthcare costs by $134 billion, far more than the $2.4 billion that they spent on the program. Researchers attribute these savings to reductions in smoking rates and cigarette consumption per smoker, generating significant savings in healthcare expenditures. Finally, a study of Arizona's tobacco prevention program found that the cumulative effect of the program was savings of $2.3 billion between 1996 and 2004, which amounted to 10 times the cost of the program over the same period of time. The financial burden of tobacco use in Connecticut: $2.36 billion annual healthcare costs in Connecticut directly caused by smoking. Over $559 million is covered by the state Medicaid program. $1,005 is the amount that each household for residents' state and federal tax burden from smoking caused government expenditures, and smoking caused productivity loss in Connecticut is $3.5 billion annually. We know that tobacco control
Thank you,
saves
Mr.
lives
Williams.
and money. Thank you for your support.
Thank you so much for your ongoing advocacy and being here with us today.
You're welcome.
Next, we have Janet Stolfi Alfano.
Good afternoon, members of the Appropriations Committee. My name is Janet Stolfi Alfano. I'm the Chief Executive Officer of the Diaper Bank of Connecticut. I'm here today to urge your strong support for the continuation of funding for the Department of Public Health's Menstrual Equity Grant Program. This vital program is a critical component of upholding Connecticut's menstrual equity law and ensuring that period poverty does not remain a barrier to education and health for thousands of our state students, particularly those in the highest need communities. The grant program directly addresses the systemic issue of period poverty, and data indicates that about 1 in 4 students who menstruate struggle to afford period products. a rate that is disproportionately higher in lower income communities, particularly those served by Title I schools. The consequences of this lack of access are severe. Educational loss, missing just 1 day of school per month due to the inability to manage menstruation can result in 2 weeks gap of lost instruction time. Health and dignity, without access to free quality supplies, students resort to unsafe and makeshift alternatives. We have been successful in implementation this program. We started in October of 2024, and we've served over 520 schools, over 112,000 students, and distributed over 5.4 million products to students. Without this grant, many of the schools report that they would not be able to fund complying with this law. And the program has relieved teachers, nurses, and other dedicated staff who have had to purchase these products out of pocket to supply them for the students. Schools have successfully integrated their program, viewing it not just as a commodity, but as a critical component of student health, as well as a learning opportunity. We are looking for, again, the continuation of this program, which ends December 2026. So to continue for the half of year that would be covered under this appropriation budget, we're looking for $325,000 for the half-year period. It's a direct investment in educational equity, public health, as well as student dignity, and ensuring that no student in Connecticut has to choose between their education and their basic health needs. We really urge you to support this program, and thank you for your time and consideration.
Thank you so much. I'm going to, I believe, turn it over now to Representative Dillon, who will
Thank
take.
you very much, Madam Chair.
Thank you, Madam Chair.
Our next speaker is Shruti Shah.
Good afternoon, esteemed committee members. So my name is Shruti Shah. I am a 16-year-old junior at South Windsor High School. I'm here today to represent the Students Against Destructive Decision Club at South Windsor High School, along with the Governor Prevention Partnership's Youth Advisory Board. My testimony today is in favor of Bill HB 5032 and to continue maximizing funding towards drug prevention programs in our state of Connecticut. As a member of my high school's prevention coalition, I have personally seen the damage that drug use can do to students from all walks of life. And parallel to that, the way that prevention work has helped not only those struggling with addiction, but the community as a whole. We've all heard that it takes a village to raise the next generation. Well, prevention work, like what GPP does, is what keeps that village safe for our youth. Outreach and education are the crux of prevention, and for us to keep expanding the number of families, schools, and communities we can help, we need your help. Funding towards prevention programs is imperative to make the execution of our vision, a safer, healthier Connecticut, more efficient. I've seen firsthand at the GPP that this money goes towards creating accessible educational seminars, marketing campaigns, and prevention coalitions across the state. Every one of these programs has the potential of changing an exponential number of lives. Even one conversation with a trusted adult, possibly inspired by one of these programs, can decrease a teen's likelihood of trying drugs or alcohol by 50%. The work that the GPP does, in partnership with the Department of Mental Health and Addiction Services, has made significant progress in the past couple of years. SUDOR's data showed a 21% decrease in overdose deaths in 2025 alone. This is proof that prevention is working, and now is not the time to stop. If connection and outreach are our tools for a better Connecticut today, then prevention work as a whole is a bridge into a better tomorrow. The youth that we are asking you to protect via this funding bill are the leaders of our future. They are people like me, trying to learn more about the dangers of addiction to help make my school and community safer so that I can go after my dreams of becoming a medical professional and continuing to advocate for prevention work. My choice to become involved in prevention work stemmed from the way I saw my peers struggle to chase their dreams because they were held back by drugs or alcohol. So I'm asking you all, as leaders of today, to make that choice. Please vote to continue maximizing funding for prevention programs so that youth like me can focus on the things that actually matter, not drugs. Thank you all for your time, consideration, and commitment to a healthier tomorrow.
Thank you very much for your work. Kellyanne Day.
Good afternoon. Hi, Representative Dillon. It is nice to be here, and thank you to members of the Appropriations Committee. My name is Kellyanne Day. I'm the CEO of New Reach, an organization that's been providing homeless prevention, emergency shelter, and supportive housing since 1990, and I live in New Haven. Thank you for the opportunity to testify today in support of the CT Can End Homelessness 26 legislative agenda, including both the coordinated budget investments and the policy changes needed to prevent and solve homelessness statewide. I also want to support the Connecticut Nonprofit Alliance's request for $155 million for nonprofits. We appreciate that the governor's budget includes investments related to homelessness and housing stability. Specifically, we are grateful for the governor's proposal to include $4.13 million to continue wraparound services for 125 individuals in supportive housing and 24/7 mobile crisis services for adult. Those dollars matter and they reflect recognition of urgency, but they're just the starting point. Most importantly, we know what works to end homelessness in the state of Connecticut. We need to prevent, we need to provide rapid response, and we need to shelter. Please help us do that with a coordinated investment in case management services that support stability, reduce returns to homelessness, and improves health outcomes. We are experiencing a real housing crisis right now. There are few homes for sale. The rental market is tight, therefore the rents are high. And when this happens, our neighbors who are on low incomes or fixed incomes are vulnerable to displacement. And that's exactly what's happening. Rents have increased 75% in the past 10 years. So if you rent, you're in extreme disadvantage. As a provider of homeless prevention and emergency shelter, I can tell you that this is definitely one of the direct causes to our increase of 45% of homelessness since 2021. And as a provider who provides homeless prevention services, I know that investing in prevention works. So our ask for $10 million for Housing Crisis Fund is critical to help people remain stably housed. Without stable housing, people will become homeless. If we invest flexible funding, if we invest in case management services for folks living in supportive housing, and if we invest in the nonprofits who are employing people who are spending so much time, especially as Sarah mentioned, during this blizzard, helping our most vulnerable neighbors to remain housed, to stay housed, and to get shelter. We need your investment. We need you to support nonprofits, and we need you to support the Can End Homelessness Connecticut legislative agenda. So thank you very much for giving me the opportunity to testify today.
Thank you. Karen Nig, did I pronounce that correctly?
It's actually Niag, but did all right.
Karen Niag, I apologize. I knew I had it wrong. Yes.
Thank you for listening with me today, and thank you for being here listening. My name is Karen Niag. I'm a mom of a 29-year-old daughter, Stephanie, who actually is here with me doing some puzzles today. Stephanie is very beautiful, and she is a very complex individual. She's supported with a nonprofit organization, Oak Hill. She equally goes to a Favor Day program. Stephanie's well-being is totally dependent on her caregivers. She lives in a beautiful home. We're in the northwest corner, having a wintry weather. That's why we have Stephanie home with us. I would like to give some ease to the staffings who are probably short-staffed over this holiday, or excuse me, of this blizzard. So Stephanie is here playing with us today. My greatest concern with the house is not how beautiful it is, but how we're going to keep it staffed. Many families like mine are living in constant fear of a system that feels like it's always on the edge of collapsing. And this all has to stem from the budget. The men and women who care for my daughter are dedicated, compassionate, and skilled. They provide not just supervision, but stability, emotional support, medical oversight, and quite incredibly, a sense of family. Yet, despite their central roles, they are among the most lowest paid employees in the state right now. And this simply just is not right. I'm worried that my daughter, Stephanie, is not receiving the level of stimulation she needs to maintain her long-term health. And this is due to the lack, it's not due to the lack of care, it's due to the lack of staffing. They're being overwhelmed, stretched thin, and focus is simply just on getting through the day. When staff are unstable, enrichment, engagements, and meaningful activities are the first thing to disappear, even though they're essential to her physical, emotional, and cognitive well-being. Nonprofit providers are asking additional 155 million from our budget to address the workforce crisis. This is not a luxury or an expansion. It's about sustainability. It's about being able to recruit, retain, and fairly compensate the people who care for the most vulnerable citizens. Our state budget reflects our values, and we truly value individuals with disabilities and the families who love them. We must also value the workforce that makes their lives possible. Thank you for listening with me today.
And thank you very much for the work and for your family. Maritza Bond.
Hi, nice to see you, Representative Dillon. Good afternoon, Senator Austin, Representative Walker, and ranking members and members of the Appropriations Committee. I am here today on behalf of the Connecticut Associations of Directors of Health regarding our fiscal 2027 statutory per capita funding for local health departments. I want to focus on my time on the statutory framework and what the proposed adjustments actually represents. Under the Connecticut General Statutes 19A-202 and 19A-245 per capita grants are established for municipal and district health departments. When statewide appropriations fall short of that statutory level, payments are reduced proportionally. Over the last several years, appropriations have consistently fallen short of that benchmark. Local health departments have absorbed those reductions, even as the scope and complexity of mandated public health responsibilities have continued to increase. The governor's proposed adjustments includes an additional $128,000, bringing the recommendation total to $8,341,658. It is important to be clear about what that actually means. That $128,000 is not program growth. It does not create new services. It does not expand the scope. It simply represents a step toward restoring funding closer to the statutory framework. From our perspective, the recommended total should be understood as stabilization as the minimum necessary to prevent further erosion of statutory public health capacity. Local health departments remain responsible for communicable disease control, environmental health inspections, food safety enforcement, emergency preparedness coordination, lead prevention, and numerous regulatory functions required under the state law. Those responsibilities do not decrease when funding falls short. When per capita funding is reduced, the impact is real. Inspection timelines, enforcement capacity, disease follow-up, and preparedness coordination are directly affected. Public health infrastructure is foundational to the health, safety, and economic stability of our Connecticut communities. As you deliberate on fiscal 2027 appropriations, we respectfully ask that the statutory per capita baseline be maintained so local health departments can continue fulfilling the responsibilities already established in law. Thank you for your time and consideration. I'm happy to respond to any questions you may have.
Thank you very much.
Good to see you.
Good to see you. Kathy Flaherty.
Thank you, Representative Dillon and all the members of the Appropriations Committee. My name is Kathy Flaherty, and I'm the Executive Director of Connecticut Legal Rights Project, and we are a legal aid organization specifically set up to provide representation to people who receive mental health services from the State Department of Mental Health and Addiction Services. Very grateful to the governor for including level funding for CLRP in the budget recommendations for this year. That will enable enable us to continue our vital work representing people who are in the state hospitals and also people who are living in the community, many of whom are facing the risk of losing their housing due to disability-related behavior. And that funding enables us to continue this vital work. I'm also here to join in the call for support for the Connecticut Association of Nonprofits, the call for additional funding for community nonprofits, because our clients who we serve depend on those community nonprofits for the services they receive in the community. And especially in our housing work, we see two things. When there is staff turnover, when there is staff reduction, when there's cuts in services, that impacts directly on the lives of our clients and makes it that much harder for them to maintain their stable housing. So we join in that call. The other thing that we especially appreciate is the dedicated money in the budget to fund and support discharges from the state hospitals. People may not be aware that the average length of stay in our state hospital is not in weeks or months, but it's actually measured in years. And people should not be in the hospital any longer than they need to be, and they should be able to rejoin their lives in the community. And having a dedicated source of funding that will support those discharges is very much needed and very much appreciated. I appreciate the time you've taken to listen to me today, and I look forward to hearing from everyone else.
Thank you very much and good to see you, Kathy. Thomas Burr.
Yes, good afternoon, Representative Dillon and members of the Appropriations Committee. My name is Thomas Burr, and I'm the Public Policy Manager for the Connecticut chapter of the National Alliance on Mental Illness, NAMI Connecticut. For the past 20 years, NAMI Connecticut has been working in conjunction with many other advocacy organizations like the Connecticut Coalition to End Homelessness to end homelessness. We care about this issue because 30% of people experiencing homelessness are people with mental health and/or substance use conditions. You have my written testimony, which echoes the data in the monetary ask of the Connecticut Coalition to End Homelessness, which mirrors the testimony I gave to this committee last Friday. So today I'd like to emphasize something that wasn't included in the governor's budget for DEMAS, money to expand the peer-run respite network. A peer-run respite is a voluntary short-term program that provides 24/7 community-based, non-clinical mental health crisis support as an alternative to inpatient hospitalization. A respite is operated in a home-like environment by peer support specialists who have lived experience with mental distress, crisis, and life-altering challenges. Peer support is recognized by the Center for Medicaid and Medicare Services as an evidence-based model of care. On a personal note, my son was one of the many, many people who I have heard from who has been traumatized in an inpatient hospital setting, and as such, would avoid that particular method of care. This delayed my son's path of recovery by years and almost cost him his life. A peer-run respite could have really helped him on his journey to recovery, but at that time, they didn't yet exist here in Connecticut. He actually works now as a volunteer in a peer organization, so he knows this. As you may recall, in the 2024 legislative session, DEMAS was authorized to create a total of 8 peer-run respites within available appropriations. You are also likely aware that the Gloria House in New Britain, the state's first and to date only peer-run respite, came online in July of 2024. While we applaud the creation of the Gloria House, it is critical that the rest of this network of peer-run respites are created as soon as possible. We are all well aware that the Medicaid funding from the federal government is likely to be cut next year. What you may not be aware of is that a stay at a peer-run respite is 1/10 the cost of a typical stay in an inpatient hospital. This has the potential to save millions of Medicaid dollars, as well as provide better outcomes for the people with mental health conditions, many of whom, like my son, haven't had great experiences or outcomes with inpatient stays in Connecticut psychiatric hospitals. Please include the money for the creation of the remaining 7 peer-run respites in the DEMAS budget. Over the past 10 years, 14 other states have already concluded that peer-run respites are key components to their state's continuum of care. So in conclusion, without increasing the funding for all of these key items, we won't be able to solve the problem of homelessness, as well as help people who need an alternative to inpatient psychiatric hospitalization.
Thank you
People will
very
continue
much.
to suffer. And I just ask that you do the right thing here. We have the room in the budget and we have the surplus funds available. So if not now, guys, when? Thank you.
Thank you. Thank you for your testimony.
You're welcome.
Kelly Fitzgerald. Is Kelly Fitzgerald here?
I don't see her.
Okay. Andrew Young.
Good afternoon, Appropriations Committee and leadership and senators. I'm Andrew, and I work at CUNY Employment Opportunities over in Meriden as a job coach in the Group Supported Employment Department. I help an array of individuals with disabilities gain employment skills on the job. Some of the challenges that we've had are maintaining staff levels, hiring new staff because of the low wages, and as a result or solution of that, what I've seen is that we've had to hire a lot of temps from a temp agency. And with that, it costs more to hire a temp than it does internally as a CUNY staff. As a result, talking with my coworkers, including myself, we all work multiple jobs. We feel unheard, unseen, and a little bit disrespected. All of my coworkers are looking, including myself, are unfortunately having to look elsewhere, even though we love what we do and making a difference each day. Because if we were to get the $155 million through through this, it would help definitely improve the morale. It would help maintain the staffing levels and hopefully get some new staff because of that new competitive rate that we could have. Thank you.
Thank you very much. Lorena Mitchell.
Hi, good afternoon, distinguished members of the Appropriations Committee. My name is Lorena Mitchell. I'm a New Haven resident, and I currently serve as the coordinator for community mental health initiatives with the City of New Haven. In this role, I work to strengthen our city and our region's behavioral health ecosystem. I'm here in strong support of Elm City Compass, New Haven's crisis response team, and I urge you to approve the $1.3 million in annualized funding to sustain this essential service as reflected in the governor's budget. New Haven is a regional hub for behavioral health and social services. Our hospitals, our shelters, our behavioral health agencies serve residents from surrounding towns as well as our own. When our crisis system is strong, the entire region benefits. When it is strained, the impact extends far beyond our city boundaries. Since its launch in 2022, Elm City Compass has responded to more than 3,600 mental health and substance use crises. More than a response team, Compass is critical crisis response infrastructure, strengthening coordination across city government, public safety, healthcare providers, and our community-based organizations. Within municipal government, Compass partners closely with the New Haven Police and Fire Departments, with our 911 dispatch, and many departments across our municipal government, including our health department, our public libraries, housing code enforcement, parks, elderly services, and the mayor's office. City staff frequently encounter residents experiencing distress, addiction, and untreated mental illness. Today, instead of navigating these situations without clinical training, they can access real-time consultation, de-escalation expertise, and follow-up support. This has improved the safety, outcomes, and coordination for both staff and residents. Elm City Compass also convenes ongoing coordination meetings with Yale New Haven Hospital, with our Regional Mental Health Authority, and with many other local behavioral health providers, housing agencies, and community partners. This collaboration has reduced fragmentation, strengthened connections between adult and child crisis systems, and supported the expansion of key resources, including the 24-hour DEMAS-funded REST Crisis Stabilization Center and a 100-bed emergency housing program offering extended stays for individuals experiencing homelessness. Together, these efforts reduce unnecessary emergency department visits, create more stable pathways to care and housing, and strengthen the broader behavioral health system that serves our region. The requested $1.3 million in annualized funding will ensure that Compass can continue operating as the backbone of this coordinated crisis response infrastructure serving our entire region. Thank you for your time and consideration, and I urge you to support the funding for Elm City Compass and pass the budget. Thank you.
Thank you very much for coming to see us. Danielle Phillips.
Good
you
afternoon,
are.
esteemed members of the Appropriation Committee. My name is Danielle Phillips, and I've spent the last 17 years at Marrakesh working with individuals with intellectual and developmental disabilities, autism, mental illness, acquired brain injuries, and others who depend on Connecticut's community supports to live safely and with dignity. I'm here today because the people we serve are being left behind. Waitlists are growing, families are overwhelmed, and individuals who should be receiving essential services are instead stuck in a system that can no longer keep pace with their needs. Every day we see people who are not just waiting, they are unserved and unsupported with nowhere else to go. For decades, providers like ours have stepped up to fill the gaps. We've helped people navigate paperwork, hearings, denials, lengthy wait lists, and confusing eligibility rules, often without any funding for the staff doing that work. But we can't continue at this pace. After years of underfunding, the cracks have grown too wide and the people falling through them are real. A major part of this crisis is the workforce shortage. Connecticut has roughly 30,000 direct support professionals who are working for private nonprofit organizations. In a recent study, it showed they earn an average of $6.11 per hour less than a livable wage. These workers are the backbone of the entire system. They're the ones supporting people in their homes, at their jobs, and in their daily lives. They manage medical needs, challenging behaviors, community inclusion, personal care, and they do it with compassion and commitment every day. And yet their wages do not reflect the importance of their work. This is wrong, and the consequences are immediate. Programs can't stay fully staffed, families can't get the services they've been waiting for, and people already in services are receiving fewer hours or losing supports altogether. Despite all of this, our staff continue to show up with extraordinary dedication. They are some of the most caring and skilled individuals I have ever met. They do incredible work even though they are not paid anywhere close to what they deserve, and I am amazed by them every single day. And I want you to see that for yourselves. I invite each of you to visit our programs, meet the people we support, and talk with the staff who keep the system running. Seeing their work firsthand is the clearest way to understand what is truly at stake here. Connecticut has a strong history of supporting community services. That support has made a real difference, but it is no longer enough to restore what has been lost. Today, I'm respectfully asking that you increase funding for community nonprofits by $155 million in fiscal year 27. This investment won't create luxury, it will create stability. It will reduce waitlists, retain qualified staff, and help ensure that no one in Connecticut is left without the support they need to live safely and with dignity. Thank you for your time and thank you for listening.
Thank you very much for being with us today, and thank you for your work. Next is this Patricia McIntosh.
Thank you, Madam Chair Dillon, and also the esteemed members of the Appropriations Committee. I'm happy to be here today to share my thoughts regarding the Elm City Compass program. So my name is Patricia McIntosh, and I am employed by the City of Hartford Health and Human Services Department as their Deputy Director of Social Services. I'm writing in support, here testifying in support of Elm City Compass and in support of the request for $1.3 million in annualized funding so that this vital crisis response partnership can continue, serving New Haven and supporting the entire system in its region. In 2020, the City of Hartford researched alternative crisis response programs to identify the best fit for the City of Hartford. We then implemented the Hartford Emergency Assistance Response Team, known as a HART team. The HART team provides an alternative alternative response to crisis calls, often mental health or substance use related, that are received by Hartford's 911 dispatch, affording the response of a clinician and a peer instead of a police officer, yet with close collaboration. For large cities like New Haven and Hartford, this model of alternative crisis response affords both community response and co-response and allows for more direct service to be provided on scene. Like Elm City Compass, Heart Team fills the gap for clinical calls, allowing first responders to focus on crime, medical, and fire emergencies, while assigning mental health personnel to those calls better suited for their intervention. Similar to Elm City Compass, in 2021, since 2021, Heart Team has responded to over 5,300 calls for service, and largely for individuals experiencing emotional distress and largely experiencing the challenges of complex social needs that we're hearing of today. Programs like Heart Team and Compass are critical to strengthening public safety systems by allowing a focused attention to emergencies by first responders, while social service needs are supported through clinical providers. Alternative crisis response programs like Compass and Heart Team help to reduce unnecessary emergency department transports, provide support on scene to allow for safer outcomes, and help to ensure individuals in crisis are linked to the clinical care they need. It can also be inferred that alternative crisis response programs improve crime solvability, given the ability to focus more time on higher acuity situations by our first responders. Additionally, the broader community response to programs like Compass support the compassionate approach to managing emotional crises, as well as the systemic improvements with continuity of care. Both Heart Team and Compass provide regional support as their services are part of a public safety system, not only for residents, but also the high volume of employees, visitors, and students traveling through these major hubs daily. As part of the City of Hartford's administration of the Heart Team, a lateral program to Compass, I strongly support continuation funds allocated to alternative crisis response. Thank you for your time and your consideration of this request.
Thank you very much. Our next speaker is Bethlyn Heller.
We're working to try to get her online. We can move on in the interim.
Okay, then Angelo Aglieco.
Hello, how are you, Madam Chair?
Did I get your name right?
Eliako, you did a great
Close enough.
Well, listen, you did fantastic. Hello, everyone, and hello to you, and good afternoon. Thank you for allowing me to be here. This is actually my first time actually doing this, so I'm very excited, but I'm also a little bit overwhelmed of hearing so much that we need, and in so many different areas. We are all trying to struggle and to stay afloat and to do the right things and make the right choices and have a sense of compassion and empathy in the same time. Our individuals that we deal with at CUNY Employment Opportunity, from all different ranges, from providing services for them to be able to experience life, to take them out and to show them and to be a part of the community and to say, you know, they're no different than anybody else. That is very much, you know, I'm so humbled by it because I've been there for 10 years. I walk down the hallway and I hear them calling my name, and sometimes I feel like a celebrity, but they show me so much love, so much attention that you want the best for them. These programs need to be funded. They need to still be alive and very well working and functioning, as well as staffing. Staffing has been difficult, especially after COVID. COVID really took us for a loop. And if COVID did not teach us anything, it brought everything to a stop. But we had to recover. Now we're all moving forward. And the economy is very hard to live by. It's very hard to be able to pay your bills and take care of the things you got to take care of, especially someone who was diagnosed with head and neck cancer in 2017, and I'm not supposed to be here. So obviously God had a bigger plan for me, but I'm grateful to be here. But I'm also here because I have to take a shout out to all the employees who do work in CUNY Employment Opportunities, the ones that came back after COVID, the ones who have been there consistently working, which is not that many, but I have to give it to them because yes, we are all working very hard and we deserve that pay, we deserve that increase, we deserve that because without the staffing, without the proper foundation, we don't have the structure. But these individuals, these people that I work with every day, I give them so many props. The pay increase would be something beyond one's imagination of feeling so grateful and so thankful to being seen, to being heard, but also to be able to still do and enjoy what you're doing. That is, to me, everything. Thank you, Madam Chairman.
Thank you very much for being here today.
Thank you.
Margaret Watt.
Hi, good afternoon, committee chairs and committee members. My name is Margaret Watt. I am the public policy chair of NAMI Connecticut, as well as someone working in regional leadership positions in behavioral health for more than a dozen years, currently leading a variety of prevention efforts in Region 1. I want to thank you first for the proposed investments and efforts to maintain DEMA's programming. This time, as you hear, is more challenging than ever. I don't want to repeat what my colleague Tom Burr at NAMI Connecticut has already said, but just to say that NAMI represents individuals and families statewide with lived experience with mental illness who are the people at the bottom of the system, right, receiving the services. And our coalition statewide finds it incredibly important that the state increase funding for both housing and community mental health. You're hearing many providers talk about the dire needs. The increases are long overdue, as you've been hearing. Two specific asks. One is the state has invested in recent years in a couple of new levels of care which have made a difference. That's the urgent crisis centers for children's behavioral health and the peer-run respite, which is called Gloria House. As everyone has been asking you for a while, to continue to maintain that funding. The peer-run respite, though, is something we really need to put throughout the state. It is 1/10 the cost of a hospital stay for someone to go to a peer-run respite in an emotional crisis. It's an evidence-based project model. It's really effective. However, it has been underutilized since it was established about a year and a half ago. Why? Because when we create new things in our state, we don't even allocate funding to promote awareness of them. So while we would like you to ask you to fund 7 more peer-run respites so that people can access them from every region of the state, so that our Latino population can have one where they can go without language barriers, so that our LGBTQ population can go to one where they feel no barriers or stigma from providers. We also ask that you allocate some specific money to raise awareness that this system exists so it can be fully used and serve the purpose that, we know that there are emergency rooms that don't even tell people this exists as an alternative. The other thing I want to ask, so advertising money for these things, peer-run respites. The other thing I just want to mention is you are hearing today also from a lot of folks talking about the regional behavioral health action organizations. It's great that the state is maintaining funding to the regions. The state is not sending funding to local communities for mental health efforts on the ground level or prevention efforts on the ground level. Local prevention councils, which are the bedrock of our prevention system, continue to receive the same amount of money they've received for at least a decade, which is like $3,000 to $5,000, maybe $10,000 for a city the size of Bridgeport per year. The needs are immense. I would point to the Cannabis Prevention and Recovery Services Fund as a source of funding that is allowed to be used for prevention, treatment, and recovery, and would ask that the appropriations and finance committees really delve into and look at how that money is being allocated and clearly specify that some of that money needs to go directly to communities for prevention and not just stay at the state level or regional level. There's a lack of transparency around where the money's going, in fact, and I would also ask for a dashboard such as the opioid settlement dashboard. Thank you so much.
Thank you. And Beth Lynn, is Beth Lynn online now?
Yes, I am.
Well, it's nice to see you.
Hi. My name is Beth Lynn Huller. I'm representing Mark Ingham, Manchester. I'm also talking about how the housing department, you need to get a housing department for the deaf people. I was in an apartment recently and it was not set up right. So I'm looking to hopefully have some money when I can find a place for me or any of the hearing impaired people. My place was not equipped for that. So right now I'm living in a group home for hopefully just temporarily. So until I can find a apartment for myself. I am very independent. I just need something for the hearing impaired and hopefully, with no stairs. A ramp is good because I do have some problems with my legs. But again, I am very independent. I work for Walking of Manchester. I've been there for 12 years, going on to 13 soon. I really would like to, if possible, for money to go to the housing department for me. I've been wanting to live hopefully in Manchester, because that's where my job is. But I'll live anywhere that is close to my job. Like I said, that's what I'm asking. I'm asking for, a place to live with, I know it costs money, and hopefully some help. I'd like to have the Mock Inc. staff to be my staff, because that's, I think that'd be suitable for me. And again, I'm just asking for a better place to live for the hearing impaired. Thank you, and I hope that I get that. Have a good day.
Thank you for joining us.
You're welcome.
The next speaker is Monica Photo.
I don't see that she's on.
Courtney Sheehan.
Hello.
Hello.
Good afternoon, co-chairs and members of the committee. Thank you for the opportunity to testify today. My name is Courtney Sheehan. I'm a licensed professional counselor and a senior program director at CHR. CHR provides mental health and substance use treatment, supported housing, and foster care services to approximately 25,000 citizens of Connecticut each year. I'd like to share from my 30 years experience providing clinical care and operating behavioral health programs like adult crisis services to draw attention to two main issues of consideration today. The first is that Connecticut residents would benefit from an increase in behavioral health funding, specifically to establish a much needed system of crisis stabilization centers. In Connecticut, it's important to note we still have a gap in our crisis care delivery system for those in acute crisis. You may be aware that emergency departments are unfortunately not often the most helpful place for individuals in behavioral health crisis, especially considering the majority who present don't require inpatient care. Many leave an ED experience with their mental health needs still unmet, and this can contribute to stigma, frustration, and disengaging from life-saving care. Fortunately, we know a better way. Crisis stabilization centers are an evidence-based alternative to hospital-based care and can address the gap in our system. The benefits of crisis stabilization centers are multiple and well documented. They're more cost-effective than the current system, and they're more effectively deliver care to allow people to quickly rejoin employment, education, family, and other pursuits. I included some research links in my testimony at the bottom for future reference. Second is we have an effective mental health emergency department support program, and its funding is at risk. This program uses the expertise of professionals with lived recovery experience to provide compassionate support, reduce social barriers to accessing care, and to link people to community supports and treatment, both during and after an emergency department visit. In its first 15 months, this team already assisted over 700 individuals in need. The number one presenting problem of people served by this program is suicidal ideation or behavior. Currently, this life-saving work is in jeopardy unless we allocate adequate behavioral health funding to sustain this vital program and others like it. The good news is nonprofit organizations have extensive knowledge and access to best practices to serve the residents of Connecticut, yet the demand for adequate services still remains unmet. We just need adequate funding to hire people and do the work. I'm here to thank you for recent increases and to request an increase in funding for vital nonprofit programs by $155 million in fiscal year 27. Thank you for the opportunity to testify today.
Thank you for your testimony, and thank you for your work. Beth Fisher.
Good afternoon, Representative Dillon and distinguished members of the Appropriations Committee. My name is Beth Fisher. I'm the CEO for CUNE Employment Opportunities. We're a nonprofit agency serving Central Connecticut. We provide day and employment services for DDS and DEMIS to nearly 500 individuals each year to become valued in their community, independent by earning a wage, and proud of their accomplishments. That's our VIP mission. Thank you for the opportunity to testify today. We appreciate the significant and real increases that the governor and legislature have approved in recent years and in the coming year. But unfortunately, after years of stagnant funding, it is simply not enough. As a day and employment provider for DDS, our agency received a smaller COLA than our colleague agencies that provide residential services, and our DEMIS-funded programs saw no new increases in FY26. We have employees with the same job title, scope of work, and educational requirements funded by DDS and DEMIS, and we simply cannot pay one set of employees less than another. Digging deep to maintain wage parity erodes our already stressed agency budget and decreases funds for other critical needs. We continue to see a 20% vacancy rate, no improvement over last year, despite raising wages across the board. When staff call out and coverage is not adequate to meet the DDS required staffing ratios, client services get canceled. This directly impacts our clients and our revenue. Our agency is not alone with these challenges. In my written testimony, you'll find that I've cited a recent National Core Indicators report on the state of the workforce in IDD that was recently shared by DDS and highlights the results of providers surveyed in Connecticut for for 2025. With adequate funding, our agency could fill vacant positions, improve wages, improve access to services by eliminating last-minute cancellations, address our waiting list, and ensure quality service delivery. Adequately funded nonprofit services make Connecticut a better place to live and enhance the overall quality of life for everyone, including our most vulnerable citizens. Please support increased funding for community nonprofits by $155 million in FY27. Thank you for your time and the opportunity today.
Thank you very much. Next, Heather Latora. Hi, Heather.
Hi, good evening, Representative Dillon and the Appropriations Committee. I'm Heather Latora, proud president of Marrakesh, supporting individuals and families in Connecticut, and it's my 40-year anniversary this year. Marrakesh contracts with several state agencies and other entities to provide individualized supports, and for some 24/7. As most of us were waking up in our own homes in the storm this morning, hundreds of private, nonprofit, direct support professionals throughout the state were working hard to support our friends, our neighbors, and our loved ones. Big shout out to them, and thank you. And the commissioners, thank you, the legislators and the commissioners, for acknowledging them as well this morning. Thank you for your time, not only today, but for days and days, years and years, and some of you for decades of listening and learning. And I could tell by the questions you posed to our state commissioners, you know our system way too well. And I know that my colleagues and my partners, individuals and families, move you as they continue to move me as I hear their testimony. I debated whether to testify this year because for the first time in decades, it feels like many state leaders understand that funding human service nonprofits is not discretionary because people are not discretionary. And I'm grateful for the progress we've made together. But the work's not done. Shout outs are not enough. They are not enough for people not earning livable wages and not enough to support everyone with a need instead of leaving them on waiting lists. Here is an incentive. You will finally be rid of me once those two issues are taken care of. There was a time when we could open group homes in months and help people move out of hospitals in days and set up new services really quickly. That is no longer possible. You heard from the DDS commissioner today who mentioned the RFP process for a new group home. And due to the process, he couldn't discuss that in detail. And I could say there were days when there was so much competition for new proposals, and we were opening up programs and helping people out of institutions and just doing our work. And it was a competitive process and it was great. And the barriers we face today are systematic and severe. A recent study I attached and Beth just talked about shows that in Connecticut, direct support professionals in the IDD field are paid an average of $6.11 an hour below livable wages. And at the same time, individuals with disabilities face growing wait lists with nowhere to turn. And you deserve to know why and what we could do about it. Inconsistent COLAs across departments have made it impossible to stabilize the workplace. While DDS has taken steps toward livable wages and benefits, recently recalculated rates eliminated our enhanced benefit pool. So for the past 3 years, this means for the past 3 years, we were finally able to contribute to staff retirement plans after going without any since 2011. And now we're struggling again, even to keep up with healthcare costs. Very few people can commit to jobs, long-term work without benefits. The most troubling issue is that some people are receiving no services at all. Our mission has always included helping people who fall through the cracks, and far too many are falling through them today. People on autism, ABI, and mental health waiting lists, and even individuals approved for services are still waiting. These gaps are unacceptable. We
Thank
want to
you. If
help.
you could wrap up, Heather. Yeah.
Without full staffing, without consistent funding, we cannot meet the need. Thank you so much.
Good to see you.
Nice to see you.
Next, Suzanne Kuligowski.
Good afternoon, members of the Appropriations Committee, and thank you for your time and dedication on this very snowy Monday and for hearing the needs of your constituents. I am Suzanne Kuligowski, President and CEO of ARI of Connecticut. We provide services in and around Stamford for nearly 100 individuals with intellectual and developmental disabilities, as well as many other cognitive, physical, and psychological disabilities. We so appreciate the increases that are already included in the fiscal year 27 budget. They are generous, but unfortunately, they're not enough. The requested increase in funding for nonprofit programs by $155 million is not a want, it's a need. Too many years of stagnant funding have left our services in significant damage. Our greatest asset, as you've heard so much today, is our staff. Without quality direct support staff, we're unable to provide quality services, and without quality clinical staff, our DSPs don't have the training and support that they need to handle challenging medical and behavioral needs. Our current funding is not enough to pay competitive wages to recruit and retain quality employees. At ARI, we just filled a nursing position that was vacant for 3 years. That extra strain puts on all other members of our staff stress and strain and pressure that is beyond measure. DSP positions also remain open for years. As soon as you fill one, 2 more staff resign. This has a direct impact on the individuals that we serve and those who are in need of services. I constantly receive referrals that I quickly decline because we can't hire enough staff to add new individuals to our program. And I have stopped keeping a waiting list because I see no end in sight, and it would be unfair to these families to lead them to believe that we will serve them as soon as their number comes up. It's not coming up. It's heartbreaking to speak with these families who are so desperate for services. With the increase in funding that we know we will receive when you do approve the additional $155 million, we will be able to increase wages in order to be more competitive with hiring, and we'll be able to more adequately compensate our existing staff for the incredible work that they do. Our staff work unbelievably hard, serving a very challenging population. Many of them work 2 or 3 jobs. They're exhausted and burnt out, but they're also committed and dedicated. Even during a blizzard, they show up. We're very grateful for the bipartisan support that we've received from this committee in the past. Our state has the ability to fund and strengthen services like ours so that even if the safety net gets stretched, it will not break. Please support increased funding for community nonprofits by $155 million in fiscal year 27. Thank you very much for this opportunity to testify.
Thank you. Would you like me to take over, Pat?
Very well, Senator. Thank you. Nice to see you.
Nice to see you too. Up next, we have John Stakely.
Good afternoon, Senator Alston, and distinguished members of the Appropriations Committee. My name is Jonathan Stakely, and I'm a personal care attendant for my brother Jesse, who has Down syndrome. Like thousands of individuals across Connecticut with physical and intellectual disabilities, my brother depends on caregivers every single day. On sunny days, he needs care. On rainy days, he needs care. No matter the season or temperature, his needs do not change. His safety, health, and dignity rely on consistent, dependable support. And without that care, I worry about what his future would look like. I love my job. I love being to ensure that my brother's health and well-being are protected. But with the responsibility comes real challenges. One of the most pressing challenges we face is the payroll system through GT Independence that serves caregivers. As a delegate in our home care union, I regularly receive calls from workers who have not been paid on time and for hours that they worked. Some have gone weeks waiting for corrected checks. That added financial stress makes it incredibly difficult for caregivers to pay rent, buy groceries, and maintain stability in their own households. We are already facing a worker shortage. Recruiting and retaining qualified caregivers, especially for individuals like my brother, who is nonverbal, requires trust and reliability. It is nearly impossible to ask anyone to take on the important work if we cannot guarantee they will be paid accurately and on time every time. That includes proper payment when they use their earned paid time off. Unfortunately, caregivers are not consistently receiving their correct compensation when they use PTO. And when caregivers are not paid correctly, it does not just impact the workers, it directly impacts people who depend on them. So my request today is simple. Please provide the Department of Developmental Services with the resources necessary to ensure that caregivers across the state are paid in full, accurately, and on time every time. Stable funding for DDS means stability for caregivers, and stability for caregivers means safety and dignity for people like my brother. Thank you for your time and consideration.
Thank you. Up next is Carlos Sosa Lombardo. Carlos? Go
Good
ahead.
afternoon, Senator Austin and members of the Appropriations Committee. My name is Carlos Sosa Lombardo. I serve as a Deputy Community Services Administrator for the City of New Haven, where I help oversee human health services operations citywide. Thank you for the opportunity to testify on HB 5032 and adjusting the state budget for the biennium ending June 30th, 2027. I'm here respectfully requesting approval of $1.3 million in annualized funding for Elm City Compass, New Haven's Community Responder Program, so that we can continue providing vital mental health and behavioral health interventions to residents in our city. Elm City Compass is a clinician-led team of mental health professionals that partner with local public safety agencies to respond to behavioral health crises in New Haven. The team is deployed at the request of the New Haven Police Department and the New Haven Fire Department. And under specific circumstances, they may also be dispatched directly through the 911 call center, also known as PISA. Since its launch in 2022, the Compass team has responded to almost 4,000 mental health and substance use crises. The team serves individuals experiencing acute psychiatric distress, substance use emergencies, homeless-related crises, trauma-related incidents, providing de-escalation, stabilization, safety planning, and direct linkage to care. The program reduces unnecessary emergency room visits, decreases avoidable arrest, supports first responders, and ensures that individuals in crisis receive care from trained behavioral health professionals rather than relying on law enforcement. It reflects a thoughtful, data-driven investment in public safety and public health. The 1.3 million annual investment will allow us to sustain current staffing levels and maintain a rapid response capacity. I respectfully urge you to approve this funding so that we can preserve and strengthen a model that is working, one that saves lives, reduces system strain, and reflects our shared commitment to compassionate, effective crisis response. Thank you for your time, your leadership, and your consideration.
Thank you. Up next is Jenny Cole. Jenny?
Thank you very much, Senator Austin, and good afternoon, honorable members of the Appropriations Committee. My name is Jenny Cole, and I'm the Menstrual Equity Project Manager at the Diaper Bank of Connecticut, and thank you all for the opportunity to testify. I'm here to urge you to support extending funding for the Diaper Bank's Menstrual Equity Program through a $1.9 million 2-year grant from the Connecticut Department of Public Health. The Menstrual Equity Program provides eligible public schools with free period supplies in accordance with Connecticut's menstrual equity law. This funding is set to end in December 2026, and we're asking the Appropriations Committee to extend our funding by $475,000 to allow us to continue to provide period supplies at the same level of distribution through the end of this budget. Currently, we have distributed more than 5 million period products to over 500 public schools, ensuring that over 112,000 menstruating students have reliable access to the supplies that they need to learn and thrive. Our reach is vast, partnering and distributing products to schools in every county of the state. The Diaper Bank has a proven scalable system for equitable procurement, warehousing, and distribution of period supplies. In accordance with the law, the Menstrual Equity Program addresses period poverty, the lack of access to adequate menstrual products, which remains a significant barrier to education and health for students in Connecticut. Approximately 1 in 4 students who menstruate struggle to afford period products, with an even higher rate in low-income communities. Lack of access to these products leads to students missing school, which worsens the achievement gap, again, especially in low-income communities. And oftentimes, students must resort to making some sort of makeshift product. So toilet paper, socks, rags, things like that aren't good for your health and also cause discomfort, shame, and emotional distress. Along with all that, we know that there is vast public support for these sorts of programs. 77% of Americans support free access to period products in bathrooms in public schools. So we've learned through this program, many teachers, nurses, schools, and school staffs were purchasing period supplies with their own funds to ensure students had what they needed. This reflects both a deep commitment from these professionals and also an awareness of the financial strain that many families face, as well as the emotional impact on students who weren't able to access to have these products readily accessible. A big part of this program is that we hold quarterly advisory meetings with our school partners where we focus on program updates, program evaluations, educational opportunity, and perhaps most importantly, peer-to-peer learning. No 2 schools are distributing products exactly alike, so distribution methods look like nurses handing them out, administrators, facility departments, and some student groups have even kind of championed this program in their schools. And this has really required us to be flexible in order to meet the needs of the school to figure out the best way to get the products to their students. Another key aspect of this program has been program evaluation. We're working with
Jenny, can you wrap up, please?
Yes, absolutely. Thank you. So again, we're respectfully asking for funding to help us continue with this program, as we know that it greatly supports our students in Connecticut. Thank you again for your time.
Thank you. Up next is Valerie Rayer. Valerie?
Good afternoon, esteemed members of the Appropriations Committee, and thank you for the opportunity to testify today for HB 5032. My name is Valerie Rayer, and I'm the Chief Operating Officer of the Kennedy Collective. We are a nonprofit organization dedicated to supporting individuals with diverse needs by providing comprehensive services that enable them to live, work, and participate fully in their communities. I'd like to express our appreciation for the increases included in the enacted fiscal year 2027 budget. and to respectfully ask that you increase that funding for community nonprofits by $155 million in fiscal year 2027. Although we are grateful for the meaningful progress over the last year, after decades of stagnant funding and rising demand for services, the financial strain on providers remains significant. DDS rates in Connecticut continue to lag behind the true cost of operating in one of the most expensive states in the country. Inflation, insurance, transportation, utilities, compliance requirements, and wages have all increased substantially. Reimbursement rates do not keep pace, and the methodology of being reimbursed has significant constraints. Last year's increases were weighted more heavily toward residential services. While residential funding is critical, day and employment services are equally essential to quality of life and community integration. Disparate increases create internal imbalance and make workforce sustainability even harder, especially for those organizations like ours that are sharing staff between both. You've heard from others about workforce. This is our most pressing challenge. We cannot compete with other employers offering higher starting wages and bonuses. Attracting and retaining competent, qualified personnel is exhausting. Our personnel are tasked to provide complex and demanding care. The responsibility is so much more than what we value at with these rates. As I heard in earlier testimony, when the state provided these services, they were funded and paid adequately. But once outsourced to community providers, the demand for quality increased and the reimbursement for services decreased. The most recent data shows a 40% average employee turnover rate in the DDS system-wide, and this has led to 61% of agencies have closed their doors to new referrals. Organization, we've already tightened every belt possible. We've consolidated buildings, reduced overhead, renegotiated contracts, and narrow programs instead of expanding them. There are no efficiencies left to extract without impacting services. At the same time, we face uncertainty at the federal level. Potential changes to Medicaid or SNAP would directly affect both the individuals we support and, sadly, many of our employees. With adequate funding, we would increase wages, stabilize programs, reduce turnover, and expand access to employment and day supports, strengthening the entire system. Connecticut has long demonstrated bipartisan commitment to community-based services. We respectfully ask you to continue that leadership by supporting an additional $155 million in fiscal year 27 and addressing both rate adequacy and reimbursement reform. Thank you for your time and consideration.
Thank you. Up next, Jameson Conti. Jameson.
Hello.
Yep, go ahead.
Good afternoon, esteemed members of the Appropriations Committee. My name is Jameson Conti, and I'm currently a senior at Haddam Killingworth High School. I'm here as a representative of our Ignite Club, member of the Government Prevention Partnership Youth Advisory Board, as well as a member of the Connecticut community. I come today to testify for the maximum support and funding for our prevention through the Department of Mental Health and Addiction Services, as well as push for the passing of Bill HB 5032. As a current high school student, I've been exposed heavily to drugs and alcohol and the dangerous impacts they have. Children are being exposed to these issues at younger and younger ages. Unfortunately, one simple uninformed decision can lead to a lifetime of mental health, physical, and social issues. This is why prevention is important, not just to sway people's choices, but to inform them so they can be certain in their choice of abstinency. The Governor's Prevention Program offers the perfect opportunity to sway these students' minds. From my own experience, student-led discussions and programs offer an exclusive form of communication. Creating student-to-student environments is critical to making sure the students feel heard and understood. The Governor's Prevention Program also offers direct involvement and input from current high school students. In this way, the GPP is constantly up to date on current issues high schoolers are facing. In my opinion, one of the biggest misconceptions with drug use is the belief that it is solely a physical problem. In fact, the damage and stress caused by an addiction can pose just as much of an issue on their mental health. From personal testimonies of my classmates, drugs create a downward spiral. Kids often look to alcohol or vaping as a way to reduce stress from school or friends, which cause more stress, leading to more drug use and thus creating a dangerous cycle. The best way to prevent these issues is through prevention, stopping the damage before students can create an addiction and the dangerous cycle. This is why we should fund prevention programs such as the Governor's Prevention Program. The evidence is in clear support of this too. In 2024, there was a 26% drop in the amount of overdose deaths and another 21% decrease in 2025. Even looking at Connecticut specifically, there were 772 overdose deaths in 2025. This is the first time in the last decade that the amount of overdose deaths has dipped below 800. We have seen great improvement through the implementation of prevention programs, and we by no means should begin to slow down or stop. In the end, I've come here today to emphasize truly how important preventative
Jameson, can you wrap it up, please?
Yes. Preventative programs such as the Governor's Prevention Program are to the grown youth. We respectfully ask you to continue to fund the Department of Mental Health and Addiction Services so the programs such as the GPP continue to protect the next generation. Thank you.
Thank you. Mary Etter, you're up.
Good afternoon, members of the Appropriations Committee. My name is Mary Etter, and I'm privileged to serve as the Executive Director for the Bristol Adult Resource Center, otherwise known as BARC. We support over 170 individuals in day programs and residential settings, and these individuals come from 24 towns in central Connecticut. On behalf of BARC's employees, thank you so much for your commitments to increased funding. However, the minimum wage in Connecticut is one of the highest in the country, third to Washington State and Washington, D.C., and it keeps increasing. It's bumping right up against what we pay our direct support professionals. Why on earth would anyone want the responsibility of human lives for such little pay? The crazy thing is, we have great employees that are dedicated to the work that we do, and they care deeply for our individuals. In spite of years of inadequate funding, we have opened and are opening new programs and are supporting our individuals with IDD in even more personalized ways than we have ever done before. The disparate increases in funding from the legislature is not helping us to staff those new day programs, though. And the increasing minimum wage will only make it even more difficult for us to find competitive employment for our individuals. At BARC, we are working on our culture. The senior leadership is trying to figure out what makes people apply to BARC in the first place so that we can figure out why the right people stay. It's an ongoing process and I don't have any data, but I can tell you that we are getting what seem to be really quality applicants. I am hopeful for our future staffing, but I need your help to keep our good people employed. Increased funding would help us increase the wages for our very deserving staff. It would help us keep our best staff, which would only increase the quality of the services we provide. Please support increasing funding for community nonprofits by $155 million in FY27. Thank you for the opportunity to testify, and now I'd like to introduce you to JB.
That's why that's why I am with Bart, because if without Bart, I will be in jail or out on the streets.
So he wanted to share that with you. He was hoping to come do it in person today. We were very disappointed, but I'm super happy that I got to spend the afternoon at his house with him and his housemates. And thank you very much for this opportunity to address the committee.
Thank you. Up next is Tricia Cunningham.
Hi, good afternoon. My name is Tricia. Well, first of all, I want to say thank you, Senator Austin and members of the Appropriations Committee for having us all here today. My name is Tricia Cunningham. I live in North Stonington and serve as Executive Director of Always Home, whose mission is to prevent family homelessness. We serve families with minor children in varying degrees of housing crisis and act as a family hub for the Eastern Connecticut Coordinated Access Network. Thank you for the opportunity to testify in support of the Connecticut Can End Homelessness 2026 legislative agenda, including the coordinated investments and policy changes needed to prevent and end homelessness statewide. You have already heard the data, the financial realities, and the growing strain on both families, along with the organizations and their employees working diligently to support them. The burden is becoming unbearable, much like the weight of today's snowfall. We appreciate that the governor's budget includes investments in homelessness and housing stability, and additionally respectfully urge the legislature to adopt a coordinated annual investment of $123.9 million organized as CCEH's Prevent, Respond, House campaign, so we can reduce entries into homelessness, meet current demand humanely, and accelerate exits to housing. Stable housing strengthens communities, reduces shelter demand, and improves health outcomes. One mother recently shared with us at Always Home how Always Home and others supported her through her addiction, mental health challenges, and her long path to stability. She first came to Always Home through a CAN appointment for diversion services and case management services. She shared that she made the hardest and bravest decision of her life to call DCF on herself and ask for help. She knew she could not do it alone anymore, and she chose to get better. Loving her children was the greatest motivation, and she chose sobriety for real. For her, getting clean meant facing grief, shame, and responsibility head on. It meant learning that asking for help was not weakness, and that protecting her children sometimes meant stepping back so she could eventually step forward stronger. She shared that she is not proud of everything in her past, but that she is deeply proud that she chose to change it. She proclaims that she is still here, she is clean, and she is choosing her children and herself and her life every single day. But we want to impress upon you that it took not just her drive, but also a network of support services for this mother to put the pieces of her life back together. It is this essential funding supporting this network that we are testifying on today that helped this mother survive, recover, stay housed, and break the cycle for her children. Thank you for your leadership and for considering this testimony. I urge you to support the full $123.9 million Prevent, Respond, House package, along with aligned policy changes so Connecticut can prevent homelessness, meet today's needs, and move people into housing faster. Thank you very much, and stay safe and stay warm.
Thank you. Up next, Hannah Yacob.
Good afternoon, members of the Appropriation Committee. My name is Hina Yacoub. I am a psychiatrist and member of NAMI, the National Alliance on Mental Illness. And so you've already heard some from my colleagues today, and you've heard from me last week as well. Speaking today with regards to the DEMAS budget. Just to reiterate what I spoke about last week, and you all have access to my written testimony, we are fully aligned with the Connecticut Coalition to End Homelessness with regards to our respectful ask to increase the appropriation for housing and housing stability to $123.9 million. So with regards to an additional ask, what I want to focus on today is on peer-run respite programs. So peer-run respites, just a short summary, are voluntary short-term programs that can offer non-clinical mental health crisis support as a potential alternative to hospitalization. They are primarily operated by peer support specialists who have lived experience with either mental illness or substance use. And these individuals model recovery. They help clients focus on their strengths. They offer them self-help strategies as well as practical information and resources. Some positive outcomes associated with peer crisis respites include reduction in crisis symptoms and emergency department visits, improved client functioning and self-esteem, and increased connection with community resources. And plenty of research shows that individuals who have been in peer-run respites experience them as empowering and safe places where they feel more seen, more heard, and more respected than they may have felt in conventional treatment settings. So as a psychiatrist and a prescriber, I deeply value the treatment that I can provide in supporting patient safety and recovery, but I also recognize that healing is not always achieved through the traditional medical model. So I welcome any service that would genuinely benefit my patients and complement my care by offering something that I simply cannot, which is connection through lived experience with mental illness or substance use. So in the 2024 legislative session, DEMAS was authorized to create 8 peer-run respites within available appropriations. We have since thankfully gotten our first peer-run respite in 2024, the Gloria House. So our first and currently only peer-run respite in Connecticut. So we as NAMI think that it is critical to continue building our peer-run respite network to create safe, supportive, and empowering spaces for people who are in crisis. So with that, I fully support NAMI Connecticut's ask for the investment of $7 million for the creation of 7 additional peer-run respite programs. With your help, the support of peer-run respites will help strengthen our continuum of care for mental health services in our state. Thank you to this committee for your hard work on behalf of Connecticut and for your kind attention today.
Thank you. Up next is Susan Lusick. Susan.
Yes, thank you, Senator Austin and members of the Appropriations Committee. My name is Susan Lusick Hughes. I live in Tolland, and I am the parent of a young adult who lives with intellectual, developmental, as well as physical disabilities. You've heard a lot from agencies here today, and I'm here to speak as a parent, a caregiver, and an advocate for my daughter's ability to live safely and with dignity in the community, and to urge your opposition to the short-sighted and dangerous shift in policy as it regards to the elimination of community first choice and its rollover to as yet to undetermined waivers. I have many questions and concerns about the proposal to transition CFC participants to waiver programs. These waiver programs, when will they be defined? How will existing CFC participants be assured that their services and supports will not be interrupted? My personal experiences with DDS and case management have been excellent, but I also know that they are overwhelmed with their caseloads. This new waiver would create an avalanche of new casework. And my personal experiences with the existing fiscal intermediary is very concerning. Is the state's fiscal intermediary / third-party administrator, GTI, fully prepared to roll these changes out without service, support, and payroll interruptions? Because there have been many, many documented complaints and problems reported with this company, as you all heard during the more than 10 hours of public testimony last week, as well as today. More questions. Will these CFC participants be transitioned to DDS waiver programs? How many DDS clients are there who are currently on CFC? Has the DDS budget been augmented with funds for these CFC participants to be covered by DDS waivers? We all know that there are waiting lists for services from DDS. Would the CFC participants that transition to DDS waiver programs be placed on a waiting list, or would they be cut to the front of the line? If CFC participants are placed on a DDS waiting list, would they then lose services for the time that they are on the DDS waiting list? And for how long would they wait for those services to be restored? All of these issues and questions would have a critical impact on my family and families like mine. So I respectfully urge you to maintain community first choice as it is and oppose any move to shift it to any other waiver program. Please look very carefully at any new process that will be put in place, and please protect the services that allow people with disabilities like my daughter to live full lives in their communities and give families the support they need to keep their loved ones safe at home. Thank you for your time and consideration.
Thank you. Matthew Rodriguez, you're up next.
Hello, is everything working properly?
Yep, we can hear you. Go ahead.
Okay,
You got 3
thank you.
minutes.
Good afternoon, honorable, sorry, words and nerves. Good afternoon, honorable members of the committee. My name is Matthew Rodriguez, and I live in Meriden. I work at Gilead Community Services, a nonprofit agency that helps people with mental illness and individuals in addiction recovery. And it is my privilege to represent both my clients and my fellow workers. I am here to speak on HB 5032 and urge to increase funding for community nonprofits like Gilead by at least $155 million for fiscal year 26. Over the last few years, we have seen a real change in how our nation views mental health care. Mental illness, slowly but surely, thankfully, is becoming more widely accepted as on par with physical illness. More and more, we urge our friends and family to seek professional mental health care instead of simply stigmatizing them or telling them to deal with it. Politicians around the country and here in Connecticut have spoken endlessly on the need to tackle the rising mental health crisis. which is good. Unfortunately, in Connecticut, this change of rhetoric has not been matched with an equal commitment to our mental health care infrastructure. And talk is cheap, speaking frankly. Private nonprofits that provide the bulk of the mental health care in our state are being funded at levels that are literally decades out of date. And the system is beginning to buckle under the strain. Where I work, the starting wage for a counselor with a master's degree is less than $20 an hour. Think about that for a second. Because Connecticut so severely underfunds mental health care, we have master's level caregivers making barely above minimum wage, which is it's ridiculous. The consequences of this should be obvious. Very few people are willing to stay long-term at that wage, no matter the dedication, and we have ample of that. So our staff are constantly changing, and our programs more closely resemble revolving doors. Clients are largely unable to build a working relationship with their caregivers because they don't even last a full year. That is not an environment that allows for the fostering of trust, and trust is the foundation of every relationship. What staff do choose to stick around are usually forced to pick up a second or even third job just to make ends meet. These people have families, children to raise, elderly parents to nurture, and these individuals who give so very much of themselves receive so very little in return. They stumble, they fall, and some of them even break, and there is no one to catch them there when they do. The bottom line is that the quality of care takes a nosedive, and everyone suffers as a result. It doesn't have to be that way. Connecticut is a very wealthy state with billions of dollars in surplus revenue every year. We are not being forced by circumstances to make difficult choices about the budget. Our state is actively choosing to underfund critical mental health care services. I urge you to make a different choice. There will not be a better time. Our state and our nation need leaders to step up now more than ever. Increase funding for our state's nonprofit mental health care providers and choose to make Connecticut a leader in the nation's fight against mental health care or mental illness. Thank you for your time.
Thank you. Up next is Alvina.
Good afternoon, respected members of the Appropriations Committee. My name is Alvina Suha. I'm a student at South Windsor High School and a member of the Youth Advisory Board of the Governor's Prevention Partnership. I'm here to testify in strong support of House Bill 5032 to urge you to continue and expand prevention funding to the maximum amount. As a student, I've learned that substance use and mental health struggles rarely look the way that we expect them to. Peers around us could be the most bubbly, energetic people we know. What most people don't see are the pressures around them, the influences of others, and the challenges that they may be facing at home. By the time that adults notice, the behavior is already there. In my environment, struggling often goes unnoticed until explicitly stated. There may be a concern, a check-in, a question asked, but all it takes is a student saying, "I'm fine," for the conversation to end. Not because adults don't care, but because we've built systems that wait for certainty instead of responding to risk. In Connecticut, this delay has consequences. Suicide remains one of the leading causes of death for young people, and youth overdose deaths, deeply connected to untreated mental health struggles, continue to rise. These are not separate crises. They are symptoms of the same problem, too many young people reaching a breaking point before support reaches them. I realize prevention often comes too late when people are already engulfed, when they believe no one is paying attention, no one cares, and no one will help. Prevention is the difference between stepping in early and responding after harm has already occurred. Through my work with the Governor's Prevention Partnership, I've seen what early intentional prevention looks like. As a Department of Mental Health and Addiction Services funded organization, GPP creates spaces where young people like me are trusted with honest conversations, even about topics that many consider taboo. I've seen adults listen to teens not as problems to manage, but as people whose experiences matter. That is what real prevention looks like. In closing, I respectfully urge this committee to continue and expand prevention funding to the maximum amount through HB 5032. This funding gives young people like me support before silence turns into suffering. Thank you for your time, your leadership, and your continued commitment to prevention in Connecticut.
Thank you. Up next is John Crystal. John?
Yes, thank you. Chairwoman Austin, Representative Walker, and distinguished members of the Appropriations Committee, it's a pleasure to testify before you once again. My name is John Crystal, and I'm professor and chair of the Yale Department of Psychiatry. Thank you for your continued leadership and for the strong collaboration between the state of Connecticut, the Department of Mental Health and Addiction Services, and Yale University through the Connecticut Mental Health Center. I am testifying today in support of the government's FY27 budget adjustments, specifically the continued funding and support for the Connecticut Mental Health Center, also known as CMHC. This year, we are proud to celebrate 60 years of this state academic partnership, a national model for delivering community-based behavioral health care, advancing research, and training the next generation of clinicians. At its core, CMHC cares for Connecticut's most vulnerable and underserved residents, providing recovery-oriented mental health and substance abuse treatment to thousands of individuals each year through programs such as early psychosis care, street psychiatry, culturally responsive services, and substance use treatment. From lithium to naltrexone, from clozapine to ketamine, CMHC's research programs have brought numerous transformative treatments to Connecticut. We are grateful for the state's leadership now in supporting the psilocybin-assisted psychotherapy pilot program, which reflects Connecticut's commitment to caring for individuals with treatment-resistant symptoms of illness. CMHC also plays a vital role in training the next generation of behavioral health leaders, educating clinicians who will serve communities across Connecticut, while strengthening the state's long-term workforce capacity. Finally, CMHC drives groundbreaking discoveries that are transforming psychiatry and fueling Connecticut's innovation economy, advancing new treatments, attracting private investment, and helping launch companies such as Biohaven Pharmaceuticals that create jobs across the bioscience sector, work made even more critical amid growing uncertainty in federal research funding. Sustained support in FY27 will ensure continued care for underserved residents, strengthen the workforce, advance therapeutic discovery, and support Connecticut's economic vitality. Thank you for your partnership and for your commitment to the health and well-being of the people of Connecticut. Thank you very much.
Thank you. Up next, Marlene Bodner.
Good afternoon, Senator Austin and esteemed members of the Appropriations Committee. My name is Marlene Bodner. I'm the Chief of Staff of the Kennedy Collective in Trumbull, Connecticut, a nonprofit serving more than 1,000 people with intellectual and developmental disabilities through day programs, residential services, employment, and social enterprises. We employ over 550 people. I am also the mother of an adult child with a disability served by a different provider in this same system. I'm here today as both. I want to thank you for the funding increase in 2025. It matters, and it is not enough. We are asking for $155 million in additional provider rate funding in fiscal year 2027. Here is the context. Connecticut providers went without a cost of living adjustment from 2006 to 2025, 19 years. Cumulative inflation over that period was nearly 59%. The 3% COLA last July was appreciated, and it closed less than 6 cents of that gap. The result, we cannot fill direct support professionals positions because we cannot pay competitive wages. We have families on wait lists calling us every month. We have deferred building maintenance until it becomes emergencies. Every cost, utilities, food, transportation has risen while our rates were frozen. We also ask that day and employment services receive equal treatment in any rate increase. Last year's budget favored residential services. For organizations like mine, day and employment programs are just as essential and just as underfunded. And as the federal funding grows uncertain, with proposed Medicaid and SNAP changes directly affecting the people we serve and their families and the people who work for us, the state's investment here is more critical than ever. Connecticut has always charted its own path, and we are counting on that. With $155 million, we fill vacancies, reopen capacity, serve people on our wait list, and expand employment for people with disabilities. That is what that money does. As a mother, I know what it means when the system works, and I know what it means when it does not. My son and thousands like him deserve a system that is financially sound enough to be there for the rest of their lives. Please support the additional $155 million, treat day and employment services equitably, and commit to indexing rates to inflation going forward. Thank you for your time and commitment.
Thank you. Up next is Joanna Schubert.
Good afternoon. Hello, distinguished members of the Appropriations Committee. My name is Johanna Schubert, and I'm the Policy and Advocacy Director at Hartford Communities That Care, as well as a member of the DPH Commission on Community Violence Prevention and Intervention, where I chair a subcommittee on statewide partnerships. Hartford Communities That Care is a nonprofit in the north end of Hartford. I'm representing our agency today and joining other advocates to underscore the importance of preserving the dollars allocated to the Department of Public Health's Commission on Community Violence Intervention and Prevention. Hartford Communities That Care started in 1998 with a youth program at Fox Middle School called Stump the Violence. Tensions that began during the school day were spilling out and leading to violence in the streets. We recognized that early intervention, mentoring, and supporting the whole family would be key to stopping this violence. As one of our young leaders says, youth development is violence prevention. Over the last 27 years, we've worked hard towards that goal. Today, Hartford Communities That Care supports 5 distinct overlapping programs that focus on our mission of creating a drug-free and violence-free environment. Our work has helped shape the national best practice model and is a contributor to making Connecticut a leader in violence prevention. Now more than ever, there are threats to the basic needs safety net that keeps communities strong and rates of violence low. What we've done in Connecticut remains a national model for investing in resources that provide real and tangible results in bringing rates of violence down. We've done this with the help of the legislature by looking at violence as a public health issue, and to that end, investing in the statewide Commission on Community Violence Prevention and Intervention at DPH. This year alone, thanks to the efforts of DPH and the coordination of violence prevention entities across the state, rates of violence are falling dramatically in our cities. In 2025, we saw a 50% reduction in homicides in Hartford, a 57% reduction in non-fatal shootings in New Haven, and fatal shootings were down 66% in Bridgeport as compared to 2024. This is the 4th straight year of violence rates falling. This translates to more birthdays, more graduations, more milestone moments for families, as well as more snow days and more opportunities for the mundane business of living, which too many take for granted. The work of DPH currently supports 18 dynamic programs continued to further bringing down rates of death and injury. We seek to maintain meaningful levels of consistent funding from the state to support the work of gun violence prevention and intervention. Our organizations are doing the work on the ground and on the front lines. The money allocated through DPH is a great first step, and we welcome it. Thank you again for the opportunity to testify, and I'm happy to take any questions.
Thank you. Up next is Sabrina Hosington. Sabrina.
Hi, thank you. Good afternoon. My name is Sabrina Hoisington, and I work for CUNE Employment Opportunities in Meriden. We provide day and employment services to nearly 500 individuals yearly. I want to thank you for the opportunity to testify today. I am here to request that you increase the funding for vital nonprofits like mine by an additional $155 million and ensure equal rate increases to all health and human services, including day and employment services. I'm here today not as an executive or a policymaker, but as a nonprofit employee. I work alongside dedicated professionals every day, and I see firsthand what these funding decisions mean on the ground. The individuals we support depend on consistent, high-quality day and employment services to live meaningful, fulfilling lives. These programs are not extras, they are essential. They give people purpose, structure, independence, and community. When these services are strong, individuals thrive. When they are strained, the impact is immediate and personal. I also see what my coworkers go through. Many of them, including myself, work multiple jobs just to make ends meet. We come to work tired, mentally drained, and physically exhausted, but we still show up. We show up because we understand that our people that we support are counting on us. We understand that their presence matters, the consistency helps, and someone maintains their skills, builds their confidence, or simply just has a good day. Yes, we find deep personal satisfaction in helping individuals live the fulfilling lives that they deserve, but too often that fulfillment comes at the expense of our own health and financial stability. Burnout is real, stress is constant, and sometimes it becomes too much. When staffing levels drop because people simply cannot afford to stay in this field, the consequences are immediate. We have had to ask individuals not to come in because we cannot safely support them. We've had to deny admissions when families are desperate for services. This is heartbreaking for them and for us. At the same time, unprecedented federal cuts not only hurt programs like ours, but also the social services that many staff rely on just to survive. When those supports are reduced, it makes it even harder for people to remain in these essential roles. By increasing funding to nonprofits by $155 million in fiscal year 27 and ensuring equitable rate increases across all health and human services, you are not just increasing reimbursement rates, you are helping stabilize a workforce that is stretched thin. You are protecting access to services for vulnerable individuals, and you are providing just a little more breathing room for the people who do this work every single day. We are grateful for the progress that has been made, but more needs to be done to ensure that the people providing these critical services can afford continuing to do so. Thank you for your time, your consideration, and your commitment to individuals and the families we serve.
Thank you. Up next is Arian Jangle.
Good afternoon, distinguished members of the Appropriations Committee and Senator Austin. My name is Arian Jangle, and I'm a sophomore at Rocky Hill High School. I'm also a member of the Governor's Prevention Partnership Youth Advisory Board, funded through the Department of Mental Health and Addiction Services. I'm here today in strong support of House Bill 5032, and to ask that prevention funding be continued and expanded to the maximum amount. I've personally seen how drinking, partying, and other risky behaviors have become normal for students my age. It might seem harmless at first, but prevention programs show us how quickly things can spiral out of control. Prevention isn't just about warnings or rules. It's about giving young people the guidance, support, and connections they need to make better choices before harm happens. I've seen this in my own school through leading a program called Rocky Hill Cares, where we host workshops to meet with local teens and ask them their experience with alcohol and drug abuse. Many of them say that it helps them relieve stress during midterms or many other stressful events they have during the school year. In Connecticut, overdose deaths have dropped to 772 in 2025, the first time in a decade that they've been under 800. That progress shows that programs like GPP saves lives. And when young people have trusted adults in their lives, they're 50% less likely to try drugs or alcohol. That one statistic alone shows the real power of mentorship, connection, and prevention. These programs also make sense financially. Every dollar invested in prevention saves at least $10 in future healthcare, emergency, and justice costs. But the real impact isn't just money. It's lives saved, families kept whole, and students able to grow up with opportunities instead of regrets. Prevention gives young people hope. It gives them mentors, guidance, and communities that actually care. Pulling back from funding now risks undoing the progress that's already been made and leaving students vulnerable to dangers that could have already been prevented. I'm asking you today to support House Bill 5032 because prevention is more than a program. It's a lifeline, it's a chance, and it works. Every connection, every dollar, and every program matters. Thank you for your time, your leadership, and for giving young people in Connecticut a safe, healthier, and brighter future.
Thank you. Valerie Williams, you're up.
Hi, my name is Valerie Williams. I work for Connecticut Renaissance, an agency that has several contracts with the state. We have locations in Waterbury, Norwalk, Stamford, Bridgeport, and New Haven. We provide gambling treatment, residential support, clinical, community support services for adults and adolescents who are struggling with substance abuse, behavioral health, and who may also have involvement in the criminal justice system. Thank you for the opportunity to testify today. I'm grateful you did not cancel or reschedule. I planned for this today and probably could not have made a reschedule. I am here first to thank you for the increases included in the FY27 budget and to request that you increase funding for vital nonprofit programs like ours by $155 million in FY27. I know this sounds as if I am not grateful, asking for more, please. However, it is important to take into account that state contracts for social services have been underfunded for decades. I know this because I first worked at Fairfield Hills Hospital, then 30 plus years at Keystone House in Norwalk, and now 3 years with Connecticut Renaissance. I also know this through my sister, who is developmentally disabled and has been receiving services from the Kennedy Collective for over 40 years. This means I have experience with DEMIS, CSSD, DOC, DDS, and DSS. And I can tell you the service system is crumbling. Agencies are trying hard to hold on. Some programs have already closed. At Connecticut Renaissance, We closed an outpatient clinic this year, and we closed another one last year. We couldn't find clinicians. We have trouble hiring cooks, caseworkers, and administrative staff. Candidates, once they hear the job responsibilities and the pay rate, generally don't show for the interview. My sister receives day support services at the Kennedy Collective. To save money, her program is being moved farther from her town, which means a longer transport ride. There are some disabled clients at the Kennedy Center that are on the transport van for over an hour every day each way. I testify every year, often talking about paying the frontline staff a livable wage. But we also must remember that it takes managers, supervisors, licensed social workers, accountants, cooks, facility maintenance professionals, IT staff, chart auditors, directors, coordinators, CEOs, CFOs. Drivers have to have CDLs to effectively and efficiently operate a multi-million-dollar agency that provides these vital services for Connecticut citizens. We must be able to recruit, hire, and retain quality staffing at all levels. It is heartbreaking when a senior and executive level staff leave to work for higher pay in private industry or for the state. For my sister, who is a client, it turns her world upside down when staff changes. Losing a van driver she knows and trusts for her means she may not want to get on that van. Connecticut has always charted its own path. I am a proud resident of Connecticut, and I know nonprofits have benefited greatly from the bipartisan support of members of this committee. Our state has the ability to fund and strengthen services like ours. Please support increasing the funding for nonprofits by $155 million in FY27. Thank you for this opportunity to testify.
Thank you. Up next is Richard Rothstein. Richard.
Good afternoon, Madam Chair and members of the Appropriations Committee. I'm Richard Rothstein of West Hartford. I am a steering committee member of the Connecticut Profound Autism Alliance and the co-guardian of my son Spencer, who has profound autism. He has lived in GDS group homes operated by private providers since 1991 and will continue to require 24/7 one-to-one supports for the rest of his life. Our family is extremely grateful for these supports, and I have been advocating for individuals with intellectual disability and autism since the 1980s. I testify here because those with profound autism, including our loved ones, are otherwise voiceless. As you've all heard today, the staffing crisis continues, especially in programs that serve those with higher needs, such as for those with profound autism. We are thankful for progress to increase funding in the current state budget and for the last few state budgets. There are many individuals who need the 24/7 one-to-one supports that Spencer receives, but are unable to reach them because of an inability of providers to attract and retain qualified DSPs. In the North region, as Commissioner Sheff reported this morning, DDS has twice published notice of opportunities for 2 group homes to serve individuals with profound autism who are aging out of very expensive out-of-state residential schools this school year. In both requests for opportunity, no providers submitted bids to serve these individuals. Why is that? We need to find out and fix it. Staffing issues all come into play when addressing an explosion in the number of reported abuse and neglect cases of those with autism and/or intellectual disability. These are found from even the best providers in the best homes, in the best day programs. It is my understanding that the number of reported cases have tripled since just before COVID. Why is that? Let's find out. There are likely many, many more that aren't reported. Few make the press or electronic media, but in my written testimony, there will be attached an article from WTNH on one such incident which recently happened in North Branford. Shouldn't our most vulnerable be safe from abuse and neglect? We need to take additional steps to minimize abuse and neglect, and let's move to the point of preventing abuse and neglect. There's evidence in the recent case and in others that some of the most important safeguards in the screening and hiring process are not working. As is often said in the disability community, there's nothing for us without us. Family members like ours need to be involved as the entire abuse and neglect system is reviewed and revised, not just by DDS and its providers. Thank you very much for your attention, and look forward to working with you the rest of the session.
Thank you. Up next is Heather Gates. Heather?
Good afternoon, Senator Austin and members of the Appropriations Committee. I'm the President and CEO of Community Health Resources. CHR is a large freestanding behavioral health provider in the state of Connecticut for all ages. Our mission is inspiring hope for individual and community well-being, and our vision is that every life will get better, but we need your help in order to fulfill our mission and vision. Thank you for the opportunity to testify, and I want to thank you for the increases that you included in the bill for FY27. But unfortunately, funding for behavioral health services has not kept pace with other sectors. Our funding from DEMAS has remained flat for this year, and there are no new programs being initiated. Adults with serious mental health and substance use issues are being left out of the state's priorities. We had to eliminate 4 positions to give raises to our lowest paid staff this year. We need funding for case management and peer support services. Clients are more likely to stay engaged in treatment when they have an engagement specialist checking in with them. And there's a desperate need for more supervised housing and support for those who are homeless. 140 to 150 adults come to our front door every week asking for help, yet our services have not seen increases to support this in years. In fact, some of them have been reduced regardless of the need. We reach the conclusion again that individuals with mental health and substance use challenges do not have equal access to care and are not a priority in Connecticut. We have a contract with DEMAS to provide support to individuals in emergency departments and to connect them to care. It's called the MHED RSS program, and the annual cost is $1.6 million. Supports 10 staff who are based in emergency rooms, and it is not funded past June, and so we would be eliminating that program. We are facing unprecedented uncertainty about federal funding for critical programs. Low reimbursement rates compound these effects and impact our ability to hire and retain qualified staff. We recently experienced the turmoil of the cancellation of our SAMHSA grants, but fortunately the bipartisan effort restored them. We really should not have to depend on federal funding for essential services in Connecticut. I want to thank you for your efforts, and we appreciate your support.
Thank you. I have to go back to Neha Shanavaz. I'm sorry, I said your name wrong.
You're completely okay. Good afternoon, respected members of the Appropriations Committee. My name is Neha Shanavaz. I'm a sophomore in the Special Program in Medicine at the University of Connecticut and a resident of Bloomfield. Thank you so much for the opportunity to testify today in strong support of House Bill 5032 and the continued and expanded funding of substance misuse prevention efforts in Connecticut. My journey in prevention began after a tragedy shook my community. A 13-year-old student named Ethan lost his life to a fentanyl overdose inside our school. A place that was meant for learning and growth became the site of unimaginable loss. This loss is what ignited my passion for prevention. I joined the Governor's Prevention Partnership Youth Advisory Board, a Department of Mental Health and Addiction Services funded organization dedicated to strengthening youth prevention across our state. Through this work, I have helped lead initiatives such as the Prevention Starts With You campaign, which distributed nearly 60,000 drug deactivation pouches, preventing the misuse of over 2.6 million pills. I have testified before this legislature before, advocating for policies that make prevention tangible and accessible, including legislation that provided free drug disposal pouches with prescriptions. Seeing those pouches available at my local CVS was proof that prevention policy works. In 2 weeks, I will be attending the United Nations Commission on Narcotic Drugs to engage in global prevention discussions. As I prepare to represent youth voices in those conversations, I am proud that Connecticut has built a prevention model worth sharing, but that leadership depends on sustained and expanded investment here at home. Prevention works when it's funded, it works when it's proactive, and it works when youth voices are empowered and mentored. The Governor's Prevention Partnership has given young people like me the mentorship, platform, and support necessary to turn our concerns into action. Prevention is not a temporary initiative. It must be woven into our schools, our communities, and our systems. This requires continued and expanded funding under HB 5030. Substance misuse and overdose continues to impact families all across Connecticut. The crisis has evolved, and so must our response. Continued and expanded prevention funding ensures that organizations like GPP can reach more students, distribute life-saving resources, train youth leaders, and strengthen protective factors before tragedy strikes. I stand before you today not only as a student, but also an advocate and as someone who has witnessed the cost of inaction. Prevention is an investment in lives saved, families protected, and futures preserved. I respectfully urge you to support HB 5032 and continue and expand prevention funding to the maximum amount possible. Thank you so much for your time, your leadership, and your commitment to Connecticut's youth.
Senator Marks, I'm turning the floor over to you.
Thank you, Madam Chair. Next, Dr. Daniels, I believe.
Number 55, Daniel Green.
Oh, I'm sorry. I thought she'd show up or he would show up.
He's there. I see him.
Daniel Green, there it is.
Danielle has been
Green.
having issues joining on and off today, so I'm not sure if she can hear us.
We can go on to 67, Charles Garner, while we figure that out. See you soon.
Hello, my name is Charles P. Garner, RCP. I am in support of CCAR, the House Bill of 5032. I am a resident of New Britain, Connecticut. I want to speak solely and honestly from the heart. I am previously incarcerated, mostly contributed by my substance abuse. From that time, I entered prison. I found a different way of living through faith, but also through recovery, which CCAR has been huge support about that through that. And through that system and through all the training that I have gone since the Recovery Coach Academy, I have further enlightened myself and heightened my capabilities to become a recovery coach professional. As a recovery through CCAR, I've gained immense positivity for myself, for others, but the main thing is that I was part of the process of rehumanizing others and supporting others in no matter what situations they go through. And through CCAR, I've been able to utilize people as resources. I've enhanced my listening skills, but as most of all, being able to manage my own stuff. And then from there, I'm able to ask other people direct questions and ask them how I best can be, but as well how CCAR can support them. Throughout my endeavors through CCAR and the initiative CCAR training, I learned the components of core values and guiding principles of recovery. My forthcoming career in the human services field will enable me to assist others positively and productively to deal with stress. Going above and beyond, CCAR has also helped me be able to be of service in the community, to be a boots on the ground person. I personally have witnessed a few days ago someone that was actively using fentanyl, and the best thing that I could do was pay attention and be on guard with a can of Narcan that I had in my bag, which I was also provided through CCAR Center, HRCC, which is on 75 Charter Oak Avenue. Throughout that, I have been a part of a huge family now. I have family members, but I call CCAR is truly my family. They have uplifted me, they have guided me and supported me in everything that I have done, as well other recoveries. I do support that. Yes, money is a key component, but the truth of the matter is, it's the boots on the ground and it's the tender and loving care that CCAR provides, as well other recovery coaches. I just definitely ask that everyone puts forth their
Charles,
side
if you
differently.
could wrap up, that would be great.
Thank you. But I would like to testify that funding is definitely available for the rest of us to all be on boots on the ground and for CCAR to further enhance their service in recovery coaching. Thank you.
Thank you. And next we have Adrian Benjamin.
Hello. Is this working? Hi.
Yeah, it's working. We hear you.
Hello, Senator Marks, and thank you to all the Appropriations Committee members for your diligence, attention, and fortitude today. My name is Adrienne Benjamin. I live in Madrid. I'm here both as Zoe's mom and also as the chair of the Profound Autism Alliance. My daughter is 29 and has the most severe form of autism, profound autism. She's nonverbal and needs help with virtually everything. She's happiest watching the Wiggles and listening to songs like If You're Happy and You Know It, Clap Your Hands. Fortunately, I am lucky, our family's lucky. Zoe receives both day and employment services, residential services, I should say, from HARC. I am incredibly grateful to DDS, to HARC, and to the Appropriations Committee for this funding. Unfortunately, there continues to be too many individuals who are not getting these essential services. And I want to highlight some data from DDS. There's 99 people currently on the emergency waiting list. Now, emergency means what you think it means. To quote, this is a quote from DDS policy. The individual is at imminent risk of causing permanent harm to themselves or others. So we have 99 people still at home who should not be home. They should be in residential services. In addition to that, there's another list, the urgent list, which is less serious, less severe. There's 699 people on the urgent list. And why is this? Well, we've heard about it all day and afternoon, the staffing shortages. I've been coming here since 2013, and every year parent advocates like myself and CEOs of offices explain the important need to raise the rates at the agencies and to raise the pay of direct support professionals. And this is even more critical for those with profound autism, because those with profound autism almost always require one-to-one ratio of services. Two of my very dear friends right now have been rejected again and again by different agencies because of the severity.
Adrian, if you could wrap up, we'd appreciate it.
Okay. I know there was an increase in pay last year, but it didn't seem to result in an increase in the pay of the DSPs. So, they are the essential people to keep DDS running. Without them, there is no DDS. The turnover rate is awful. At my daughter's home, she's been there 5 years. There's no person there that's been there more than a year. Lastly, I just want to agree with the many people who've said, please, please adjust the budget to increase the $155 million to make progress to solve this chronic problem of understaffing so more people can get the services they actually really do need. Thank you very much.
Thank you. I think I told you to stop too soon, and I apologize. I did. I mean, yeah.
Let's see.
I so apologize. Thank you.
But I think you got my point.
I did, and I remember you from last year. Thank you so much.
Good to see you. Take care.
You too. Bye-bye.
Bye.
Next we have Mark Griffin. Is Mark Griffin here?
I don't see him.
Nope. Michael Fizzle is on. So Michael, why don't you, Michaela, why don't you go right ahead?
Good afternoon, evening. Hi, it's nice to see you. I have stopped my vehicle so I could testify this afternoon to pick up my kiddos. And so here we are. I am respectfully requesting that folks here on the Appropriations Committee consider allocating $25 million to support peer recovery services. My name is Michaela Fissel, and I serve in the role of Executive Director at Advocacy Unlimited. AU is the leading nonprofit provider of holistic peer-led recovery resources specializing in mental health, addiction, and trauma recovery. We serve over 13,000 people annually, and peer support was actually deemed an evidence-based practice in 2007 through the Centers of Medicaid Services. And there are both measurable benefits that lead to long-term well-being and cost savings. With those $25 million, I am asking that we consider allocating not only those dollars, but also creating a line item in the state's budget. Mental health became a priority for the state through your leadership in the 1950s. And then in the early 90s, we saw the integration of substance abuse and addiction as a secondary priority, integrating both of these under the newly created Department of Mental Health and Addiction Services. Prioritizing peer support is taking the next step and leading our state into the next chapter of innovative, comprehensive recovery services that will lead to both the benefits that you are looking for and the cost savings that are being asked for by so many. In fact, you can see in the testimony that provided, there's a $2, I think 81 cents return for every dollar invested into peer support. As you've heard from many of my colleagues, you can see that peer respites are an ask. Also, recovery support specialists, as referenced by Heather Gates, that's the emergency room RSS program. We actually provide that training. And there are so many peer support workers around the state who are ready to become gainfully employed and give back in this way. And that $25 million investment will go so far in supporting the community of Connecticut as they navigate and negotiate mental health, addiction, and trauma recovery. I do ask that this dollars be allocated and safeguarded. My only point that I'd like to just make is that I also would really appreciate it if the legislator would take a lead in actually defining the total amount spent on peer support. This information is not publicly available through either budgets or other available public documents, and it would be helpful in determining what the investment strategy will be.
Michaela,
So
I'm
thank
sorry,
you so
but
much.
your time is up. Okay, thank you for testifying.
Yeah, have a good day.
Next, we have Kelly Lindsay. Is Kelly Lindsay here? Michelle, you're on, so you're going to go next. Welcome, Michelle.
Thank you. Good afternoon. I'm Michelle Heimel, Director of Health and Operations at Horizons. Thank you for the opportunity to testify in front of the Appropriations Committee. And thank you for working to ensure the budget supporting individuals with developmental disabilities is preserved and increased for fiscal year 27. Sustainability for nonprofit organizations is extremely important. While these increases are positive, it does not allow us to be fully whole. And as many people have noted today, staff are the backbone of what we do. It is critical that we are able to keep pace with other industries in hiring, training, and retaining these staff. Many nonprofits are still in the position of fundraising large portions of annual budgets for expenses beyond the staffing, and opening up bond funding could help in this area as well. Over the 35 years that I have worked at Horizons, I have seen hundreds of families struggling to find supported living, employment services, and respite. Requests for services continue to come. The ability to provide the services continues to be limited by our capacity and by our staffing. These funds will have a measurable impact on the ability of organizations such as ours to provide these opportunities, which not only serve the individuals, but the families and the communities that we live in. Please continue to support these increases for our community and for the nonprofits that serve the individuals.
Thank you for your testimony.
Thank you.
Next, we have Tiffany Moss. Is Tiffany Moss here? Yep. Welcome, Tiffany.
Hi, how are you? Good afternoon, good evening, Senator Marks and distinguished members of the Appropriations Committee. My name is Tiffany Moss, and I am a resident of Oakdale, Connecticut. I am also the volunteer manager for the New London Center, Connecticut Community for Addiction Recovery, more commonly known as CCAR. I'm here to show my support in its request for the $1 million increase in funding through the DMIS for recovery coaching and recovery community center services. I've already submitted my written testimony, so I'm just going to kind of provide you information on what the community center provided to me other than employment. The Recovery Community Center was a pivotal part of my own recovery journey. When I first walked through the doors, I needed more than clinical treatment. I needed connection, accountability, and hope. Through peer support and recovery coaching, I found people who understood my experience and helped me rebuild my life one step at a time. Because of these services, my life today looks completely different. I am a homeowner. I have meaningful, fulfilling employment. And most importantly, I am able to provide stability and opportunities for my daughter, creating a secure foundation for our family's future. The support I received did not just impact me, it strengthened my entire family. The recovery support centers are essential to recovery. They help individuals move beyond crisis and into stability, employment, and community engagement. They reduce relapse risks, strengthen families, and contribute to a healthier workforce and a stronger community. I am living proof that these services work, and an investment in CCAR is an investment in families like mine. I do appreciate all of your time. Thank you so much.
Thank you, Tiffany, for all you do. Thank you. Next we have Geraldine. There you are, Geraldine Reddick.
Thank you. Good afternoon, senators and members of the Appropriations Committee. My name is Geraldine Reddick, and I am employed as a program specialist at CUNY Employment Opportunities in Meriden. I am here today because I deeply love the individuals I support, but I am struggling to survive financially in this profession. In a day support setting, we do much more than supervise. We help the individuals build life skills, practice communication, increase independence, learn work ethics, and develop meaningful relationships. We assist with personal care, medication administration, behavioral supports, transportation, meal preparation, documentation, and crisis prevention. We are responsible for their safety, dignity, and growth every single day. Direct support professionals are the backbone in this field, yet we are severely underpaid. The cost of living continues to rise. Rent, groceries, gas, utilities, but our wages do not reflect the level of responsibility we carry. Some of us work multiple jobs just to make ends meet. I stretch every penny. I calculate every bill. There are times when I have to choose which expense gets paid first. I love what I do. I love being part of their growth. I want to continue building my career in this field. Recently, I wanted to go back to school and to advance and take on leadership roles so I can make an even bigger impact, but I cannot afford tuition. The very field I am passionate about does not pay enough to allow me to grow within it. I recently watched a dedicated coworker leave this field. She absolutely loved the individuals we served. She made sure they were safe, engaged, and treated with respect every day, but she could not afford her living expenses. She had to choose financial stability over the work she loved. Our individuals lost someone they trusted. Our program lost experience and consistency. Individuals thrive on routine. Sorry, guys.
That's all right. You're doing great.
Something just happened to my computer. Oh, sorry. Individuals thrive on routine, trust, and relationships. When staff leave because wages are not sustainable, it disrupts progress and stability. It affects safety and skill development. We are not asking for luxury. We are asking for livable wages. We are asking for funding that allows agencies to pay direct support professionals fairly for the essential work we provide. We are asking for the ability to stay in the careers we love without sacrificing our own financial stability and well-being. Thank you for the opportunity to provide my perspective. Please support increasing funding for community nonprofits.
Thank you for your testimony, Geraldine.
Thank you.
Next, we have Allison Zonka. Hi, Allison.
Hi. Good afternoon, members of the Appropriations Committee. I hope you're all staying warm and safe in this blizzard. My name is Allison Chonka. I serve as the Senior Director of Development and Communications for Bridges Healthcare. Through our more than 20 different behavioral health and prevention programs, we serve approximately 9,000 residents of all ages in Milford, West Haven, Orange, and surrounding communities. I, like many others who have spoken today, am here to truly thank you for the increases included in the enacted budget for FY27, and to also request that you increase funding for vital nonprofit programs like ours by $155 million. Why are we asking for more? Well, unfortunately, years of stagnant funding our industry faces constant funding challenges. These include the need to offer competitive pay as costs of living continue to rise, reimbursement shortfalls, and ongoing and unprecedented shifts in federal funding. To underscore this uncertainty of federal funding, I'd like to share what happened to us only a month ago. On the early morning of January 14th, Bridges Healthcare was notified that 5 out of our 6 SAMHSA grants had been terminated. That is an annualized total of $1,370,000 in cuts in one night, no notice. This was after a year of already reviewing, scrubbing, making sure we were in compliance with new executive orders the year before. And while those cuts have now been rescinded, here are the details of the 5 grants that were momentarily gone, leaving us scrambling. First, our trauma-focused school-based outpatient therapy, which serves 441 students and family members who are affected by trauma and would have affected 7 staff positions. Under substance use, the grant for expansion initiative for a medication-assisted treatment for those struggling with prescription drug and opioid addiction, which serves 266 individuals annually and potentially cutting 4 full-time and 4 part-time staff positions. 3 prevention efforts, our mental health awareness training, which has 1 full-time staff member who trains more than 300 individuals annually. 2 Stop Underage Drinking grants, which supports the work of 2 staff members who run the Milford Prevention Council and the West Haven Prevention Council. These harmful and erratic cuts and threats are not only unnecessary, but also add chaos and uncertainty to a community health safety net that is already so fragile. Connecticut has always charted its own path, and our state has the ability to fund and strengthen services like ours so that even when our safety net stretches, it will not break. So please support increasing funding for community nonprofits like ours. Thank you so much for this opportunity to testify and for your support now and in the future.
Thank you, Allison. We're going to go back now to 75 and 76. Erin Crandall and go Erin Gasparini and then Jeff Crandall.
Hi.
Go, Erin. Your turn.
Okay. Good afternoon, Madam Chair and members of the committee. My name is Erin Gasparini. I am the Chief Program Officer for CUNE Employment Opportunities, an agency who supports individuals with mental illness and intellectual disabilities. Every year, I testify to share a perspective on why funding is so important for the people that we support. I've shared the stories of success, which are endless and truly show with the support of a community you can bring about change. I've also shared the real struggles of CUNE staff to help tell the story of the challenges that they face in a field supporting Connecticut's most vulnerable. This year, however, I am struck by how upset I am that this needs to be the process year after year. I am upset that in order to secure funding for nonprofits that support people with disabilities, I need to ask my staff to disclose their personal living situations and financial hardships. I'm upset that people who dedicate their lives to service must bear their struggles as proof that the system is broken, when the brokenness is already well known. I'm upset that CUNE staff, talented, compassionate professionals, are forced to work multiple jobs just to pay their bills to support their families. These are not entry-level workers passing through. These are skilled people doing complex, emotional, and demanding work in the field that they once loved. However, they come to work exhausted and burned out, not because they lack commitment, but because the commitment alone does not pay rent, cover healthcare, or put food on the table. I'm upset that our participants, people with disabilities, are too often marched out to display out on display to justify funding, as if their existence must be constantly proven worthy of investment. This practice is dehumanizing. It forces nonprofits to participate in a cycle that borders on exploitation simply to access the resources needed to provide basic, dignified support. I want to work in a system who values what we do because it's the right thing to do. I don't want to force caregivers and participants to relive their challenges publicly in order to beg for funding, while recognizing that with every ask made to staff leaves them humiliated and wondering if this is in fact the field they want to remain in. As I myself am facing a year of uncertainty due to health challenges, I think about what it would be like if I too had to beg the hospitals for the opportunity to receive care. If I had to publicly display the sacrifices that my family will be forced to make just to be approved for medical treatment that I will need. If my pain, my prognosis, and my family's stability had to be put out on trial in order to be deemed worthy of help. That is what we ask people with disabilities and the nonprofits that serve them every single day. I'm upset because the system can be better, and I'm speaking because it must be. We do not need more stories of struggle. We prove the need. We need adequate, sustained funding that honors the dignity of the people we serve and the people who serve them. Anything less is a choice and is one that we can no longer justify. Please support increased funding for community nonprofits by $155 million in fiscal year 27. Thank you for the opportunity to testify. Thank you for your time and attention.
Thank you, Erin. Next, we have 76, Jeff Crandall, followed by Rebecca Peel.
Hello?
Hi, Jeff. We hear you. I can't see you.
Can't see me. Okay.
Uh,
Is it coming?
It looks like there's an error with the camera.
Okay.
Oh, there we
There
go.
you go.
Here it comes. Nice. Thanks. Thanks.
There you go.
Good afternoon, Senator Marks and the other distinguished members of this committee. My name is Jeff Crandall. I'm the Director of Programs for CUNY Employment Opportunities. We provide employment and day program support to individuals in programs funded by the Department of Developmental Services and the Department of Mental Health and Addiction Services. Thank you for the opportunity to testify today. I'm here to thank you for the increases included in the enacted budget for FY27 and to request that you increase funding for vital nonprofit programs like mine by $155 million in FY27. As you've heard many mention, recruitment of new staffing has been a major challenge for programs like ours throughout the year. In our DEMIS-funded programs, all of our staff, including the managers, often have to carry caseloads much larger than would be recommended by best practice levels to ensure that we continue to provide services to the people in our programs. This decreases the amount of time that they can spend with each individual and risk burnout of the remaining staff. In our DDS-funded programs, program managers, program specialists, other staff are regularly being pulled from their normal job duties to provide direct care support to deal with staffing shortages. And even with these measures in place, it's still sometimes necessary to cancel services for some of the individuals to ensure that we maintain the required staffing ratios. I recently had the opportunity to locate a new job for one of the individuals in our program who had been in our group support employment program. She was able to land her first independent job out in the community at Amazon. And she made more than most of the staff at our program. And they see that. They're happy for her. They're very excited for her, but they realize that, how much they're struggling already to make ends meet and seeing that, maybe they can't afford to stay in the field that they love. If the final budget was to provide the increased funding, we'd be able to start addressing some of these concerns. We can show staff that their work is valued and retain these high-quality staff who have built a rapport with the people we serve and developed the skills to assist them in meeting their employment goals. So again, please support increased funding for community nonprofits by $155 million in FY27, and thank you for the opportunity to testify.
Thank you, Jeff. Rebecca Peel is next, followed by Latia Maldonado.
Good evening, Senator Marks and esteemed members of the Appropriations Committee. My name is Becca Peel, and I'm the Community Relations Manager at Mosaic. Our nonprofit organization provides home and community-based services, including 24-hour residential supports to individuals with intellectual and developmental disabilities. We support more than 200 people to live their best lives with a team of 400. Thank you for the opportunity to testify today. On behalf of the individuals we support and their families, I want to begin by expressing our sincere gratitude for the funding increases, including in the enacted budget for fiscal year 27. This investment shows that the committee recognizes the essential nature of the work performed by nonprofit providers of services to individuals with disabilities. While we are grateful for these recent steps forward, we respectfully request increased funding for vital nonprofit programs like Mosaic by $155 million. I'll echo the words from fellow providers and share that additional funding is not just a request for more, it is a request for sustainability. With additional investment, we can close the wage gap and bring direct support professional wages closer to a true living wage, reducing staff turnover and the reliance on costly overtime and agency staffing. And that can improve the lives of more people like my friend Amanda. Amanda was born with cerebral palsy with severe intellectual disabilities, and at that time, the immediate family said they did not want her. Luckily, her aunt stepped in and created a new loving world. Amanda learned ways to communicate through her smiles and sassy nature. She enjoyed family camping trips and her time with new classes and programs. She came to Mosaic after her aunt passed away. Her father figure Ken tried to care for her by himself, but recognized how his own health prevented Amanda from living her best life. Like any new home, there was a learning curve to help Amanda, but now she has found a real home with her housemates. The smiles and sassiness continue, with teasing staff about who she prefers and sharing how she wants to be treated like a queen bee. Ken is grateful that Amanda is in a program with staff who respect her, are consistent, and recognize any change in condition. For all people, trust is established when there is comfort and stability. For our most vulnerable friends, trust is essential to make sure we defend their right to a meaningful life. The team at Amanda's Home and all nonprofit providers deserve a living wage that represents the value in that trusting relationship that is built. An hourly wage value that the National Core Indicators, Intellectual and Developmental Disabilities, State of the Workforce 2025 survey shares Connecticut is shy by $6.17. The progress made in the budget is a beacon of hope, but we cannot stop here. We urge the committee to increase funding for community nonprofits by $155 million in fiscal year 2027. Thank you for your time, your compassion, and your continued support of our community.
Thank you, Rebecca. Latia Maldonado? Hi.
Hi. Good afternoon, Senator Marks, Senator Austin, Representative Walker, and honorable members of the Appropriation Committee. My name is Latia Maldonado, and I'm a direct service provider. I work every day by supporting people with intellectual disabilities, and I'm here to ask you to increase the funding for the Department of Developmental Services. Right now, the system that supports some of our state's most vulnerable residents is running on exhaustion. Tired workers, strained services, and individuals whose quality of life has steadily declined. The need is growing, but the resources are not keeping up. I've worked in the field for more than a decade and currently serves individuals through Oak Hill. But this wasn't always my career. I spent years as a chemist, and I had financial stability and a predictable future. I chose to leave that behind because I wanted to do work that mattered, to support people who depend on others for their daily living and dignity. What I have found was a system that pushed to its limits after years of insufficient investment. Services continue only because workers care deeply about the people they support, often at a great personal cost. Underfunding does not stay on paper. It shows up in people's lives, including mine. It shows up when one job, so I'm sorry, where one job sustain, let me start again. Where one job once sustained me, now three barely do. I support children with intellectual disabilities during the day. I work in residential care in the evenings and provide personal care on the weekends. I work 7 days a week with no real break. Even so, I faced homelessness. I've lived in my car with my daughter while working a full-time job. I constantly worry about how to pay my basic bills. After years of this pace, I am physically, emotionally exhausted, but I keep going because of the people I serve who depend on me. And they're feeling the effects as well. There was a time when individuals received rich, consistent support, fresh meals, meaningful community experiences, trips, and long-term relationships built in trust. Today, budgets are tight, staffing is unstable, and opportunities are limited. Processed meals replace home-cooked meals. Community engagement is reduced. Vacations are rare. Staff turnover is constant. Stability, the foundation of good care, is disappearing. This decline did not happen overnight, and it did not happen by accident. It is the result of years of funding decisions that have gradually weakened both the workforce and the services people rely on across Connecticut. But funding decisions can also repair what has been worn down. Investing in DDS means strengthening the workforce, restoring quality services, and ensuring that the people with intellectual disabilities have real opportunities, not just basic survival, but meaningful, fulfilling lives. You have the ability to make the investment now, so I urge you to increase funding for DDS and rebuild the system that so many people depend on every single day. Thank you.
Thank you, Latia. Appreciate your testimony.
Thank you.
Next, we have Paul William Palmer Sr.
Hello?
Paul, are you here?
Yeah, I'm here. Can you hear me?
We hear you. We don't see you, but if you want to go ahead, that's all right.
All right, I get that video.
Up there. Oh, I saw you for a second. There you
There
are.
it is. Okay. Yeah. All right. Here we go.
Hi, Paul.
Yeah. Thank you, members of the Appropriations Committee. My name is Paul Palmer, and I work closely with Thomas Burr of Miami and Kathy Flaherty, Connecticut Legal Rights Project. We do collaborative work on behavioral health patients' rights and legislation to increase patients' rights. And I'm testifying today in regards to HB 5032 to adjust the state budget ending June 30th in support. The funding that we need for projects like the peer respite would be apparently included in this. And peer respites are something that is a positive change in behavioral health, because instead of using inpatient hospitalization, it actually reduces it by 70%. Now, the advantage of this is it saves money from the state budget. Most of the people that go into these behavioral health hospitals are usually on Husky or some type of Medicare or Medicaid. And the other advantage to the peer respites is 94% of people return back home to family or friends instead of staying in a hospital for lengthy stays. Now, traditional mental health services conversations about suicide, self-injury often result in forced treatment, causing many people to avoid future services. And this can have a very detrimental effect. And many times they say it's 100 more likely than average to die by suicide following discharge from one of these in-hospital stays. I personally was in a hospital stay 10 years ago, and I can testify that I never want to go back there again. It's the last place in the world I'll ever go. I will never go there again, because it is a dehumanizing experience, taking all your human rights away. And even though we have a patient's bill of rights, they ignore it because there's nobody to actually enforce it. It's like the fox watching the hen house. They're on the honor system. When you complain to the health department, they tell you, well, we're just not going to investigate. And that's what they did with me. And so this is a much better option and is a better use of state funding. Right now, there's only one place, which is the Gloria House, and it's in New Britain, and they have 7 more in the wings, but unfortunately, there's no funding for it. So this bill would probably increase the funding and able to do that. The net savings could be millions of dollars in the state of Connecticut. Also, patients tend to be traumatized in inpatient, whereas the respite houses are just the opposite. And so I'd like to conclude by thanking you and asking that you support this and hopefully include $7 million in funding for the respite houses. Thank you.
Thank you, Paul. Next, we have Sarah Wilcox, followed by John Miel. Hi, Sarah. Welcome.
Hi, good afternoon, Madam Chair and members of the Appropriation Committee. My name is Sarah Wilcox. I'm a member of Community Health Center's Center for Key Populations, and I'm someone who works face-to-face with the consequences of the decisions made in rooms like this one. Every week, I meet people surviving conditions most of us can't imagine. Homelessness is the outcome of housing that costs more than people earn, and systems stretch beyond capacity. When we say homelessness has increased 44% since 2021, those aren't abstract numbers to me. That increase has a face. It's the man apologizing because he hasn't had access to a shower. It's the grandmother raising her grandchildren in a motel room. It's the person refusing shelter in freezing weather because untreated trauma makes crowded spaces feel unbearable. We can't treat mental health in isolation from housing. Stability is the foundation of recovery. Without sleep, without safety, without an address, medication adherence drops, therapy becomes inconsistent, and employment becomes impossible. Housing isn't just shelter, it's dignity. It's the ability to regulate, to plan, and to breathe. Homelessness isn't just urban, it's everywhere. It's hidden in cars, it's doubled up living situations, it's places our data doesn't fully capture. The crisis is deeper than it appears on paper. We're already paying for this crisis in emergency rooms, inpatient hospitalizations with law enforcement and shelter overflows. These are all reactive systems. Prevention is cheaper. Stabilization is cheaper. Rapid rehousing is cheaper. Peer-run respites cost 1/10 of an inpatient stay and offer something hospitals can't: shared understanding, dignity, and trust. That's fiscally responsible and that's humane. I appreciate the current proposal acknowledges the problem, but the acknowledgement isn't aligned with the scale of the need. If we underfund this moment, we're choosing to manage suffering instead of reducing it. Increasing House Bill 5032 to 123.9 million annually isn't extravagant. It reflects what it costs to reverse a 44% increase in homelessness and build a coordinated response. Connecticut has the capacity to lead. We know what works. Providers are ready. The question is, will we meet this crisis with the scale it demands? I urge you to fund prevention, fund response, fund housing, fund the remaining 7 peer-run respites. Because when we invest in housing and community-based mental health care system, we aren't funding programs. We're funding stability, recovery, and the possibility of a future. Thank you for your time today and the responsibility you carry in making your decision.
Thank you, Sarah. Next we have John Miel and then Chantel Archer. Welcome, John.
Good afternoon. Thank you so much, Madam Chairman. My name is John Cabot-Neely, and I moved up to Wallingford about 2 years ago from Florida, and I'm in Rushford in Meriden. I'm a client with Rushford in Meriden, as well as a client with the CUNE Employment Opportunities Program. I have been listening to this, and I have learned so much about so many programs that Connecticut provides. I moved up here from Florida. Florida has nothing compared to this. If you want inpatient, you're going to pay for it out the wazoo. Here, I go to Rushford. I get my medications for my bipolar, so I don't drink and use drugs. I'm trying to get back into Connecticut society. CUNE Employment Opportunities is I feel heard. I feel seen. I feel respected. I feel loved. Connecticut has such an incredible industry in this state. You know, it boggles my mind. In the short 2 years that I've been here, it is absolutely unbelievable how incredible Connecticut is and these programs, so I can get into the industry that is Connecticut. I am honored and privileged to be able to speak to you guys on a state level. I feel so honored and privileged to be able to speak on behalf of CUNE. These people are incredible. And to hear that these people are working 2 or 3 jobs to pay their bills breaks my heart. And Mary, my employment specialist, we have so much work to do this year. And I hope that you guys continue to fund this. $155 million is a lot of money. I can't wait to get back to work, to pay state taxes, to keep funding these programs. I am just beyond. I am so honored and privileged. Thank you so much to the Appropriations Committee for listening to me. Thank you, Madam Chairman. God bless you. God bless Connecticut. And P.S. I really hate snow. It's been wonderful. Thank you so much, everyone. Thank you.
Thank you, John. Next, Chantel Archer. Chantel, are you here? Hi. Oops, you were there for a second. Hi.
Hi. Good afternoon, Senator Marks, Senator Austin, and honorable members of the Appropriations Committee. My name is Chantel Archer, and I am a health program associate at the Connecticut Department of Public Health. I have been a state employee at DPH for 5 years, and the agency's mission is simple but critical: to improve and protect the health and safety of the people of Connecticut. During my time at DPH, I've worked across several programs. I currently serve in the Office of Injury and Violence Prevention, but I've also worked in the Office of Oral Health and the Maternal and Child Health Unit. In each role, my focus has been securing and managing grants and contracts that bring federal funding into our state to support public health initiatives. That funding is essential. It is what allows these programs to operate effectively and deliver the services they were designed to provide. These programs serve real and urgent needs. Some have helped to educate residents about the connection between oral health and overall health. Others have helped to ensure that individuals in underserved communities receive prenatal and postpartum care. No matter the program, the goal is always the same: to support the health and well-being of every resident in the state you represent, regardless of their background or circumstance. My current work focuses on the Overdose Data to Action Grant, an initiative that could not be more important right now. Overdoses, especially those involving opioids, have been rising for years. This crisis affects people from every walk of life. It does not discriminate based on age, income, race, ethnicity, or family background. It touches communities across our entire state. But none of these programs can exist without sustained funding. Public health protection requires investment from every level of government, local, state, and federal. Without that support, we cannot carry out the work we are entrusted to do. We have already seen what happens when public health systems are stretched too thin. During the COVID pandemic, the consequences of underfunding became painfully clear. Returning to that level of vulnerability is not an option. For the health and safety of every resident of Connecticut, we must find a way to provide additional funding for DPH. The decisions you make directly affect the well-being of every community in this state. If we cannot adequately protect people now, how will we protect them when the next crisis comes, when the next public health emergency or the next pandemic arrives? Thank you for your time and consideration.
Thank you very much. Next, we have Linda Iovana, followed by Danielle Middlebrook. Hi, Linda. Welcome.
Hello. Good evening, Madam Chair and members of the committee. My name is Linda Iovana, and I'm the CEO of CCARC. We are a nonprofit provider of day employment residential services for adults with intellectual and developmental disabilities, serving Central Connecticut. We contract with both DDS and DSS, serving individuals with a wide range of needs while employing approximately 270 people. Thank you both to the legislature and to administration for the investments made in recent years in community-based nonprofit services. After a decade of cuts and chronic underfunding, these increases were both necessary and appreciated. However, I'm here today because even with this meaningful progress, we're still not where we need to be. I am requesting that you increase funding for vital nonprofit programs by $155 million in fiscal 27. Across our organization, we continue to experience persistently high staff turnover and vacancy rates. Each month, we hire new staff and lose staff at nearly the same pace. This level of churn is not sustainable. It disrupts continuity of care, strains remaining employees, and limits our ability to admit new individuals into services, even when the need is urgent. As a result, we currently have program vacancies not because of a lack of demand, but because we cannot staff them safely and consistently. At the same time, the individuals seeking services today are presenting with significantly higher levels of need, requiring more intensive supports, more one-to-one staffing, and greater clinical oversight. Compounding this challenge is the reality that our workforce is increasingly less experienced. not by choice, but by circumstance. We train new employees, we invest in them, and then lose them to higher paying entry-level jobs outside of human services. This cycle places extraordinary pressure on supervisors, compromises stability, and increased risk for the people we support. Despite doing everything we can, raising wages, redesigning schedules, and launching innovative programs, we cannot overcome these structural issues without adequate, predictable funding. Inflation continues to outpace reimbursement increases, and nonprofits like ours are being asked to absorb the costs. I'd also like to ask that the nonprofit grant be funded and allocated via RFP. We rely on this grant to complete necessary capital projects to maintain our homes and infrastructure. Examples include new roofs, HVAC updates, accessible ramps, and ADA compliant bathrooms. CCARC recently worked with DSS to increase room and board rates due to legal compliance and rates based on cost report data that was over a decade old. It is vital that DSS rates be rebased annually so that they remain fair and equitable and cover the costs of the wards of the state for whom we provide services. Please support increasing funding for community nonprofits by $155 million. Thank you for your time.
Thank you, Linda. David Ostrom, are you here?
Yes, Senator Marks.
Hi, David. Welcome.
Hi, good evening, Senator Marks and honorable members of the Appropriation Committee. My name is David Ostrom, and I've been privileged to serve in our nonprofit community for over 32 years, currently as our Vice President of Quality Improvement and Training for Continuum of Care. Our agency operates programs across the state, supporting more than 3,000 individuals each year, many of whom live with significant mental health challenges, substance use disorders, complex medical needs, and homelessness. We greatly appreciate the funding increases the governor and legislator have approved in recent years, but unfortunately, as many of us have shared today, after years of stagnant funding for nonprofits, the need for services is increasing and more needs to be done. Our workforce is in crisis. At our agency alone, as the former colleague just mentioned, we've hired over 300 employees this past year, and over 320 have left, a number that's just not sustainable. And why is this happening? Simply because our rates are not competitive. Human service rates barely keep up with minimum wage, quite often not at all. Entry positions such as retail, food service, Amazon pay the same and much more without requiring staff to manage behavioral crises, administer medications, document clinical service, and ensuring the safety of our most vulnerable citizens. As a result, we're constantly retraining. Every time we hire and lose staff, we reinvest in recruitment, onboarding, training, only to repeat the cycle a month later. Today, our agency carries over 90 vacant positions, now relying on per diem and temporary staff with less familiarity of our clients and less preparation to manage complex situations. But of course, it's not just workforce, it's a crisis for the individuals who depend on us. Those we serve need stability, consistent in relationships, which are critical. Many of them experience trauma, abandonment, and instability throughout their lives. When staff turnover is high, continuity of care breaks down, trust is lost, and our connections are disrupted. And when this happens, we see increases in behavioral health incidents, increases in 911 support, and increases in unnecessary emergency room visits and hospitalization, situations that could have been prevented with consistent staffing and strong therapeutic relationships. When nonprofits are underfunded, costs don't disappear. They shift to higher cost services such as hospitals, law enforcement, and crisis systems that are already stretched thin. Investing $155 million in fiscal year 27 is not just about wages, it's about stabilizing our resilient workforce that stabilizes lives, ensuring that the people we serve receive consistent, high-quality care in their communities. Connecticut nonprofit human service system is a critical partner to the state, but we cannot continue to operate with chronic underfunding and expect positive results. I respectfully urge you to support Bill 5032 and provide the increased funding to strengthen the system and, most importantly, the individuals who rely on us every day. Thank you for your time and commitment to the people of Connecticut.
Thank you, David. Danielle Middlebrooks.
Good evening, Senator Marks and esteemed members of the Appropriations Committee. How are you?
Good.
My name is Danielle Middlebrooks, and I'm here today as the ARC Connecticut's Director of Advocacy and Public Policy, urging you to protect and strengthen the funding for Connecticut Department of Developmental Services and community-based nonprofits. DDS funding makes community life possible for thousands of individuals with intellectual and developmental disabilities. Through DDS, organizations like the ARC Connecticut's 14 chapters provide residential services, employment supports, day programs, and critical family assistance in every legislative district. However, providers across Connecticut are facing significant challenges. Costs for transportation, food, utilities, and insurance continue to increase. At the same time, direct support professionals remain underpaid for the responsibility and complexity of their work. We're encouraged by the rate increases over the past year and see this as an important step forward. However, chronic underfunding still exists and results in reduced capacity, longer waiting lists, and an increased risk of crisis for the individuals and families who rely on these services. From my seat, I can see how DDS-funded services make a tangible difference in people's lives. These services mean security and peace of mind for families who want to know their loved ones are supported and safe. And they mean meaningful employment opportunities, greater independence, and autonomy for individuals and self-advocates, like many of those that you've heard and will hear tonight. I respectfully ask this committee to ensure that DDS funding reflects the true cost of providing high-quality community-based services. Connecticut has long affirmed that people with disabilities belong in their communities, not on waiting lists, not in crisis, and not without support. That promise requires sustained, adequate investment, ensuring that individuals can continue to live, work, and contribute in the communities they call home. I urge you again to protect and strengthen this essential system for the thousands of Connecticut residents whose lives depend on it. Thank you.
Thank you, Danielle. Mary Apuzzo?
Good evening. And
Hi, Mary.
hi, how are you? Thank you for the opportunity to testify today, and he rises. My name is Mary Apuzzo, and I am proud to say that I'm Program Manager at CUNY Employment Opportunities in Meriden, Connecticut, a Connecticut DEMIS-funded program. I am here first to thank you for the funding increases, including in the enacted budget for fiscal year 2027. Those increases matter. They have a real impact, and I'm also here to respectfully ask you that you increase funding for vital community nonprofit programs like mine by $155 million in fiscal year 2027. CUNY Employment Opportunity serves individuals with co-occurring mental health and substance use disorders and disabilities. We help provide people find meaningful, gainful employment and support them in building and sustaining vocational goals. But what we really do goes deeper than job placement. We walk beside people as they rebuild their lives. Our program is often a turning point in someone's recovery journey, especially for individuals living with serious mental health challenges. Employment is not just a paycheck. It is dignity, identity, routine, purpose, and hope. What we see every day is this. People are not defined by their past mistakes. People are not defined by their diagnosis. People are defined by their potential. And when they are given that right support, they rise. But we are feeling the strain of years of underfunding. We are seeing longer waiting lists. We are spending more time stabilizing basic needs instead of advancing career goals. Our staff are stretched thin by trying to meet increasing demand with limited resources. We have also seen firsthand what happens when the SNAP benefits are reduced. Many of the people we serve became food insecure and turned to trusted programs like ours for helping connect them to resources and community supports. There is another truth I want to name. Many nonprofits workers themselves are not paid a livable wage, working full-time and still struggling to afford basic necessities. As a single mother of 3, I struggle while doing the work I truly, truly love. This is unsustainable. If funding does not increase, the risks to the community are clear. More people will fall out of care. More people will lose stability. More people will cycle through emergency rooms, shelters, and jails. That costs the state far more than prevention ever will. If CUNY Employment Opportunities receives an increase in funding, we would pay staff wages that reflects the importance of their work, reduce caseload sizes and increase individualized support, serve more people without creating wait lists, and strengthen retention so people don't just get jobs, they keep them. In short, we could change more lives because that is what community nonprofits do. We are not line items, we are lifelines. So please support increasing funding for community nonprofits like mine by $155 million in fiscal year 2027. Thank you so much for the opportunity to testify tonight.
Thank you, Mary. Bright Johnson, you're up.
Good evening. I'm Bright Johnson, Connecticut Government Relations Director for the American Cancer Society Cancer Action Network. We have submitted longer written testimony which details the cost of tobacco use in Connecticut, the disappointing and uneven history of tobacco control funding over the decades, and indisputable evidence in support of the vital role tobacco control plays in helping people quit and preventing kids from ever starting. Additionally, we have submitted comments on a number of other ACS CAN mission critical items in the governor's budget revision, including breast and cervical screening funding, access to the HPV vaccine, and the new lung cancer referral program. I'd like to first use my time today to publicly thank the governor for maintaining $12 million in tobacco control program funding in his fiscal 27 budget revision, which will provide continuity of tobacco control programs and services across the state and help alleviate and reduce the staggering annual economic toll tobacco use costs Connecticut. Despite lower tobacco use rates over the past 20 years, the number of annual deaths in Connecticut is a staggering 4,900 lives lost, 13 people per day. Annual healthcare costs from tobacco use exceed $2.36 billion in Connecticut, including $560 million to Connecticut's Medicaid program, and more than 2/3 of people who currently smoke indicate that they would still like to quit. We are not asking for a new funding source or to create new bureaucracy, only to utilize a portion of that which comes to this state every year for this very purpose. We urge this committee to continue to support the allocation process of that tobacco control funding in accordance with CDC best practices that for both fiscal 27 and beyond. Additionally, ACS CAN applauds Governor Lamont for maintaining fiscal 27 funding at $2.6 million for the state breast and cervical early detection program. The Connecticut Breast and Cervical Cancer Early Detection Program is a critical safety net for thousands of Connecticut women who continue to lack access to essential screening, diagnostic, and treatment services. We recognize the enormous impact the program has delivered in saving the lives of low-income, uninsured, and underinsured women diagnosed with breast and cervical cancer. The proven success of this early detection program demands funding levels to ensure that no woman is denied these life-saving services. ACS CAN strongly believes in preventing cancer before it develops and in detecting cancer early when it is more easily treated. We support evidence-based educational efforts to increase uptake of the HPV vaccine and policies that will increase HPV vaccination rates consistent with American Cancer Society HPV vaccination guidelines to prevent cervical and other HPV-related cancers. We urge the committee to continue to ensure that the vaccine remains available to all 11 and 12-year-old boys and girls through the Connecticut vaccine program, ultimately reducing cancer incidence and mortality in the state of Connecticut. Finally, despite coverage being available, lung cancer screenings are not widely employed for a number of reasons, with only about a 6% utilization rate in Connecticut. That can, should, and needs to change. Accordingly, in 2023, the legislature created a new lung cancer screening referral program within DPH to provide greater awareness, access, and equity to an underutilized preventative tool. We are grateful the governor's budget revision maintains program funding for fiscal 27. While we strongly support the LCSRP, it remains critical that no funds be diverted now or in the future from breast and cervical screenings to lung cancer screenings and vice versa. Thank you for your time.
Thank you so much, Bright. I'm going to turn this over to Chair Walker. And Chair Walker, 91, David Porteous is up next.
Thank you. And thank you so much, ma'am. Thank you.
Thank
you. Okay. Have a good evening and stay safe. Next, David Porteous.
Thank you. And good evening.
Good
My
evening.
name is David Porteous. I'm chairman of the board of directors for Gilead Community Services, a provider of mental health and addiction services in Middlesex and Hartford counties. Gilead has very successfully provided these services for 55 years, but we're facing daunting challenges today. In short, as you've heard from many others, the virtually stagnant funding of the last 2 decades is crippling us. Our funding has not kept pace with inflation or the growing cost of services. Consequently, Gilead, like many others, is looking at a staffing crisis. We're also looking at a financial deficit this year, which is an order of magnitude greater than anything we've ever seen in the past. It's a level of loss which is not sustainable financially. The funding that we receive for compensation in particular has led to the staffing crisis. For example, the contract that we recently got from Demas just last month for this fiscal year merely restores employee take-home pay to the same level as it was at the end of 2024. Basically, no increase in 2 years. We lose candidates and employees to the private sector. We also lose them to the very state agencies that fund us, but are able to offer better compensation to their own hires in similar positions to ours. In the last few years, we've been forced to close 2 outpatient programs and to consolidate others. There are hundreds of people we can no longer help. Of even more concern, 5 of Gilead's programs serving our most vulnerable clients are running a combined deficit this year of over $500,000. Not-for-profit organizations simply cannot run significant deficits and survive, and the board has been looking at all options to solve these fiscal problems. The preferred option, and the simplest one, is in your hands.
The 888 area code said. Sacred Heart Academy be closed on Tuesday, February 24th.
I'm sorry?
You can keep going.
I'll
Sorry
start
about
again.
that.
So, okay. The preferred option and the simplest one is in your hands. The realistic approach to the funding needed to pay for the services the state asks us to provide on their behalf. The other options open to us are far more draconian, up to and including closing these underfunded programs with inherent pain and disruption to both our employees and the vulnerable individuals that we care about so deeply. That is the antithesis of our mission, and it pains me greatly to acknowledge the need to even consider it. Gilead's blessed with a wonderful staff. The management and board of Gilead are fully committed to providing rewarding careers for our employees, but we cannot do it without your help. Your decisions on funding are far more than a fiscal matter. They help to shape and to display the values of the state and can make an almost unimaginable difference in the quality of life for countless individuals in Connecticut. Echoing the calls of others today, I ask that you increase funding for vital nonprofit programs in Connecticut by $155 million in fiscal year 2026. Thank you very much for your time and your attention today, and I appreciate it, especially in light of the storm we just got through. Thank you.
Thank you, sir, and thank you for your testimony, and have a good day. Have a good evening, and stay safe. Thank you. Next is Elizabeth Ott. Good.
Madam Chair, she was here.
She
I'm not
was.
sure. I'm not sure where she went.
Okay, all right. Jacqueline Santiago Rosario.
I don't see her.
Okay. 94, Michelle Michael. Condarina? Michael?
Nope.
Okay. Stephen Bob.
He is here.
Hi, Stephen.
Good afternoon. Good evening, Senator Austin, Representative Walker, and honorable members of the Appropriations Committee. My name is Stefan Bob, and I'm a mental health assistant 2 at Connecticut Valley Hospital in Middletown, Connecticut. I've been in state service for over 18 years. Many of my colleagues are struggling with the affordability crisis. We ourselves are working 3 times as much just to keep in step with the rising cost of food, housing, and transportation. Many of us are just a crisis away from some type of insecurity. Imagine if your car needs a major repair, a healthcare crisis, or a loss of housing. All of us working double or triple shifts just to maintain. This leads to overworked and overtired staff. We serve the most vulnerable population that expects us to be at our best. We face traumatic scenarios daily, and when we factor in the lack of rest or quality mental health care, then it has the potential for disaster. I'm speaking with you today to increase the funding to the Department of Mental Health and Addiction Services. If we increase funding, the needs of all Connecticut citizens can be met. We can increase salaries for those of us working in this difficult but necessary field. We can recruit and retain more staff so we are not working double or triple shifts because we are short-staffed or out of necessity to feed our family. So many of my colleagues are young parents who are forced to leave their young children with extended family or childcare because we live in a society where one income or a part-time job for one parent is no longer feasible. Children are being raised by anyone but their parents. These situations can be stressful upon a family. We need to help our families bring back normality and to stabilize our mental health so we can safely provide care for others who desperately need our services. The increases will not only bring depleted systems back to standard, but also enable future improvements. It all begins with funding. Thank you.
Thank you, and thank you for your testimony. Next, Thomas Holt.
Thank you.
Good
Hello, good evening.
Mhm.
Good evening. Good evening, Representative Walker, senators, and members of the Appropriations Committee. My name is Thomas Holt. I'm the Senior Program Manager for CUNY Employment Opportunities, Supported Employment Programs. We have two programs, one based in Middletown that serves all of Middlesex County, as well as Lyme and Old Lyme. This program has 97 DEMIS slots and assists people with mental health disabilities gain and maintain employment. Our other supported employment program is embedded at Rushford in Meriden and has 74 DEMIS slots. This program serves Meriden and Wallingford. Thank you for the opportunity to testify today. I'm here to thank you for the increases included in the budget for fiscal year 27 and to request that you increase funding for vital nonprofit programs like mine by $155 million in fiscal year 27. Employment is such a huge part of who we are. When you first meet someone, what's one of the first things that's asked? What do you do for work? Employment increases one's confidence and gives them purpose. That is why what we do is so crucial to our community. Over the years, we have had decreases in our caseloads due to lack of funding. The need for our services has always been great, and when we serve fewer people, wait lists can occur. Both of our programs have a steady stream of referrals, proving that there is a need for these services. Unfortunately, due to a lack of funding over the years, we have barely been able to pay our employees a livable wage. Many of our employees have second jobs because their salary alone cannot pay their bills. Funding increases over the last year have helped, and we are very appreciative of this. Despite this funding, nonprofits are still underpaid. This leads to huge staff turnover, which affects our clients. They work independently with our staff and become comfortable with them. This builds their confidence and motivation, which leads to them gaining employment. When there is constant staff turnover, this process is disrupted and ultimately affects our clients. The increase in funding will give nonprofits the ability to offer a higher wage and to hire and keep qualified staff to provide these quality services that our clients so deserve. Please support increasing funding for community nonprofits by $155 million in fiscal year 27. Thank you so much for this opportunity to testify, and I wish you all have a great night.
Thank you, sir, and thank you for your testimony. Stay safe. Have a good evening. Thank you.
Thank you. You as well.
Okay. Joanne Todd.
Good afternoon.
Good afternoon.
Good afternoon, Representative Walker and distinguished members of the committee. I want to thank you for the opportunity to testify. My name is Joanne Todd, and I am Board Treasurer of Horizons, a private nonprofit provider partnering with the Department of Developmental Services. For 47 years, Horizons has delivered residential day and employment supports to individuals with developmental disabilities across Connecticut. Today, we support more than 1,600 people statewide and employ approximately 270 full-time staff, along with 130 seasonal team members. I want you to know I appreciate the rate increases included in the enacted fiscal year 27 budget. Those steps are really meaningful. However, they are not sufficient to stabilize the system. I am here to urge you to approve an additional $155 million for fiscal year 27 for community-based nonprofit providers. The workforce landscape has fundamentally shifted since the pandemic. Although last year's budget strengthened residential rates, day and employment services did not receive equivalent adjustments. For providers like Horizons that operate both programs and often rely on shared staff, this imbalance creates operational strain and limits flexibility. A consistent rate increase across all DDS services, including day and employment supports and room and board, would help create stability and equity. Demand for services continues to outpace capacity. Our waiting list continues to grow, yet our ability to respond has diminished. We are no longer able to serve many individuals requiring one-to-one or highly specialized support. Sustainable funding is essential if we are to recruit and retain qualified staff. While entry-level wages have risen modestly, compression has become a really serious issue. Long-tenured staff are earning wages nearly identical to new hires. Without an ability to meaningfully differentiate pay based on experience and skill, retention remains a constant challenge, as well as the challenge of just paying a living wage. Beyond workforce pressures, the financial picture remains daunting. Community providers are funded at levels roughly 32% below 2007 benchmarks when adjusted for inflation. Over the past 3 years alone, inflation has exceeded 16%, outpacing recent rate adjustments. At the same time, providers are navigating the expiration of ARPA funding, stagnant Medicaid reimbursement rates, and persistent staffing shortages. Connecticut's fiscal guardrails were designed to promote stability. They've had the unintended consequences for human services. Core programs within DDS have steadily lost ground, and the state's Medicaid reimbursement rates remain among the lowest nationally. These structural challenges undermine the long-term viability of the community-based system. And capital investment is equally critical. The nonprofit support bond program offers an important opportunity to address aging infrastructure and ensure providers can maintain safe, accessible facilities. While isolated project concerns may have drawn attention, many organizations, including Horizons, have demonstrated responsible stewardship of prior bond funding, completing projects on schedule and within budget. Continued access to bond funds will strengthen the infrastructure that families rely on every day. Community nonprofits are the backbone of Connecticut's developmental services system. Families depend on us as a stable support in community-based safety net. An additional $155 million in fiscal year 27, along with renewed bond support, would help restore workforce stability, expand service capacity, and protect services for the individuals with developmental disabilities.
Joanne?
Thank you. Thank you for your time. All right. Thanks so much.
Have a good day. Thank you.
Bye-bye.
Elizabeth Ott.
Hi, thank you. I apologize that I had some technical difficulties.
Don't worry.
Okay, thanks.
3 minutes.
Perfect. I serve as program director for Guilford Youth Mentoring, as well as a member of the Governor's Prevention Partnership, Prevention and Leadership team. And the Prevention Partnership is a DEMIS-funded organization and is dedicated to strengthening Connecticut by fostering our resilience. And that's a mission that I know that all of you share as well. I'm here today to urge your continued and expanded support for prevention programming, and particularly for mentoring initiatives as you deliberate on HB 5032, because it's a good investment for our state. Mentors change the mentees' lives, but it goes beyond that. They're changed for the better, and they also send a powerful message to all the students who observe our volunteers consistently dedicating their time from their busy lives and showing up in the schools week after week. That shows them that kids matter and that our communities value youth. I've worked in this field for my entire career because over and over again, I've witnessed the impact that it has, that there really is no such thing as other people's children. And there are concrete actions that adults can take to fundamentally alter the trajectory of a child's life. For a relatively small investment, mentoring programs yield a remarkable return. They cultivate youth who are prepared to be valuable assets to our state's workforce, and they significantly reduce their likelihood of experimenting with substance use. Approximately a third of towns in Connecticut currently offer a form of mentoring program, and we should be prioritizing the expansion of this number, broadening the scope and depth of these programs, and providing crucial support for mentor retention, as well as research that has consistently shown to be vital. Mentoring programs consistently deliver a strong return on that investment. School systems benefit from a network of adult volunteers who advocate for them during budget discussions. Children's attendance improves by an average of 9 days a year when they have someone at school who's genuinely happy to see them and who they recognize isn't being paid to be there. The overwhelming body of research corroborated by my own extensive experience is unequivocally clear. Kids with mentors are more prepared to learn. They exhibit improved attitudes towards school and teachers, feel more connected, and their aspirations grow in terms of graduation, further education, and career choices. They're less likely to encounter trouble at school, possess better conflict resolution skills, and are less prone to feelings of isolation and depression. They're also much less likely to initiate substance use. A bonus for all of us is that kids with mentors are 78% more likely to regularly volunteer in their communities and 90% more likely to become mentors themselves. I know our state deeply values our children, and I welcome any questions that you might have. As you consider your decisions, I implore you to prioritize prevention, because for every dollar that you invest in this crucial effort, you save the state about $10 in healthcare costs, justice system expenditures, and treatment. Never mind avoiding lost wages and unrealized potential. Thank you very much.
Thank you. And thank you for your testimony. Have a good evening.
Thanks, you too.
Okay. Suzanne Gaskell.
Hi, good afternoon, members of the Appropriation Committee. My name is Suzanne Gaskell. I come to the committee today as a mother of an adult child with a disability, a retired high school public school teacher, Gilead Community Service and Oak Hill board member, and as a community member concerned for the mental health and well-being of all Connecticut residents. Thank you for your time and attention to the countless testimonies that you've heard this afternoon and will continue to hear until late this evening. I've previously testified on behalf of clients and caregivers at Gilead Community Services. Last year, I was encouraged and incredibly thankful for the increases included in the enacted budget for FY27. And I'm really hopeful that the inroads we made last year to help sustain that vital programming at nonprofits such as Gilead Community Services and Oak Hill continues. It must. The need is great and it's growing. Years of stagnant funding, you've heard over and over, coupled with rising costs, translates to the nonprofits' inability to attract and retain qualified personnel. The very personnel whom each and every one of us is dependent upon for the overall safety of our communities and our own personal well-being and that of our loved ones. As a board member at Gilead Community Services, I've been deeply troubled by the prospect of program closures and the current staffing crisis. As a parent, I'm terrified. I have a son who's been in a Gilead group home for 15 years. I come to care deeply for many of the Gilead clients over the years of my experiences there, who have made tremendous progress towards recovery in the face of life-altering mental illnesses and addiction. And I'm equally moved by the dedication of the Gilead staff that empowered that journey. It's not an easy job. Many of our staff members are enduring unsustainable pressures at work as the consequence of low wages and resultant vacancies. They're doing more, working longer hours to ensure programs have sufficient coverage, and some have forgone vacations and holidays with their families in service to Gilead. As a community, I feel we can do better for them. With your support of HB 5032, we can continue to deliver the program and fairly compensate our caregivers. The ask is fiscally responsible because if we don't, the subsequent cost to the state, both in economic and human terms, will be enormous, far offsetting any short-term savings today. The $155 million increases proposed by the Alliance for Nonprofits may sound like a lot, but in a time of unprecedented uncertainty about federal funding, but let's consider that equals $43 per Connecticut resident annually. That's 83 cents a day. So what would that $43 of additional funding to nonprofits, how would that benefit the Connecticut residents? Well, for one, all residents would be assured that they have access to quality care, housing, and services they require. They'd have the confidence in the continuity of care for loved ones, and it would be there in a time of need. They'd know that if they chose a field in social services, their work would be valued. They'd know that if they worked at a nonprofit, they could expect to earn a livable wage.
Suzanne, you've got to wrap up. Okay.
Okay. They'd know their stakeholders and solutions. They'd know that they're empowered for hope and dignity, and they'd celebrate bipartisan support to sustain vital programming. Thank you so much. Please support increasing funding to community nonprofits by $155 million in FY27. And thank you.
Thank you, and have a good evening. Thank you.
Bye.
Alicia?
Good evening, Representative Walker and honorable members of the Appropriations Committee. I'm Alicia Gaduti, the President and CEO of Edelbrook Behavioral and Developmental Services. Edelbrook is a 125-year-old multi-service agency specializing in serving those with autism spectrum disorders. We contract with DDS, DCF, municipalities, and school systems, and receive Medicaid funding through DSS. We support 400 youth and individuals and their families, and those are individuals with highly complex developmental and behavioral needs. And we do that with the expertise of more than 650 talented and caring employees in 27 locations throughout Connecticut. We provide an array of educational, residential, prevention, and community-based services, and our students and individuals come to us from nearly every community in Connecticut and from other states. Gandhi said that the true measure of any society can be found in how it treats its most vulnerable members. Many of the individuals we serve have extensive trauma histories. They've experienced multiple hospitalizations, and they have been in other treatment programs, often out of state. We help youth and families find success after they have had many, many doors close on them. Our programs keep people out of hospitals, get them back into the community, and ultimately, and most importantly, help them find hope and happiness. And our success is dependent on our talented, committed, and compassionate staff. They work to build relationships, establish trust, and provide the most specialized care in every aspect of our individuals' lives. And we do this work not only to fulfill our mission, but also in partnership with and on behalf of the state of Connecticut. We ask that you prioritize this vital work in this year's budget. As you've heard tonight, while most Connecticut residents are heeding warnings and staying home, keeping warm, and remaining off the roads, the staff in our group homes bravely faced the blizzard, trudged through nearly 2 feet of snow, shoveled out their cars, and showed up for our individuals who depend on their support. Staff in hundreds of community provider agencies are present, shift after shift, putting others ahead of themselves. They are the state's quiet heroes, providing hope, love, help, and most importantly, access to vital and necessary life-saving and life-affirming services. We're incredibly grateful for the long-term plan you passed last year to include funding indexed to inflation. As you know, costs for staffing, health insurance, utilities, rent, and other expenses are increasing exponentially, and our funding has fallen very far behind. Please prioritize our quiet heroes in your FY27 budget with funding that truly reflects the importance and the value that you place on their work. They should be honored and respected for their compassion, their expertise, and their unwavering commitment to service. Thank you for your time and attention.
Thank you, and thank you for your testimony. Stay safe tonight, please.
Thank you, Representative Walker.
Okay. Lynn Arizini? You're muted. You're muted, Lynn. You're muted. Still muted. Lynn, you're muted.
Audio. Okay, can you hear me now?
Now I can. Go right ahead.
Okay, excellent. I am Lynn Arizini, and this is Carl.
Hi.
For the last 2 decades,
Hello.
our family has been advocating for disabled adults like our son, Carl. First, we advocated for full DDS residential funding for Carl. Some of you may remember Carl singing "When You Wish Upon a Star" to convey his wish for funding to live in his own apartment with supports. That wish came true in 2018. Even though Carl has profound autism with serious self-injurious behaviors and limited speech, he was living in his own apartment with Chapel Haven, Family Care, and Marrakesh providing a wide range of supports. The DD's Council's award-winning film, Building a Great Life, featured Carl as a success story in the community. Unfortunately, that success story has reversed course in very negative ways during the last 6 years. The pandemic hit and rocked Carl's well-ordered world and caused serious regression in his coping skills and independence. Change is so difficult for our autistic son, and now change is constant for him. The turnover in staff, the lack of staffing, has had a huge negative impact on Carl. Because of the numerous staffing cancellations and program changes, Carl's self-injurious behaviors have increased, resulting in emergency room visits due to these injuries. The lack of staffing and appropriate behavior supports, as well as triggers of loud children moving upstairs from Carl, ended his living in his own apartment last October. Since then, Carl has moved into 2 different respite situations in search of a place where he can get the support he needs, as well as regain the independent skills he worked on tirelessly for over 30 years. How can Carl return to the life he once had? DDS and nonprofit agencies need more funding. Staff needs more incentives, benefits, and a career path for the important work they do. The federal government is failing people like Carl, and now is Connecticut's chance to step up and do what is right by their most vulnerable citizens. If Connecticut provides increased funding to the nonprofits who help Carl, he can once again thrive and live a more independent life in the community. In closing, I would like to add a verse to a recently departed Reverend Jesse Jackson's poem, I Am Somebody, because our son Carl is somebody. I am somebody. I may have autism and be intellectually disabled, but I am somebody. I must be respected, protected, never rejected. I am God's child. Thank you for listening, and I count on you guys to keep doing the right thing and support people like Carl here.
Wow. Thank you. And thank you, Carl. Have a good evening. Thank you.
Bye.
Bye-bye. Bye-bye. Next is Caitlin Huang.
Good afternoon, distinguished members of the Appropriations Committee. My name is Caitlin Huang, and I'm a freshman at Hall High School. I'm also a member of the Governor's Prevention Partnership Youth Advisory Board, which is funded through the Department of Mental Health and Addiction Services. I'm here today to respectfully ask you to continue and expand prevention funding to the maximum amount under Bill HB 5032. I want to be honest with you. I haven't personally witnessed or experienced an overdose, but I have smelled vaping and weed on students walking to class, and that's common. Young people vaping or smoking is normal, and that normalization is a concern. It's exactly why prevention matters. The risk landscape for young people is changing. Substances are more accessible, more discreet, and often marketed in ways that make them seem harmless. What may begin as experimentation can quickly turn into dependence. Prevention allows us to respond early before those risks escalate into a crisis. I also see this issue from another perspective. My dad is a dentist, and he treats young patients whose nicotine use affects their oral health and healing. Nicotine reduces blood flow and can delay recovery after oral surgery procedures. Many of these patients begin vaping when they were students. What may seem small at first can carry long-term health consequences that could impact their lives long into the future. The good news is that prevention is working. Connecticut saw a 26% decrease in overdose deaths in 2024, with a further decrease of 21% reported in 2025. That progress reflects your consistent investments in prevention and community partnerships. It proves prevention is working. This is not a time to slow down. It's time to stay steady and move forward. Prevention protects students before they become statistics. It strengthens families before a crisis occurs. It builds healthier schools and communities before harm takes hold. I respectfully ask you to protect and strengthen prevention funding within DMHAS so that organizations like the Governor's Prevention Partnership can continue equipping communities across Connecticut with the tools they need to stay ahead of evolving risks. The future you are funding today is the one my generation will inherit tomorrow. Thank you for your time, your leadership, and your commitment in our communities in Connecticut.
Thank you, and thank you for your testimony, and thank you for being on the Governor's Partnership. Have a good evening. Next, we have Zariah Pedros, and I don't see her up there. Okay, so Colette Beeman?
Yes, Bement. Good morning. Actually, good evening, Representative Walker.
Good evening. Go right ahead, ma'am.
My name is Colette Bement, and I'm from Tolland. I have a 39-year-old son, Scott, who has intellectual disabilities, and he's on the autism spectrum. He's an office assistant at Opportunity Works Connecticut in Rockville, and he lives in Willimantic with 2 roommates. He has employment and residential supports provided by Horizons. Horizons is an incredible organization, as I'm sure you've heard from people today about it and heard from Chris McNamara, the CEO. They set high standards for their staff to adhere to, and I know that my son is always supported and respected when he's at home and at work. You have heard a lot today from families, from employees, from executive directors for nonprofits, so I will not belabor that. All of the nonprofits, including Horizons, have struggled for the last few years trying to retain and find new staff. And every year I worry, will this be the year that Scott's Home closes? As you listen to testimony today and then make decisions regarding funding for nonprofits, I'd ask that you consider 3 facts. Unfortunately, it doesn't look like my testimony made it to your list of speakers, so I'm just going to give you what I have here. Fact 1, nonprofits provide the majority of supports to individuals with IDD, but you may not know how many. Nonprofits provide residential support to 6,340 individuals, and DDS-run supports are 350 individuals. Nonprofits provide 12,742 individuals with support for day and employment. DDS provides 82. What will happen if these nonprofits begin to close or reduce their services more than they already have? What is going to happen to all of these people? Fact number 2, there are DDS lists for residential, day and employment, behavioral services, which need funding now and in the future. And there are projected lists for age outs and high school graduates. For example, there are 48 people on the emergency list for residential services who have no money allocated to them right now. They're emergencies. Some of them have been on the list for 2 years. There are 519 urgent residential requests. Those people should have services within 1 year. For underserved, those are people who have residential services, but they need more funding. There's 57 on that emergency list and 253 on the urgent list. There are also 47 people waiting for employment and day services, and there are residential age outs who will age out of school programs in June that need to have a residential support somewhere. And then there will be high school graduates in June of 2024, probably about 300 of them. What are you going to tell their parents when you say, sorry, our nonprofit can't take you?
You're going to have to wrap up.
Okay, because they don't have enough employees. When I look at Southbury Training School, the cost right now for services there is over $1 million per resident. And I look and I say, why? They're not providing services that are to people who are any different than those who are served by the nonprofits. And I asked, you just consider how many people are served by the nonprofits now, and what will happen if any more nonprofits close or reduce their services. Thank you very much.
Thank you. And you can submit your testimony to appropriations, and we will
I did submit it, and it said that it was accepted, but I don't see it in the list. So I will try again.
Okay, try again.
Thank you very much.
Okay, have a good evening. Thank you.
You too.
Next is Martin Legault.
Yes, good evening, Representative and members of the committee. My name is Marty Legault. I'm the parent of a Horizons Inc. Client, and Horizons has been supporting our daughter for nearly 40 years, since she was 10 years old, through their many programs, including Weekends in the Country, summer camp, day program services, and residential support services. Our daughter has very complex needs that without the expert services provided by Horizons, our family would be at a total loss to meet. We are extremely grateful for the state's financial support to Horizons over all these years that has allowed them to continue providing these critical services to our daughter. I'm here today both to thank you for the real funding increases that the governor and the legislature have approved in recent years, and to request that you increase funding for critical nonprofit programs like Horizons by $155 million this coming fiscal year. I've submitted my written testimony, and I thank you for your attention this evening.
Thank you, sir, and thank you for testifying, and have a good day. Thank you.
Thank you.
Next, Caitlin Rose? No. Jeffrey Branch? No. Tashi Adino? No. Carrie Bishop? Good evening.
Good evening, Representative Walker and distinguished members of the Appropriation Committee. My name is Carrie Bishop, and I'm the Chief Financial Officer at CUNE Employment Opportunities. Thank you for the opportunity to testify today. I also want to thank you for the increases included in the enacted budget for fiscal year 27 and to request that you increase funding for vital nonprofit programs like mine by $155 million in fiscal year 27. Our organization partners with DDS to provide essential services to individuals with intellectual and developmental disabilities. These services are not optional. They are life-sustaining supports that allow people to live safely in their communities, find and maintain employment, build relationships, and experience dignity and independence. From a financial perspective, I want to highlight two key realities. First, cost pressures are outdating reimbursement rates. Over the past several years, providers have experienced significant increases in labor cost, healthcare benefits, insurance, transportation, utilities, and compliance requirements. Direct support professionals are the backbone of this system. Yet we are competing with retail and fast food employers who can sometimes offer higher wages with fewer responsibilities. Without sustainable rate structures, nonprofit providers cannot remain financially viable. Second, workforce instability directly impacts service delivery. High turnover, vacancy rates, and burnout are not abstract issues. They translate into service disruptions, longer wait lists, and fewer options for families. When reimbursement rates do not allow us to offer competitive wages and career pathways, we risk losing qualified staff, and ultimately the individuals we serve experience the consequences. As a CFO, my responsibility is to ensure long-term fiscal sustainability while fulfilling our mission. I can honestly say that many providers are working with very tight margins and are often using their own reserves just to keep services running. That's not a sustainable way to operate. Please keep in mind that behind every line item in our budget is a person, as an adult seeking employment, an individual striving for independence. DDS services are not just expenditures, they are investments in human potential. Thank you for your time.
Thank you, and thank you for your testimony, and have a good evening. Thank you. Next, David Ishmael.
Good evening. How are you?
I'm great. How are you?
I'm fine. Thank you. Sorry about my attire. I've been out helping my community. I wanted to start by thanking you all for allowing me to speak to all of you. My name is David Ishmael. I'm the father to twins with autism. I would like to address my concerns to all of you with the hopefulness it will be heard and that it matters. My concern is for the private sector workers who work with our most vulnerable citizens here in the state of Connecticut. I've been here for years to address this problem that is getting worse. I feel it's important for you to know you are paying these contracts close to minimum wage. These people wake up coming into work not knowing what they will be dealing with daily. So from experience, imagine this. You come to work and suddenly a meltdown occurs with your loved one. The staff member comes to help. Then it escalates. The staff member may be struck, bitten, scratched, or spit on. and may have to take off time from work, and that means filling their position. I know I've been there. If a picture paints 1,000 words, use your imagination. I feel it's important you know what these good souls do each day, working 2 jobs to make ends meet, and they are injured. How do they get to their next job? I find it very sad that our leaders who serve by example fell short of their duties when it comes to this problem every year. You encourage us to come down and speak. My question to what? We speak and the result is always the same. So I ask, when do these voices and concerns, pains, and suffering come into fruition? I see firsthand how these staff members take my son, who is moderate severely autistic, get him dressed, feed him, and keep his hygiene addressed, and take him to his medical visits without question. My son is nonverbal, so I am and always will be his voice, and you're hearing him today. Please ask yourself, aren't they worth proper and fair wage worthy of what they do for our loved ones? It's a question we need an answer to immediately, if not sooner. So do I need an answer? Will it be what we hear year after year? Or will it be time for fairness? I want to thank you for your time. And before I close out, I would like to share something with you that I feel is very important.
Mm-hmm.
This is my son, David. And without education at Oak Hill and the staff, he would have never made it to graduate because I would have never been able to get him in the car and get him there on one of the most important days of his life. And I urge all of you to think, if this was your child, what would you want with him? Thank you for your time.
Thank you, sir. And thank you for working in the community and dedicating yourself to your community. Thank you very much.
Thank you.
Elizabeth Bouch. Okay. Jim Petalini, sorry.
He won't be testifying this evening.
All right. Jonathan McGee.
Hello, can you hear me?
Yes, sir, we can. Thank you.
Hello, Representative Walker and distinguished members of the Appropriation Committee. My name is Jonathan McGee, and I am a New Haven resident and undergraduate sophomore at Yale University. I'm originally from Los Angeles, California, and have since then relocated to New Haven for my academic pursuits. I currently serve as an intern for the Community Mental Health Initiatives underneath the Department of Community Resilience for the City of New Haven. I'm writing to urge the Appropriations Committee to approve $1.3 million in annualized funding to sustain Elm City Compass, an essential crisis response service based out of the City of New Haven. For the past 1.5 years of my residency in the City of New Haven, I'm a witness to the overbearing historic rise in crisis among individuals experiencing homelessness and mental health emergencies just outside of my institution. In my past fall term, I was walking home from the Afro-American Cultural Center to my dorm. I had several food provisions I planned to hand out to individuals outside of the New Haven Green, in front of a church. When I approached a homeless gentleman at the top of the church steps in front of his resting grounds, I was appalled to recognize there were over 12 other vulnerable homeless residents living there simultaneously. In my role as a municipal intern, I have drawn data for Elm City Compass Advisory Board members and witnessed actionable insights on how we share data transparently, communicate clearly, and respectfully with residents. Elm City Compass was built with the community and continues to be guided by it, allowing Compass to be community informed and community accountable. We must come together to reduce the suffering of individuals across the great state of Connecticut. The leadership of Elm City Compass has demonstrated a deep understanding of how to effectively support individuals with diverse and complex needs. This is why I urge the Appropriations Committee to approve $1.3 million in annualized state funding in order to allow Elm City Compass to continue strengthening and evolving its service delivery model. Stable funding will ensure that resources are directed in the most impactful and efficient ways, allowing the organization to respond to crisis with coordination, compassion, and accountability. Investing in Elm City Compass is an investment in restoring trust with our residents and expanding the City of New Haven's capacity to improve equitable access to critical services across the community. Thank you for the opportunity to testify on HB 5032. I'm here to request that you approve funding for crisis response in New Haven so we can continue to provide vital mental health and behavioral health interventions to our residents. Thank you.
Thank you, and thank you for your testimony. Thank you for your volunteerism. Thomas Fiorento. Okay, Mike.
Every year you get better at it, though.
Thank you.
Good
I'm not
evening.
gonna, go ahead.
Good evening, Representative Walker, members of the Appropriations Committee. My name is Mike Van Vlanderen. I'm a lifelong resident of Norwich, Connecticut. I've worked for Reliance Health for 35 years, and this year we're in the process of celebrating our 50th year of serving our community and all of Eastern Connecticut more broadly. We have 250 plus staff serving over 1,000 individuals each year with a comprehensive array of services primarily funded by Department of Mental Health and Addiction Services, DEMIS, and the Department of Disability Services, DDS. Thank you for the opportunity to testify today. I'm here to thank you with all sincerity and the depth of my heart for the proposed increases included in the budget for FY27. However, I do want to briefly walk you through a 35-year snapshot of resource allocation to nonprofits in the state to serve our most vulnerable citizens during my time of work. When I began at our agency in 1991, I was making $11.08 an hour as a homeless outreach worker. Our current starting salary, and you've heard this from other folks throughout the day, for that same position is still below $20 an hour and represents a 35-year increase in state-funded appropriations year over year of about 1.2%. And this applies across the board to all our direct care staff, case managers, residential assistants, direct support professionals. $1 in 1991 had about the same purchasing power as $2.38 today. That represents an increase of 138% based on the cumulative CPI data from 1991 to present for Connecticut. For our starting salary to have kept pace with the cost of living, working, and raising kids in Connecticut, the appropriated contractual dollars for nonprofit funding should currently have us around $26.37 for direct care staff. The proposed increase to nonprofits for the upcoming fiscal year is significant. You've done well by nonprofits for the past handful of years. But as John Carl Casa from the Alliance stated earlier, two things can be true at the same time. And the other thing that's true is that nonprofits are still in a deep hole relative to increased costs in Connecticut. When I started in 1991, making $11.08 an hour, within a few short years, I was able to get married, buy a home, start a family, pay for groceries without creating ongoing credit card debt, afford healthcare costs, drive a reliable vehicle, spend time with my family because I didn't need to work a second and third job. Today, very few of those things are true. I'm sure all of you understand and have seen the tireless work of the Alliance and their ability to provide informed data and advocacy to legislators on behalf of nonprofit organizers across the state. They've crunched the numbers, and you've heard that number today from several folks. It's $155 million to be increased in FY27 to get us to some level of equity that we had over the past 20 years. We know the rainy day fund is maxed out, and we know we still have billions of dollars in surplus. Our state can properly fund nonprofits, and we have the resources to do so. Thank you again for the proposed allocation to nonprofits, and please support increased funding by an additional $155 million for FY27. Thank you for the opportunity to testify today.
Thank you, sir, and thank you for your testimony. And I'll be better next year. Thank you. Thomas Fiorentino.
Thank you. Well said. You got the last name very, very well. Thank you so much. My name is Tom Fiorentino. I'm on the board of the ARC Connecticut, and I'm the dad of a young man with an intellectual disability. Just a little context and kind of connecting a couple of things. It's ironic to me that the underfunding of DDS, in particular its waivers, kind of led directly to the as the administration sees it, utilization of community first choice. Because that program, the waiver program, is unable to serve many with the greatest needs and has waiting lists and capped budgets, of course people went to community first choice. Returning to DDS, my son does get supports through FAVAR, And this is a story I told to Representative Dathan's committee last year, and I want to share it with you because I think it kind of personalizes what I'm trying to convey. Last year, I got a phone call from one of my son's staff saying, "Hey, it looks like your son is kind of sweet on this other person who works in the building, and she's kind of sweet on him." And we were thinking, if it's okay with you, or she was thinking, I was thinking, but they were using her voice, would it be okay with mom and dad if they went on a date?
Oh, wow.
Now, my son was 35 years old, and I said, sure. Now, the mom of the young woman eventually said, yes, it's okay. This was all the product of this staffer. This, this was all her idea. They got dressed up. I think they went to Applebee's. She filmed the whole thing and sent it to me, Representative, and he got out of the van. He gave the young woman his arm, and I'm thinking, where did he learn that? It wasn't from but so he did, right? They went in, they had this great time because of that staffer, his first date at age 35, a date that all his cousins and peer all had much, but he had it because of this staffer. And at the time, I said to Representative Dathan's committee, please, I don't want to lose her. Please, please. She's working two jobs. They're all working two jobs. Many of them are state assistants. Many, Representative.
Mm-hmm.
I'm so sad to report she's leaving.
Oh,
She got a job as a commercial truck driver.
wow.
So instead of,
Mm-hmm.
instead of doing what she did so beautifully, so from the heart, I'm not saying that this isn't but she's leaving because of the money. She loves the people she works with, and it's so heartbreaking, to see somebody like that leave. We don't want to lose any more of them.
No, no.
So thank you so much for listening. I know it's been such a long day, week, session for you on. I appreciate so much the attention and the way you treat people with such dignity. Really do
Thank you.
appreciate it. Thank you.
Thank you. And thank you for sharing that story. That was beautiful.
My
Thank
pleasure.
you. Next, Angelina.
Hi, good evening, senators, representatives, and members of the Appropriations Committee. My name is Angelina D'Alessandro, and I am a social work intern and housing case manager with New Reach in New Haven, and I live in Shelton, Connecticut. Thank you for allowing me to testify today in support of the Connecticut Coalition to End Homelessness 2026 legislative agenda and the investments and policy changes needed to truly address homelessness across our state. I am here today because homelessness is not abstract to me. It is personal and it is daily. In my work as a housing case manager, I sit with individuals and families who are homeless or just one crisis away from losing everything. I have watched people fall into housing instability because of a rent increase they couldn't absorb, a medical emergency, or a sudden job loss. These moments happen fast, and once someone loses housing, climbing back out becomes even harder. I've also seen what happens when people receive consistent housing-focused case management. With the right support, people stabilize. Without it, they often cycle through shelters, emergency rooms, and crisis systems that are far more costly and far less humane. Connecticut is facing both an immediate crisis and long-standing structural failure. Since 2021, homelessness in our state has increased by 44%. Behind that statistic are real people, parents trying to keep their children safe, older adults with serious medical needs, and individuals whose mental health has deteriorated simply because they lack a safe place to sleep. This is not just about what we see on the streets, it's about survival. When stable housing and consistent case management are unavailable, people's health worsens, trauma compounds, and emergency systems are left to respond after the damage is already done. What is most hopeful is that we already know what works. Housing first works. When people are given access to stable housing without unnecessary barriers, and when that housing is paired with consistent housing-focused case management, outcomes improve. We much appreciate that the governor's proposed budget includes investments related to homelessness and housing stability. In my role, case management means meeting with clients week after week, helping them apply for benefits, connecting them to mental health and substance use treatment through the Department of Mental Health and Addiction Services, advocating with landlords, creating budgets, and responding when crises inevitably arise. When caseloads become unmanageable due to underfunding, clients fall through the cracks, and not because they don't want to help, but because the system cannot provide it on the scale required. I respectfully urge the legislator to adopt a coordinated annual investment of $123.9 million through the Prevent, Respond, House framework. This investment would allow Connecticut to prevent people from becoming homeless in the first place, respond to current need with dignity, and move people into permanent housing faster. Without it, we risk a continued system strain, preventable housing loss, and the quiet acceptance of suffering that could have been avoided. Thank you for your time, your leadership, and your consideration. I urge you all to support the full $123.9 million Prevent, Respond, House investment and the aligned policy changes so that Connecticut can meet the crisis with compassion, responsibility, and the urgency it demands. Thank you.
Thank you, and thank you for your testimony. Next, Sandra Molina. Sandra Molina? No. Okay, Bruce Stovall. Is Bruce Stovall here? Bruce Stovall? Bruce Stovall. There we go. Okay.
It is here.
Yeah, and I'm going to hand off the baton to Representative Kennedy. She will pick up right behind me. Thank you, and thank you for your testimony, sir. Go right ahead.
Okay. Good evening, Senator Ostin, Representative Walker, and members of the Appropriations Committee. My name is Bruce Stovall, and I represent Oak Hill. Oak Hill was established in 1893 and is the largest provider of disability services in Connecticut. We operate 65 group homes, an accredited special education school, several camps, an assistive technology center, as well as a number of specialized clinical programs. We employ approximately 1,600 individuals and operate in 50 plus towns across the state. The staffing crisis, as you've heard tonight, across Connecticut, the nonprofit sector is all too real and perhaps the largest challenge I've seen Oak Hill face in my 30 plus years here. We employ over 1,000 direct support professionals, and we currently have over 250 vacancies. This shortage has forced us to temporarily close a number of homes, as well as hindered our ability to take new referrals from DDS, the DDS waiting list. Last year, I testified that we had 37 vacant beds. Sadly to report, regrettably, that number has now grown to 49. This staff shortage is a direct result of years of insufficient funding, where we simply no longer are competitive in the job market. We now compete with retail stores and fast food restaurants where, candidly, the salary is about the same, but the responsibilities are so much more profound in our sector. A direct care job at Oak Hill will start you off at $17.25 an hour based on current state funding levels. That very same individual, when starting off at a state-run group home, will begin around $25 an hour and count on a cost of living increase in the years ahead. Nonprofits save the state considerable dollars. We're simply asking for a fair shake. Indexing rates for inflation is a common sense solution and would allow nonprofits to provide sorely needed services to some of Connecticut's neediest families. I certainly appreciate your efforts in this area, Senator Ostin in particular, and certainly appreciate the help this committee supported the nonprofits from last year. Please accept the thanks of our nonprofit sector, but please understand we have more to do. Thank you.
Thank you, Mr. Stovall, for your testimony tonight, and thank you for being patient all day. Next up, we have Daniel Osborne. Mr. Osborne, when you're ready.
Yeah, hi, thank you. Good evening, Representative Kennedy and distinguished members of the Appropriations Committee. My name is Dan Osborne. I'm the CEO of Gilead Community Services in Middletown, Connecticut, and we are an Oak Hill affiliate. Thanks for putting me right after my Oak Hill colleague. That was very convenient. Gilead has provided a full continuum of high-quality mental health and addiction services for thousands of individuals living in Middlesex and Harford counties for the last 55 years. We serve people who have nowhere else to turn, like many people that you've talked to tonight. We're their service provider, the people we serve, but we're also their family, and we're their support system. So I'm here tonight to request that you increase funding for vital nonprofits like Gilead by $155 million in FY 7. I want to express my sincere gratitude for the significant and impactful funding increases that the governor and the legislature have approved in recent years and in the coming year. However, as others have mentioned before me, the unfortunate truth is that decades of stagnant funding and cuts, in addition to a growing need for services, means that there is still more work to do, and that's why I'm here. So I'm just going to give one simple example and cut it kind of short tonight and try not to use up all my time. At Gilead, we recently completed an analysis that identified that 5 of our 20 programs, 5 of the programs that serve some of the most vulnerable populations in our communities, are combining to produce over a $500,000 loss annually. When we dug into this data a little further, what we found was appalling, but it was not at all surprising. For each of the programs, each of those 5, over the last 5 years, the increase to our expenses has doubled, tripled, or in some cases quadrupled the revenue increases for that same time period. It's painfully clear to us that this is not a trend that's sustainable. As a result, my board is currently evaluating the viability of these programs. While we work to prevent closures at all costs because we are motivated by mission, our essential services just won't survive this continued trend. We need the legislature to continue to support these vital nonprofit programs by building on what you accomplished in recent years. We can't stop now. So please support increased funding for community nonprofits by $155 million. You've heard that number a lot. And thank you for the opportunity to testify tonight.
Thank you, Mr. Osborne. Have a nice evening. Stay safe.
Thank
Next
you.
up, we have Amberly Quiles. Did I say that right? You're not coming. Your audio doesn't seem to be working. Can you turn it up maybe a little bit? Amber, please.
Can you hear me now?
Oh, yes. Yes.
I'm so
perfect.
sorry. I
That's
deep
okay.
apologies.
No problem. Start when you're
Good
ready.
evening, esteemed members of the Appropriations Committee. My name is Amberly Quiles, and I am a 17-year-old senior from Trumbull High School and a member of the Governor's Prevention Partnership and their Youth Advisory Board, funded by the Department of Mental Health and Addiction Services, or DEMAS. I am here to respectfully request the expansion of prevention funding to the maximum amount regarding Bill 5032. To truly understand why this funding is so crucial, I want to share a deeply personal story, one that illustrates the real human cost behind the numbers and policies. My family and I are Puerto Rican, meaning we find any excuse for celebration. However, this upcoming April, we will not celebrate April Fool's Day or the abundance of a new blossoming spring. Rather, we will celebrate my brother's life, one that was lost on his 30th birthday almost 2 years ago at the vicious hands of fentanyl and Xanax. I imagine he stared up at the ceiling fan in his bed, wondering when it'll kick in, when he could escape a world that had never been kind to him. He liked music, rapped, and Sergio salad, and was vastly curious about religion, as am I. He was kind. He never forgot to wish me happy birthday, and he was a phenomenal father. His life has now been left behind, and we have lost an artist, a brother, a father, a son, and a learner. Unfortunately, my brother did not have an easy life. He lived in a small apartment with his 2 twin sisters and our single mother, and resorted to substance use after a brutal, unprecedented attack on the streets of Stanford when he was a teenager, what was supposed to be his home. He later moved to California, then Nevada, both endeavors an attempt at rehab. I recall him asking my mother to come home to eat his favorite Sergio salad. We didn't have the space, money, or mental capacity to bring him back home. And so I am left with a dead brother. My Down syndrome autistic nephew is left fatherless, and my family has a perpetually bleeding wound that refuses to heal as long as substance use continues. My friends often share tales of their siblings, all of whom struggled with addiction, but were able to come back to a white picket fenced family, who were able to eat their favorite salads, who were able to stay alive. This isn't merely a series of unfortunate events in an unfixable world. This is the story of a boy who deserved more resources, whose mother deserved a way to understand what her son was going through easily, rather than tirelessly grasping at any bit of comprehension, information, or resources she could find. And though my brother's life exposes deep, broader cracks and inequalities within our world, had there been more access, awareness, and education about substance use, especially in communities my family grew up in, I believe my brother would have been able to eat his favorite salad. I believe his son would continue growing up with a father. I believe I could have texted him happy birthday and not stare back at an empty screen, reminded of the fact that he began his life the same day it was ended. This is exactly what prevention organizations like the Governor's Prevention Partnership, or GPP, do. We reach different kinds of communities, from privileged ones to the ones most in need, but we can't continue doing it without the proper funding, expanded funding. By continuing to invest in prevention, we are investing in lives, not just lives like the lives of my brother, but also the lives that surround those who have lost their lives due to substance use. My mother, my twin sister, my nephew, and I. Thank you for taking the time to hear my testimony today and allowing me to speak on behalf of my brother to produce change. I deeply trust that continued and increased funding for prevention will save the lives of people like my brother. Thank you so much.
Thank you, Amberly, and thank you for sharing that deeply personal story. I'm so sorry for your loss, and maybe on April 1st, you could all share that special salad and remember your brother. Thank you so much.
Thank you.
We'll move on to number 120, Andrew Sellinger.
Hello.
There you are.
Can you?
I can hear
hear
you.
me?
You can start when you're ready.
Okay. I'm Andrew Sellinger. I'm from West Hartford, Connecticut, and I am the father of two adults with Fragile X syndrome. It's on the autism spectrum, and both of my children will require 7/24 care for the rest of their lives. I'm fortunate to have services from the Department of Developmental Services and a very good, loving agency after a tumultuous beginning. My son was residentially placed out of district, and when he came back, the first placement, he was assaulted in the day program and had two black eyes and was constantly restrained and having abrasions. And it was a very long period of time and dark period of time in our lives. Since then, we have transitioned to another agency, and I report that it's been 9 years since my son has had one single restraint. Because of the ideology of this agency and the care and love that they possess for their employees and the people they serve. So I want to make the point that I'm in support of the increases for FY for 2027, the 155 million for nonprofits due to the many stories you've heard of lack of funding. And it's quite simple. You can't go into buy a ribeye steak at $5.99. It's $19.99 now. So the state needs to pay for the services that they're receiving, and because of the impact that it has to the people. And this money is not just a giveaway. It's money that stays in our community and is spent in our community, and it's used to serve the most vulnerable. My son has a lot of challenging behaviors. He can be aggressive. He requires 2-on-1 out in the community. And I'm forever indebted to the direct care staff that they lovingly care for him. And I went to a restaurant, not with him, with my wife, that my son goes to. And the restaurant owner said, "Oh, your son Brian was in here with his staff." And he made remarks of, how well he was treated and with what respect. And this gentleman has, known our family and seen my son come into his restaurant for years. So it meant a lot to us. So thank you very much for the funding that you have done in the past. But as everybody has stated, we need more. The turnover is very difficult.
Thank you, Mr. Selinger, and thank you for being patient today to have your turn to speak. Thank you again for being here.
Thank you for the opportunity.
Thank you. Next up, we have Thomas Avery. Mr. Avery, when you're ready.
Yes, hello. Hello, Representative Kennedy. Thank you. And also members of the Appropriations Committee. My name's Tom Avery. I serve on the Board of Horizons, a private nonprofit agency providing essential services to our citizens with developmental disabilities through contracts with DDS. We're in our 47th year and serve over 1,600 people with developmental disabilities statewide. We employ 270 year-round staff and an additional 130 seasonal staff. Thank you for the opportunity to testify today, and thank you for the increases included in the enacted budget for fiscal year 27. We're requesting that you increase funding for vital nonprofit programs like Horizons by $155 million in fiscal year 27. Since COVID, we've been unable to support individuals who require one-to-one assistance at the level that we once could. We also cannot accept new individuals who need intensive support because we lost highly skilled staff during the pandemic and have not been able to recruit, retain, and train new staff to that level of expertise. Developing these skills takes years. My background is that I'm an occupational therapist. I spent over 30 years working with folks with intellectual disabilities and developmental disabilities. Clinicians such as occupational therapists like myself, physical therapists, speech language pathologists, psychologists, nurses, and so on, depend on direct support staff to carry out programs that we create. To give you some context, 30% of people with intellectual disabilities also have mental health issues such as schizophrenia, psychosis, autism, bipolar disorder. Up to 50% of folks with intellectual disabilities also have other serious health problems such as diabetes, COPD, epilepsy, sensory impairments, orthopedic abnormalities, and so forth. And that percentage increases as people age. So direct support staff have to deal with all these very complex issues. They have to communicate with folks who are nonverbal and use sign language. Many of them have decreased mobility and use wheelchairs, shower chairs, walkers, and a host of adapted equipment that has to be applied and maintained by the support staff. Many people are unable to eat a typical diet and have to have foods prepared a special way by support staff, or they're fed by feeding tube by support staff. There are folks who have challenging behaviors that may be harmful to themselves and others, and support staff have to adhere to prescribed routines and protocols developed by psychologists to keep everyone safe. It's essential that direct support staff take accurate data on all sorts of behaviors so that clinical staff can determine whether or not treatment is safe and effective. Direct support staff have to be able to transport folks everywhere since almost none of them drive. Often staff have to lift and position folks who have limited strength and control over their movements. So you can see that we're expecting direct support staff to do an awful lot of important and complicated things, and for
Mr.
very little
Avery,
money.
if you could just start to summarize, please. Thank you.
Okay, yes. So we're please asking that you support funding for community nonprofits by $155 million in fiscal year 27 and open the bond fund for us. Thank you so much for the opportunity to testify.
Thank you so much for your testimony tonight, sir. Next, we'll skip down to number 124, Carrie Dyer.
Hi.
I said that right.
You did. Thank you. I wasn't expecting to go next. Thank you so much for your time. I've spent the last 5 hours and 15 minutes with all of you listening to what everyone had to say. So I am going to do my best to not recycle what everyone is saying, but do my best to summarize. So my name is Carrie Dyer. I'm the Chief Executive Officer of Reliance Health in Norwich. We are a nonprofit agency serving all of Eastern Connecticut. We contract with both DEMIS and DDS. And the services that we provide are a host of levels of care. We do homeless outreach. We do recovery support services. We offer case management, psychosocial rehab, supported education, supportive housing. And we have 15 sites that have 24/7 coverage. 5 of those are DDS homes, 8 of those are DEMIS homes, and 2 of them are Demas apartment programs. So like you, all of the staff that covered those 15 sites did not have the luxury of having a snow day. They needed to find a way to get to those homes to provide the care and coverage that's needed by the very vulnerable folks that we have in our homes. I want to say thank you so much for the support that we've seen. We are definitely starting to see traction. I've spent many years being at the Capitol, repeating these stories over and over about the needs that we have and the flat funding and the horrible treatment that we feel that is happening when we're not funded adequately. So from 2007 to 2020, we were flat funded. And while we were in the midst of that, we didn't know how long that stretch was going to be. So we testified, we tried to tell our stories, but we didn't realize it was going to be a 13-year stretch. So my concern is that here we are, we're asking for a number of 155 million on top of what you've already done. And we thoroughly appreciate the fact that we are starting to have a renewed commitment to the nonprofit sector. And this new ask sounds like a lot of money, but it's because it's in the face of 13 years of flat funding. And it's more than wages. Wages are incredibly important. We need to keep the wonderful staff that we have. We need to recruit new staff to fulfill these positions. We have 250 employees at our agency serving 1,000 people. But it's more than that. We have 20 physical sites. I don't know how, we have a lot of vehicles. As you've heard, a lot of what we do is not just providing a service, but it's providing the places where those services occur and providing places that are respectful and a good neighbor to our community. We want our services to be seen as dignified and respected and as of actual businesses with expenses that align with being a business. The insurance costs are tremendous. Our compliance costs are tremendous. Cybersecurity is something that was not even considered years ago. So our ask is great. I hope we don't have ask fatigue. I know of all of these years, oh, I see the hand, okay, my time. But thank you for listening.
Finish your thoughts.
Yes, thank you for listening. Please, let's use this energy to really underscore our purpose and sharpen our resolve for this end. Thank you.
And I truly thank you for all of the work that you do. It just doesn't seem like enough, but thank you for everything and for staying with us all day to testify. Appreciate that.
My pleasure. Thank you.
Next up, we have Melanie Wild Lane.
Hi, thank you. My name is Melanie Wild Lane. I'm the Executive Director of the Connecticut Association of School-Based Health Centers. We're a statewide nonprofit supporting approximately 350 school-based health centers in Connecticut. Thank you for the opportunity to testify today. Every child deserves the opportunity to be healthy and to reach their fullest potential. Unfortunately, many young people face health challenges that can interfere with their ability to learn and thrive. We all share the goal of helping Connecticut's youth grow up healthy and successful. School-based health centers are essential in supporting students' medical, mental, and oral health needs. When kids are healthy, they're better prepared to learn. We respectfully ask the Appropriations Health Subcommittee to continue supporting and to increase the vital funding for our school-based health centers. These investments are essential to the shaping of students' futures. We also urge you to ensure that our school-based health centers' COLA remain a critical component to the current budget, allowing us to keep pace with ever-rising costs. I'm going to share with you a story. I have a longer testimony, but I want to share with you Aaliyah's story as she wrote it. When a 14-year-old Aaliyah entered her freshman year at the Connecticut high school, unnamed, she was already struggling quietly and mostly alone. Frequent headaches, anxiety, and missed classes were beginning to take a toll on her grades and her confidence. Her mother worked 2 jobs, transportation was unreliable, and scheduling outside appointments often meant long wait times or missed work days. Like many families in the community, the barriers to consistent health care were piling up. One morning, Aaliyah arrived late to school after a migraine. Her teacher gently suggested she visit the school-based health center down the hall. Aaliyah had walked past that a dozen times, but never thought it was a resource for her until that day when she stepped inside. Within minutes, she was greeted by a school-based health center nurse practitioner who carefully listened to her and asked questions. She scheduled a physical and a mental health screening. Over the next few weeks, Aaliyah received treatment for chronic headaches and connected with an on-site behavioral health clinician to work through her anxiety that had quietly undermined her for about a year. Her care didn't stop there. The school-based health center coordinated with her teachers and her family, ensuring that she had the support she needed, both medically and academically. Because services were located right on the school grounds, she never missed an appointment, she stopped missing class, and slowly began to rebuild her confidence. By spring, Aaliyah's grades were climbing, her headaches were under control, and she proudly joined the school's STEP team, something she'd always wanted to do. Her mom later said, "The health center didn't just help my daughter feel better, they gave her a chance to reconnect with her school and with herself." Aaliyah's story is one of a million stories that we hear every day from our school-based health center providers. But for thousands of students like Aaliyah, the presence of a school-based health center isn't just convenience, it's life-changing. So thank you for your ongoing commitment to our school-based health centers and to the young people that we provide service to.
Perfect timing. And Melody, did you submit your full testimony?
Absolutely.
Great. Thank you so much. So we'll have the
You're
written
very welcome.
testimony. Thank you. Next, we have Paul Reimer. Did I say that right?
Yes, you did.
When you're ready, Mr. Reimer.
Okay, thank you. Good evening, members of the Appropriations Committee. I'd like to first of all thank you for the increased funding we have received over the last several years, but also stress that a lot more needs to be done. My name is Paul Rimmer, and I serve as the director of the Horizons Supported Employment and Options Programme that is based out of South Windham. I have been at Horizons for 25 years. I love what I do, and I love the people we serve. Horizons currently serve 163 individuals in our Supported Employment and Options Programme, 90 of whom are engaged in competitive employment. Now, I appeared before this committee last year to speak about a young man who in many ways had been forgotten by the state. His name is Brady. At that time, I shared that due to ongoing staffing shortages, Brady had gone almost 5 years without receiving support. I also shared the difficult conversation I had with Brady and his mother, Carol, that despite their patience, the wait to resume support would have to continue as the workforce needed to provide these support had still not materialized. Following my testimony and much reflection, I made the decision to take action personally. I adjusted my schedule and committed one day each week to support Brady so that he could resume a part of his life that had been on hold for far too long. Currently, Brady receives just that one day a week of support, which I do provide, but receives no support when I'm on vacation or not available. When I first began supporting Brady, it would take several minutes for him to feel comfortable to leave his home. Over the past year, however, we have had the time and consistency needed to build a trusting relationship, an essential foundation for successful support. Today, when I arrive, Brady's often waiting for me at the door, eager and trying to contain the excitement about what new adventures that we're about to embark on. Brady has a passion for hiking, and during our first few months together, we explored trails throughout Connecticut. As we transition to the winter months, his mother, Carol, purchased a membership to Mansfield Community Centre, where now we go swimming and we walk the track. Over the past year, we've also visited many local restaurants. We've explored Mystic Aquarium. We've seen movies to cinema, been to the casinos, and that's just a few examples of the meaningful and enjoyable experiences that Brady has had over the last year. The change in Brady over the last year has been remarkable. He's now living his best life once a week, and his mother often shares with me that he becomes so excited in anticipation of our time together. She's also shared that witnessing the positive transformation has been a true joy for her to see. Brady's mum, Carol, is a pretty amazing person, and all she wants is a son to live a fulfilling life. Now, this demonstrates what can be achieved and a meaningful impact we can have on people's lives when we're able to attract and retain qualified staff through the provision of a livable wage. Staff retention is critical to our services, as relationships built over time are fundamental to the work we do and the outcomes we strive to achieve. I'm not sharing Brady's story here with everybody to seek any kind of recognition, but rather demonstrate the meaningful and lasting impact that can be made in an individual's life when we fully commit to our mission. Committee members and Governor Lamont, who I really hope is listening, there are many more individuals in a state like Brady who want opportunity to live their best lives. The question before all of us are whether we, as a state, will step forward to create these opportunities or allow these individuals to remain unseen. I would like to thank the committee for letting me to speak this evening, and I hope you all have a great evening. Thank you.
Thank you very much, sir, for sharing your story. We really appreciate it. Have a good night and be safe. Next, we have Rosanna Ferraro. Don't see her. Next, after Brian Skolnick. Brian, when you're ready.
Okay, I'm ready. Thank you.
Thank you.
I was just now submitting my testimony, so
Okay, great.
I can still read it, right?
Yes.
Okay. So good evening, honorable members of the Appropriations Committee. My name is Brian Skolnick, and I work as an employment specialist at Kuhn Employment Opportunities. I'm also a certified recovery support specialist, so I have experience living with substance use disorder and working every day to rebuild my life from addiction. Here at Kuhn, in our supported employment program, we help individuals reach their career goals. We show them how to navigate online job boards, build job-seeking skills, and how to prepare for interviews. Right now, I'm supporting around 20 individuals in central Connecticut who are living with substance use disorder and various mental health challenges. Employment specialists like myself help the individuals we serve find meaningful work, stability, and a real chance at sustained long-term recovery. I want to start by saying thank you. Thank you for the increases in the fiscal year 27 budget. Those investments are making a real difference. But today I'm here to ask you to do more. By adding $155 million to support nonprofits like Kuhn, we can help even more people move forward. The truth is our wait list keeps growing, staff is stretched thin, and caseloads are growing. Clients are ready to move forward in their recovery by getting back to work and rebuilding their lives, but they're being asked to wait. And in recovery, timing matters. Motivation can be fragile, and a delay could lead to relapse, hospitalization, or disengaging from our services entirely. Uncertainty around programs like Medicaid and SNAP make everything harder. Without those supports, recovery becomes harder. Getting a job or keeping a job becomes harder. And instead of moving people forward, I'm spending more and more time putting out preventable crises, all while trying to keep up with the rising costs in my own life. The staff of nonprofits who make all of this possible need wages that actually let them make ends meet. If we can't keep up, we risk losing the very people who keep these programs running smoothly. Connecticut has always led the way in supporting nonprofits, and we have the opportunity to make sure that the safety net stretches. If Kuhn Employment Opportunities and other Connecticut nonprofits received additional funding, we would put it to work immediately. We would reduce or even eliminate our wait lists. We'd hire and retain staff to lower caseloads and prevent burnout. We'd strengthen the one-on-one support that makes recovery and career success possible. That means better outcomes for the people we serve and a stronger workforce for the state of Connecticut. So I'm asking you today, please support increasing funding for community nonprofits by $155 million in fiscal year 27. Thank you for your time, and thank you for your continued commitment to people rebuilding their lives.
Thank you, Brian, and thank you for submitting your testimony in writing as well. It's very helpful.
Thank you.
Thank you. Next up, we have Kelly Juleson. Kelly, if you're ready.
I am. Good evening. It's nice to see Representative Kennedy and distinguished committee members. I am Kelly Juleson. I am the co-president and chief external affairs officer at the Governor's Prevention Partnership. We are a statewide organization that is focused on youth substance use prevention. And first, I want to thank you for restoring prevention in last year's budget. We've seen the impact. You've seen it here tonight with all of the incredible young people who are part of our youth advisory board, who have come forward to share the impact that prevention has had in their communities. And we just heard not that long ago from Amber Lee about her family's loss and what a life-changing difference prevention could have made for them. Now is not the time to take our foot off the gas. Today is actually the perfect day to talk about prevention as we're all in our homes. Prevention is too often misunderstood and made overly complicated, but prevention is not a lofty policy concept. It's not abstract. It's not unreachable. Prevention starts with you at home. It's the little things. It's taking 5 minutes to open your medicine cabinet and ask, what's expired? What's no longer needed? What's sitting here with the potential to be intentionally or unintentionally misused? And I'm going to share an embarrassing story with you that happened today. I clean out my medicine cabinet more than the average person, not because I'm anything extraordinary. It's just because I need the medication as props to demonstrate how to properly use drug deactivation pouches that we hand out as a prevention tool. I do this on a regular basis. Today, as I was snowed in here, I found prescriptions for our late dog from 2022, methocarbamol and gabapentin. They were prescribed for pain late in his life, but they're also medications that can be misused by humans. It was only because I live and breathe primary prevention that I immediately knew two things. One, of course, I should not be keeping unused medication. And two, I cannot just toss these in the trash or flush them down the toilet. These need to be safely disposed of. This is an example of how to put prevention in motion. It's not flashy, it's not reactive, it's upstream, it's proactive, it's strengthening protective factors before harm occurs. Prevention is the moments we stop to talk to our kids about the dangers of drugs and alcohol. In these moments, we truly have the power to change their futures. It's about life skills education, mentoring, parent support and empowerment, youth leadership. It's creating environments where healthy choices are easier choices. And while treatment and recovery are absolutely essential, prevention is what reduces the number of people who need them in the first place. We are a dopamine-driven society. We love immediate results, but prevention requires patience and sustained investment. But the eventual return is undeniable. Safer kids, stronger families, and healthier communities. Prevention is 1,000 small decisions that add up to big outcomes, and it starts with us. I hope when you leave this hearing tonight, you might check your own medicine cabinets and see what you may be able to properly dispose of. You never know what life you may be saving. Please increase your investment in prevention in Connecticut. Thank you.
Thank you, Kelly, and I do appreciate the message. I also clean mine out very often as well. So thank you. I don't see Christopher Prescott. Let me take a look. Next we have Jacob Tevis, if I said that right. Jacob, whenever you're ready. I don't.
Thank you. Thank
There
you,
you go.
honorable members of the Appropriations Committee. My name is Jacob Teebs, Director of Elm City Compass. I urge you to support HB 5032 and approve annualized funding for Elm City Compass. 4 years ago, Yale and the Connecticut Mental Health Center partnered with the City of New Haven to create Elm City Compass after a 9-month planning process that included extensive listening sessions with the community and first responders. Together, our community developed a comprehensive crisis response approach that included 4 objectives. First, to create a mobile crisis response team staffed by a licensed social worker and a peer specialist, managed by continuum of care, to support police and fire during 911 calls and to conduct targeted outreach. Second, to strengthen coordination across the crisis service system to divert individuals from unnecessary emergency room visits, hospitalizations, and arrests. Third, to establish an active community advisory board of New Haven residents to ensure community accountability. And fourth, to conduct a comprehensive evaluation to guide continuous improvement and decision-making. Compass has met each of these objectives. One example is that Compass is now fully integrated into the 911 system. About half of the crisis responses we make are to 911 calls, most at the request of police seeking Compass support, and about 7% of these 911 calls are handled independently by the team when there is no safety or medical risk. The other half of crisis responses involve targeted outreach to over 24 community partner sites to prevent crises from escalating into 911 calls. When conducting targeted outreach, the team notifies 911 so that all outreach is integrated into the 911 system. Compass has also created partnerships locally and regionally that have led to improved coordination with police, hospitals, homeless outreach, and other services. These partnerships began after Compass and the city convened service providers, advocates, faith leaders, and businesses during its first 2 years. Compass has also established a strong community advisory board. Board members co-lead major convenings, they conduct tabling at community events, they present at professional conferences, and they provide feedback on data. The board also prompted Compass to develop real-time information sharing between Compass and the 211 Children's Emergency Response System to coordinate support when a child is in crisis. In summary, Compass improves crisis service response, strengthens coordination, and reduces reliance on emergency rooms and law enforcement. It is a community-informed, data-driven model that works, and with your support, Compass can continue serving New Haven and the region and be a model statewide. Thank you very much for your time and consideration.
And thank you, sir, for your testimony. I appreciate it today. Have a good night. Be safe. I apologize ahead of time. John Labinek?
Lebenik, yep.
Lebenik.
Good evening, members of the committee, and thank you for your time. I'm here also in support of Bill HB 5032. My name is John Lebenik. I am a VP at Continuum of Care's Acute and Emergency Services. I'm a licensed social worker, and I'm also a person with lived experience. I have been part of the Compass program since its inception. Compass, Compassionate Allies Serving Our Streets, isn't just a program. It's a fundamental shift in how we handle behavioral health crises. In overseeing daily operations, I can tell you with certainty, our groundbreaking work doesn't just reduce the bottom line for the state, it reclaims valuable police hours and, most importantly, transforms the trajectory of the lives we touch. Our team describes our relationship with the New Haven Police Department and our community as a gold standard. Why? Because we aren't competing for resources, we are maximizing them. When our team arrives on scene, we allow officers to return to their primary duties, ensuring that the person in crisis receives specialized personal care while the community remains safe. We are the bridge between traditional law enforcement and person-centered recovery. When we talk about impact, we're talking about the woman who was evicted and losing her Section 8 voucher because of a mental health crisis. Compass did not just de-escalate the situation, we worked with social services and the landlord to actually save her housing. We're talking about a father struggling with addiction who was ready to give up, but because our peer recovery specialist has walked this path themselves, they were able to build trust and get him into treatment that very same day. Our impact isn't just a reduction in 911 calls, it's the reduction in trauma in our neighborhoods. We are transforming New Haven from a city that merely manages crises into a city that actively heals. Our work is so essential and our results are measurable. But to maintain this gold standard and keep our allies on the streets, we need your continued investment. Funding Compass is an investment in a safer, more compassionate New Haven. Thank you for your time and for your commitment to this work, and a shout out to all the recovery support specialists, people in recovery that have been here to testify. Thank you.
Thank you so much. And thank you for those words, Terry. I don't see Mag. So next up is number 134, Jessica Chan. Jessica,
Hi.
whenever you're ready.
Thanks. Good evening, members of the Appropriations Committee. My name is Jessica Chan. I am the Director of School-Based Health Centers at Child and Family Agency of Southeastern Connecticut, and I also serve on the Board of Directors for the Connecticut Association of School-Based Health Centers. I appreciate the opportunity to thank you for preserving the $1.2 million in the state budget allocated to CFA's newest school-based health center sites and to highlight the need to sustain cost of living adjustments for school-based health centers so we can continue to recruit and retain the clinicians our students depend on. CFA now operates 20 school-based health centers across New London County school districts, increasing access to medical and mental health services to a population of over 10,000 students. This year to date, we have over 6,000 students registered with our school-based program. 2,400 students have received medical care so far, and 581 students have received or are receiving mental health therapy. I won't go through all the data that's in my written testimony, but it speaks volumes about the work that our clinicians are doing every day. I'd like to focus on the integrated care model that's unique to our school-based program. Our medical and mental health clinicians, as well as their school partners, work as one team to view the whole child and address conditions that often intersect, whether it's a medical concern with psychological roots or a mental health issue with physical symptoms. This coordinated model delivers timely, comprehensive care in one setting. Our staff work beyond their licenses to ensure family needs are met both in and outside of our clinic walls, providing care coordination through external partnerships and in collaboration with school staff. One powerful example of this comes from a fellow nurse practitioner who also submitted written testimony. She recently worked with a family whose children were struggling with significant dental caries, helping them establish a primary care medical home outside of our school-based health center, secure insurance, access dental care, and connect one of the children with our school-based therapist for mental health support. These coordinated actions resulted in improved wellness, reduced pain, and better readiness to learn, improving both health and educational outcomes. I also want to emphasize why this matters so much right now. Many young people are navigating intense pressures and may be hesitant to share sensitive information with adults. Regardless of your views about national policy directions, we can all agree that investing in our youth and protecting the places where they feel safe to ask for help is a shared priority in Connecticut. Our school-based health centers are developmentally appropriate, culturally responsive, and are confidential care settings, creating safe spaces where students can seek help and build trust with adults. Our providers do this work because they believe in the mission, not because of the salary. The mission alone can't keep the workplace stable. So consistent COLA funding helps us stay competitive, prevent turnover, and make sure students continue receiving uninterrupted care. I'd also like to acknowledge and support the request of the Connecticut Association of School-Based Health Centers to fund their organization through fiscal year 2027, recognizing how school-based programs statewide rely on their consistent advocacy and the professional development they provide through annual conferences, lunch and learns, and other trainings. Thank you for your time.
Thank you, Jessica. And thank you for submitting your written testimony as well.
Of course.
We're going to go backwards to number 130 to Jacqueline Liebler. Jacqueline, when you're ready.
Thank you. Good evening, respected members of the Appropriations Committee. I am Jackie from Southington, and I'm a member of the Governor's Prevention Partnership Youth Advisory Board and a youth peer advocate for Southington Steps. I'm here to testify to continue prevention funding to the maximum amount. I'm speaking today to show you how prevention is a smart investment. To me, prevention means healthy assets, setting up the community and youth with the knowledge they need to make good decisions. At the state level and throughout towns, we engage our communities in events to build connections and get the message out about prevention. This is how we can keep our communities healthy and safe. For example, an experience that really stuck with me was first hearing a prevention analogy when I was a freshman in high school. Essentially, there was a theoretical dangerous river where people often fell in. The possible solutions were a ladder and a fence. The ladder would help people climb out, and the fence would prevent more people from falling into the dangerous river. What if people didn't have to fall into the river at all? This is when it became clear to me that prevention is crucial. That fence was prevention. Not only is prevention the right thing to do, as it helps physical health of community members, but it also costs far less to employ and has been very successful. We saw a 26% decrease in overdose deaths in 2024, and Provisional Sudar's data shows a further 21% decrease in 2025. Prevention is saving lives. Now is not the time to pull back. I encourage you to continue to invest in prevention to help us build an even stronger future for Connecticut residents. The fence I mentioned is what we emphasize as a part of the Governor's Prevention Partnership, or GPP. GPP is funded by the Department of Mental Health and Addiction Services to make Connecticut better with all of our work. As a member, I've worked to keep events running like the Future Prevention Leaders Conference, which is where over 100 youth meet to prepare for their futures in prevention. Most importantly, I get to engage with leaders in prevention across the state at every GPP meeting, hearing different perspectives, different issues, and the different solutions they have come up with. GPP connects smaller coalitions to make prevention stronger as a whole. While substance use prevention may have once seemed nearly impossible, we have seen so much improvement, and we're not done yet. Finally, I encourage members of this committee to continue prevention funding to the maximum amount. Thank you for helping us keep Connecticut healthy, and thank you for your time and support.
Thank you, Jacqueline, for submitting your testimony. I appreciate it. We're going to go back to, I see Mr. Bloodworth, you've joined us, Earl. When you're ready, if you want to start your testimony.
Yes, wow,
There
thank
you
you.
go.
I thought I was going to be in the 90s there, the 190s.
I have you as number 123.
Oh, really?
123.
Okay.
Go ahead, sir, when you're ready.
Sure. Thank you, distinguished members, Representative Kennedy, and those on the Appropriation Subcommittee. My name is Earl Bloodworth. I am a resident of New Haven, where I was born and raised, and I'm currently the executive.
Mr. Bloodworth, if you could unmute, you went back on mute. There you go. Thank you.
Okay, sorry about that.
That's good. Thank you.
Thank you, distinguished members of the Appropriations Health Subcommittee. Thank you, Representative Kennedy. My name is Earl Bloodworth. I am a resident of New Haven, where I was born and raised, and I am currently the Executive Director of Connecticut Against Gun Violence. I am testifying in support of Governor Lamont's proposed budget adjustments for the biennium ending June 30th, 2027. That's HB 5032. Specifically, the funding allocated for gun violence prevention to be administered by the Connecticut Department of Public Health, or DPH, and distributed to community-based organizations working on the front lines of gun violence prevention efforts. Although CAGV does not receive any of this funding, we work closely with these organizations across the state that do. We are witnessing firsthand the impactful work of these groups and recognize that the funding is absolutely essential. We know that the community-based anti-violence programs that are being funded through DPH are critical to the efforts to reduce gun violence in our cities and towns. The tireless teams at these organizations work to prevent conflicts that lead to violence and offer alternatives to those most at risk of violence. They provide individualized wraparound services to victims, reducing the risk of retaliation and further violence. Collectively, the organizations that received state funding have impacted thousands of Connecticut residents with the positive ripple effects of that work extending throughout their communities. According to Giffords Law Center, these community intervention programs have been proven to directly and substantially reduce gun violence in the hardest hit neighborhoods. The data here in Connecticut supports this. The state saw a reduction in homicide from 2023 to 2024, and even more dramatic reduction from 2024 to 2025. In Hartford alone, homicides were down by 50% last year. This is the same period during which Connecticut has used the DPH grants to help fund community violence intervention organizations. These programs are making our state safer, and we must continue to invest in prioritize these initiatives. These numbers represent lives saved, families kept whole, and communities strengthened. Moreover, the data shows that Black people in Connecticut experience gun violence at far higher rates than white people. Gun homicide victims in our state are disproportionately people of color. While approximately 56% of these victims are Black, only 10% of the state's population is Black. Young Black men in Connecticut are almost 39 times more likely to be murdered with a gun than similar age white men. To achieve racial justice, we must make people safe in the communities where they live. This requires funding community-based prevention and intervention programs in primarily Black and brown neighborhoods in our largest cities where the majority of Connecticut gun homicides occur. These programs have proven track records of reducing street-level gun violence by using credible messengers to break cycles of violence.
And Mr. Bloodworth, if you could start to wrap up. Your time is up. Thank you.
Almost set. Among individuals at the highest risk of being victims or perpetrators of gun violence, ensuring continuous funding for these organizations is vital to their long-term success. We implore the legislature to protect the funding for gun violence prevention in the budget this year so that the organizations that rely on this funding can continue to perform their life-saving work. Thank you for your consideration.
Thank you, sir, for being patient with us today and waiting it out. Now we are back online, and we are back on track, I should say, to number 135, Jennifer Keatley. Jennifer, and thank you for being patient.
No problem. Thank you so much. My name is Jennifer Keatley. I'm the Executive Director, UCP of Eastern Connecticut. And I am UCP has been serving people with intellectual and developmental disabilities for more than 75 years in Connecticut. Today, we provide residential services, day employment, individual supports, assistive technology, transition services for young adults, and family support services. We provide those services in New London, Wyndham, and Middlesex counties primarily, but also throughout the state of Connecticut. And through our partnership with DDS, we support them more than 400 individuals every day. These are individuals who want what we all want: a safe home, meaningful work, friendships, and the opportunity to contribute to their communities. The increased funding that we received last year is greatly appreciated and helps us to deliver our services. However, after years of stagnant funding, while the cost of doing business has escalated, more must be done. We respectfully request that you increase funding for vital nonprofit programs by $155 million in FY27. And again, while last year's budget increased rates for DDS services, it provided a disproportionately large increase for residential services in both fiscal years. Day and employment services are the programs that keep people connected to their community, learning skills, and pursuing employment. They did not receive comparable increases. Our request would be to provide an equal rate increase across all health and human services, including day and employment programs, and as well as an increase in room and board rates to reflect true costs. The challenges that we face because of this are we've had to freeze our open positions, increase caseloads on remaining staff. We've had to reduce our one-to-one supports in certain programs because we cannot recruit or retain enough staff at the current wages. We have to delay admissions for individuals graduating from high school because we don't have sufficient staffing. We have to limit expansion on employment supports, even though workforce participation is one of the most meaningful outcomes for people that we serve. We're competing with fast food restaurants and big box retailers offer higher wages with significantly fewer responsibilities. Supporting individuals with complex medical behavior and mobility needs requires training, compassion, and consistency. Without adequate rate increases, we can't offer wages that reflect the skill and the responsibility required. And that there are risks to the individuals and the families. It's not just our staff. They may lose consistent day programming and employment services. Families experience greater stress and fewer supports. As turnover happens, continuity of care is reduced. Emergency placements and higher cost state interventions may become more common. Day programs are not optional add-ons. They are essential to maintaining stability in residential settings, reducing isolation, and preventing crisis. And then there's the federal uncertainty. So while we rely on Medicare as the backbone of our services, any reduction or restructuring of Medicaid would have
Jennifer,
immediate
if you could
consequences.
start to wrap up, your 3 minutes is up. So if you could just wrap it up. Thank you so
Sure.
much. Thank you.
If we were to receive increased funding, we would raise wages for direct support professionals, expand day and employment services, and invest in career ladders to professionalize the workforce. These individuals that we serve are Connecticut residents, their workers, their neighbors, their family members, and these nonprofits like UCP are lifelines. Please support increased funding for community nonprofits. Thank you for the opportunity to testify and for your continued partnership.
Thank you, Jennifer. Appreciate your testimony today. Next, I see Lori Pasqualini.
Good evening, Senator Austin, Representative Walker, Representative Kennedy, and all of the Appropriations Committee. My name's Lori Pasqualini. I'm the Chief Financial Officer at Ability Beyond. Ability Beyond provides an array of services to people with disabilities throughout the western part of Connecticut, basically west of the Connecticut River. We are grateful to have received funding over the past few years to provide the pay increase of our direct care staff at a starting rate of $12.50 in December of 2018 to now up to $19 an hour. Unfortunately, not all of the state funders provided the same funding increases. So House Bill 5032 and the $155 million will help to create more equality amongst the funders. Ability Beyond provides services to people funded through Department of Social Services, Department of Developmental Services, Department of Mental Health and Addiction Services, the acquired brain injury and the autism waivers, as well as school systems throughout the state. I'm testifying to support the passing of House Bill. $19 is not enough to provide the cost of living here in Connecticut. In order for somebody to earn enough working at $19 an hour with overtime, they would need to work 110 hours a week. That's almost 3 full-time positions. It's just not enough. Turnover in 2019 pre-pandemic, our turnover at Ability Beyond was 17.6%. It went over 20.8% throughout the pandemic. We were able to bring it down to 15.8% when we got the significant increases in 23-24. It's now back up to 20.8%, beyond what it was prior to the pandemic. Turnover is our single biggest risk. It creates negative circumstances for the staff that work for us, and as well as most importantly, the people that we serve. It causes increased hiring costs, overtime, and leads to more burnout, all impacting the quality of care provided to our clients. In order to meet the needs, we need the $155 million to equalize those pay rates. Inflation is also hitting us really hard. Over the last 2 years, we had a 28% increase in our health insurance and a 30% increase in our professional liability, vehicle, and property insurance. That's over a 2-year period. Those funds have not been available. We're seeing another increase this year. During the pandemic, we received a lot of emergency pandemic funding, and that helped us get through the pandemic and stabilize us financially. And I think as well as many of the non-for-profits in the state, it's imperative that we get these funds.
If you could summarize.
Sure, sorry. It's
Thank you.
imperative that we get these funds for nonprofits to be sustainable, and this funding is critical to all of the nonprofit organization as well as the people we serve in all of our communities. Thank you very much, and please pass the bill for the $155 million.
Thank you so much, Lori, for your testimony.
Thank you.
I see that Barbara has joined us. Barbara Albert, if you're ready, you can start.
Good evening, members of the Appropriations Committee, also to everyone else. My name is Barbara Albert, Hartford Renner, registered voter, advocate, and activist for human rights. I'm on Medicare, Medicaid, and Social Security disability. I have multiple chronic and severe medical challenges, most not visible. I believe I have undiagnosed dyslexia and complex trauma, and I'm still twisted by the benzodiazepines that I took as prescribed. I am a psychiatric survivor. This is my testimony urging opposing any cuts to any human service agency. I believe there is no justification for making access to basic human needs more challenging than it already is, particularly to those of us who need it most. I've been attempting finding appropriate help and support for being harmed by 40 years polypharmacy, specifically brain changes from 28 years of benzodiazepines. The recurring 90-day prescription was for 720 milligrams, not exactly lowest possible dose for the shortest possible time, as now states on the box warning. I had therapy set up more than once, got canceled the day of the appointment. Any medical only sees that I'm not on a benzo, 3 opiates, Ambien, mood stabilizers, seizure meds for the interdose benzo withdrawal seizures. Benzodiazepines were not ever looked at. I do not have a seizure disorder. I keep getting psych evals where I go to primary care. This is UConn, outpatient pavilion. Last month I was told, I can't help you without a psychiatric diagnosis. I went there for my undiagnosed dyslexia for help with that. I believe this, I have filed a complaint with Department of Public Health concerning this after filing it with the patient relations at UConn. I've contacted the Brain Health Alliance, and I was told that they needed to contact the other benzo person to find out what they found out for resources. That was one of the calls. I was in and out of inpatient hospitals for almost 20 years, until about 25 years ago. Systems don't allow for past being past. So much for the present. Exactly. I was steered to Narcotics Anonymous by someone at Demas. Advocacy Unlimited kicked me out of alternatives to suicide. I had only been 5 times. NAMI dismissed me for noticing a pattern, feeling baited, then confronting. I was not told why. There was an online benzo harm support group that ended right before Christmas. It was one of the few places I wasn't terrified of people. There is no one to meet me where I'm at. There is no alternative to psychiatric standard of care without the medical model. There, in my opinion, needs to be informed consent and transparency concerning what psychiatric drugs are and are not. Betrayal and rage of injustice are not the only things I feel, and don't feel because I'm emotionally blunted, yet beyond hypersensitive. I was told I would be sick for the rest of time, medicated for the rest of time. I need to be connected with other survivors. No medication or threats of, or anything close to coercion. There needs to be a choice and options. My coping skills are for someone on a pint and a pill. Addiction is repeating the same behavior over and over and expecting different results. Dependency is when the body adapts to a substance, adjusting to it, resulting in tolerance and withdrawal symptoms while stopping.
Ms.
Also
Albert,
involves
your
cravings.
time is up. If you could start to summarize, please.
Yes, I
Thank
have
you.
another sentence or two. Thank you.
Thank
I
you.
could not wait for the stuff to be out of me. My taper was too fast. I only knew to not cold turkey. I do not believe I am non-compliant. I am refusing to voluntarily participate in my own dementia. Seems doctors don't have time to help you and your issues. They do to sign prescriptions. I need help now. This is unacceptable. Thank you very much for your time and listening.
Thank you. And thank you for sharing your personal story. Next is Victoria Hughes Bacchiacci, and I'm going to turn the reins over to Rep Belton. Thank you.
Thank you. Good evening, everyone.
Madam Chair, quickly, as we're nearing the end of the public hearing, we just want to make a reminder to folks online who may have attempted to join and were unsuccessful. If you would try logging out of your Zoom and then logging back in, hopefully we'll be able to promote you to panelist. Thank you, Madam Chair.
Should I start talking now?
Yes.
Oh, thank you. Good evening, Representative Belton and the members of the Appropriation Committee. So my name is Victoria Hughes Bacchiacci. I'm the HR Director at Horizons. If you've heard about 138 times now, thank you, but truly thank you for the opportunity to testify. So firstly, and again, many people have said this today, I'm here to thank you for the increases included in the enacted budget for 2020 fiscal year 27. However, obviously here to ask for more, to request an increase funding for non-profit programs like Horizons by 155 million. So you've heard a lot about Horizons tonight. We're a non-profit supporting people with developmental disabilities. So in my role, every morning I walk into my office where my primary responsibilities is to find, hire and retain people who make the life possible for the people that we support. I don't just see this work through like spreadsheets and labour laws. I was a camp counsellor. I really value my relationships with families of the people we support, and my own family, my brother-in-law, is lucky to be supported by Horizons. Now, I can go on and talk forever about him and his progress since joining Horizons. And it's really a testament to the Horizons way and the things that I teach and tell people we are. But it's really dependent on the dedicated staff who show up every single day. Today's been a good example of that, highlighting how dedicated people truly are with the snowstorm. So from my seat, I'm witnessing a deepening workforce crisis that threatens to undo some of these really wonderful stories. The story of David, my brother-in-law, and his peers. You've heard about all the calls. Colette is someone that testified earlier today, a parent of one of the peoples we support, and she talked about numbers and numbers and numbers and all the people that are still on these lists who need the support, like David and many others. So our mission is thriving, but we need our funding to keep up with that, to be able to provide the level of care. Burnout's the norm, we keep talking about it, but burnout staff cannot show up in a way that's sustainable. They cannot provide the level of patience, the consistency, and the emotion stability that the work really needs. When our staff are stretched thin, and they are, their stress doesn't stay at home. It spills into the direct support environment. When a staff member is worried about rent, about back-to-back shifts, about how to be present, then it really impacts the people that we support. A quick online search shows that Connecticut residents, as of early 2026, have experienced heightened stress due to intense financial pressures, housing, energy and food costs. Raising anxiety and depression are tied directly to these challenges. And all of that just adds to burnout. I was talking to a staff member the other day. She has 3 jobs and is pushing the envelope and trying to get all them 3 jobs virtually full-time hours to put herself through college. I spoke to another staff member who told me that he didn't want the manager position after working here for 11 years because we just weren't paid enough for the extra that was given. People are doing up to 3 jobs. So I find myself saying often, before COVID, but the truth is, we haven't recovered from them kind of COVID dipping numbers with our staff. The funding increase we are requesting will help us attract, retain qualified staff, build the expertise needed to serve the individuals with complex needs. And Connecticut's always charted its own path, and non-profits have really greatly.
You've exceeded your time. Can you please conclude the remarks?
Yeah, so really, I respectfully ask you to support the increased funding for the community non-profits by 155 million, and to open the bond fund to ages like ours can continue to operate safely. Thank you.
Thank you for your testimony. Next, we have Deb.
Thank you very much. Can you hear me okay?
Yes.
Thank you. Good evening, Representative Belton and members of the Appropriations Committee. My name is Deb Poland. I'm the Chief Strategy Officer for the Community Health Center Association of Connecticut. And we are the association that works with the state's 17 community health centers who provide primary medical, dental, and behavioral health care to about 452,000 people across the state every year. We did submit written testimony, so you should have that on the record. And before I say any more, I do just want to take a moment and thank all of the members of the Appropriations Committee, because I know for the last many, many nights, you've had many people come before you, and I really appreciate, just as a citizen of the state, the dedication that you all put into reviewing the budget line by line and issue by issue. So thank you for that. 3 items I wanted to highlight. The first is to thank the governor for including money for flu vaccines for uninsured and underinsured adults. We think this is a great idea. The community health centers are a perfect partner for this initiative, having provided 92,000 flu vaccines in 2024, which is the latest year that we have data for so far. And we would really like to see that this issue moves forward in the Appropriations Committee budget. Second, I'd like to align my comments with those who've spoken in favor of school-based health centers. I do also serve on the board of the Connecticut Association of School-Based Health Centers, and almost all of our community health centers do operate school-based health centers across the state as well. We do support the COLA. School-based health centers make healthier students and better learners, but they do cost a lot of money to operate, so we do need those grant dollars to increase. And finally, I'd like to ask you to include some funding in the budget for the state loan repayment program for healthcare providers. This is a program that was funded through COVID relief dollars. It was extremely successful, and now those dollars are expiring. We think it's very important to have a state loan repayment program because dozens of other states have this program. So we want to make sure that Connecticut remains competitive with other states in attracting physicians, dentists, nurses, and other primary healthcare providers. We once had this program many, many years ago in Connecticut, and through that program, we were able to attract a dentist to one of our health centers. Dr. Patel is still today working at Staywell Health Center because he was brought into that health center through the state loan repayment program. It's an excellent recruitment tool. We would hate to see this program go away due to the loss of the COVID funding, and so we would ask you to fund it with state dollars if you can. Thank you so much.
Thank you for your testimony. And now we will go to, let me see, Chris Butler.
Hello, good evening, Representative Belton, Representative Walker, and honorable members of the Appropriations Committee.
Chris, you're muted.
I'm sorry. I apologize for that. I'm a PCA, and I've worked for a client for a decade now. I originally became a caregiver and provider through an agency 12 years ago. That's when I met Client My Consumer, Christian My Consumer. After a few years, I planned to leave the agency due to pay reasons, because their pay at that time was about $12 an hour, despite being there for several years. But Christian's mother and his family saw how much her son was flourishing and wanted me to continue working with him. So we connected through the state-run PCA program. I've remained a caregiver because Christian and I have formed a lifelong bond. I care about him on a personal level just as much as a professional one. He only depends on me, but trusts me and genuinely enjoys being with me, and we always have a great time together. Thankfully, I haven't had issues being paid by GT Independent since they have taken over with the state. However, my client's YMCA membership is supposed to be reimbursed through the state, and 7 months later, that payment and none of the payments for each month have still not been processed, despite multiple phone calls with each being assured that the payment would go through. These reimbursements allow my clients to participate in activities that help keep them healthy as long as getting him involved in the community. He struggles with his weight and staying motivated. This is something we found that truly worked for him, but it's difficult to expect someone to stay motivated when the state keeps putting several obstacles in their way. This may seem small compared to someone having paycheck issues, which is a very serious issue for anyone in this state. But it's another clear example of how much GTI is failing to handle its responsibilities. If a simple reimbursement check can't be processed for months, it's no surprise that many PCAs are struggling to be paid properly. Even my client's case manager agrees that GTA operates on its own schedule, and we are basically helpless when it comes to getting this payment handled. We can call over and over again, but it's just a waste of our time and our breath, unfortunately. My client is on a very fixed income. These extra expenses are not something he can cover. I receive a small stipend through the state to help pay for these activities, but it's not nearly enough to cover out for the year. It runs out quickly, and of course, we have difficulty receiving these reimbursements as well. These reimbursements are incredibly important for my client's ability to have a full and happy life moving forward. We need you to increase funding to DDS to address these issues and to ensure consumers receive the care they not only need, but they deserve. Many people in the DDS system are getting just enough hours to survive. So those who depend on this care have a real chance at fulfilling life. I'd like to thank you very much for your time, and I hope you have a great evening. Thank you.
Thank you for your testimony, Chris. Have a good night. Next, we have Anna Allen.
Hi, thank you so much for having me. Good afternoon, distinguished members of the Appropriations Committee. My name is Anna Allen, and I'm the Executive Director of the Keep the Promise Coalition, a coalition focused on platforming voices of those with lived experience with mental health conditions, disabilities, and more. I'm testifying on HB 5032 to call for the increased funding for community nonprofits and peer respite homes. We know folks can use many different community services to access clinical and mental health care and housing. These are important and well funded, but what about those whose these services do not serve? How does Connecticut support alternatives for supportive housing and mental health care? Well, that would be through our peer respite homes. As a mental health professional, one of the most important things I want to shed light on here is the focus on quality life improvement, which leads to Connecticut residents not just staying alive, but leading happy lives. What I notice in our state is we're focused on retention more than anything. Zero suicide and zero harm methodologies are great to make sure folks are not having access to the things that could hurt them or end their lives. But when do we focus on the quality of life for each of our neighbors, peers, and residents? Once people are physically safe, how do we address cognition? Your constituency is asking you, does Connecticut care about the quality of life as much as that we care about the expectancy? The past weeks of hearings in front of the committee have consisted of individuals fighting for better care, better rights, funding, and better understanding of what mental health and disability communities go through. With peer respite housing, residents are receiving non-clinical alternative to psychiatric hospitalization, seeking safe home-like environments during emotional mental health crises. It also allows for community-based environment that fosters healing through empowerment, safety, and non-pathologized conversations about trauma and suicide. This helps avoid emergency room visits, reduces isolation, and allows for peer-led recovery, such as wellness recovery action plans. We are not only saving lives by creating successful peer respites here and expanding development to other towns in Connecticut like the Gloria House, we are also giving a clear message that how people live their lives and that were saved are equally as important. We ask that the committee reviews the 94% success rate of our first and most successful Connecticut peer respite home, and not just promise to help the housing crisis here in Connecticut, but also make a decision to create already available services in the town accessible to other towns. We ask that you approve funding for more peer respite homes and support structures for them to be created in the FY27 budget. Thank you.
Thank you so much for your testimony. Have a great night. Next, we have Melissa Davison Woods.
Good evening, Representative Belton. It's nice to see you and all members of the Appropriations Committee. My name is Melissa Davison Wood. I'm the President and CEO for Impact, Inspiring Meaningful Pathways Across Connecticut, formerly known as Mark Community Resources in Middletown. We're a nonprofit provider of services for individuals with intellectual and developmental disabilities. Impact supports individuals throughout their lives through residential services, day and employment programs, in-home supports, rec services, and supported living. We currently provide services to more than 260 individuals and their families across Middlesex and Hartford counties, including Middletown, Cheshire, Hartford, and surrounding communities. The majority of our funding comes from DDS. We are so grateful for the increases that you enacted in fiscal year 27, and we truly appreciate the governor and legislators' recognition that nonprofit human service system requires investment. However, after the many years of stagnant reimbursement rates, inflammatory pressures, workforce shortages, and increased service complexity, the system remains fragile. I respectfully urge you to support the additional $155 million investment in fiscal year 27 to stabilize and strengthen community-based services. While last year's budget provided meaningful DDS rate increases, those increases were weighted heavily towards residential services. Residential programs are critical, and we're grateful for that support. However, day and employment services did not receive proportional increases. For organizations like mine, this creates an imbalance. Day programs are the foundation of community integration, skill development, and employment readiness. When they're underfunded, the entire continuum of care is strained. The lack of funding presents real operational challenges. We continue to struggle with workforce recruitment and retention. Even with the rate increases, we compete in a labor market where entry-level retail and warehouse positions often pay similarly or more than highly demanding direct support roles. This affects our ability to maintain consistent staffing ratios, open new program capacity, and reduce wait lists. We've had to delay admissions into certain programs because we simply cannot staff them safely. This is not a position that any mission-driven organization wants to be in. Differential increases between residential and day services mean that we're forced to shift internal resources to stabilize other areas that did not receive comparable rate adjustments. That approach is not sustainable long-term and limits our ability to innovate, expand employment partnerships, and invest in individual supports. Connecticut has long been a leader in community-based services for individuals with disabilities. With a projected surplus, our state has the opportunity to reinforce that leadership and ensure the nonprofit human service infrastructure does not erode. Community partners like Impact are essential partners in delivering state services. We are strong, individuals and families thrive. When we are strong, individuals and families thrive. When we are strained, the system weakens. I ask that you support the additional $155 million investment in fiscal year 27 to ensure that community nonprofits can continue to provide high-quality, person-centered services across Connecticut. Thank you for your time, and I hope everyone has a good night, and thank you so much for spending the night with us.
Great to see you, Melissa, and thank you so much for your testimony.
Thank you.
Next, we have Ayanna Lyles.
All right, well, good evening, distinguished members of the Appropriations Committee. My name is Dr. Ayanna Lyles, and I'm a board-certified OBGYN physician licensed to practice medicine in Connecticut for the last 11 years. And I'm the vice chair for the Connecticut section of the American College of OBGYNs, which represents 1,068 OBGYN physicians and partners in women's health answering the call of our profession in our state. I'm also the co-chair for the Connecticut Maternal Mortality Committee. You have my testimony, and so I just want to highlight a few things. Thank you for the opportunity to submit testimony on behalf of the Connecticut section of ACOG on the importance of increasing Medicaid physician payment reimbursement rates in HB 5032. I urge the committee to make a meaningful investment in Medicaid reimbursement to protect patient access to care. For many physician specialties, Medicaid payment rates have remained essentially unchanged for nearly 2 decades. During that same time, the cost of running a medical practice has increased significantly, including staffing, supplies, technology, and regulatory requirements. I'm aware of several OBGYN practices that have either closed or been acquired by larger corporations due to these costs. In addition, when payment rates fail to keep pace with the cost of delivering care, it becomes increasingly difficult for physician practices to participate in the Medicaid program, and I'm aware of practices that have limited the number of Medicaid patients that they serve. The result is reduced access to care for Medicaid patients, especially our obstetric patients, who also have the highest rate of mortality in our state and account for 40% of all births in our state. Across Connecticut, Medicaid patients, including pregnant people, are experiencing long wait times, difficulty finding primary care, mental health care, and specialty care, and in some cases, an inability to secure appointments at all. I recently met a patient with Medicaid who described the months-long journey she had while waiting to get gynecologic care. She was turned down by several offices and unfortunately found our practice, which does accept Medicaid. This is an access problem, and ensuring that meaningful Medicaid reimbursement exists can eliminate this issue for Connecticut's Medicaid population, which deserves timely access to medical care, especially in our current environment. Thank you all for your time, and I appreciate the opportunity to provide testimony in support of this bill. I hope you guys have a good evening.
Thank you, Ayana. You have a great evening as well. And we are going on to David Horst.
Good evening, Representative Belton and members of the Appropriations Committee. My name is Reverend David Horst. I am manager of outreach and engagement at the New London Homeless Hospitality Center. I no longer serve a congregation and now devote my full-time ministry to homeless adults as a member of the Homeless Response Network in Eastern Connecticut. I am called to this ministry and mission because I believe that allowing citizens of this state to live in tents, in their cars, in abandoned buildings or on the streets is unacceptable, inhumane, and unjust. Living outside is not a choice, but the result of a lack of choices, and for some, no choices. We know that since 2021, homelessness has increased by 44%, a public health and humanitarian crisis right here in Connecticut. In the past year alone, 45% more people lived outside across rural, suburban, and urban communities alike. My colleagues and I see the crisis. We know how many lives are at risk, and we do our best to respond, and our hearts break almost every day. The caring and compassion we provide to people experiencing homelessness are essential, but not enough. Adequate funding is vital and saves lives. I respectfully urge the legislature to adopt a coordinated annual investment package for the homeless response system totaling $123.9 million, detailed in the Connecticut Can End Homelessness 2026 legislative agenda. Specifically, I ask for your support for increased funding of $6.39 million for year-round extreme weather response. This funding, added to the $5 million included in the governor's FY 2027 budget adjustments and the additional $610,000 for shelters, will enable us to rapidly open overflow and warming and cooling centers for unsheltered homeless citizens during demand spikes, such as the extreme weather we're experiencing right now, and other dangerous weather conditions year-round. Thank you for considering my testimony and for your leadership, courage, and compassion.
Thank you, Reverend Horst. You have a great evening. And we are going to move on to Lyndon Pitter.
Good evening, Representative Belton and honorable members of the Appropriation Committee. My name is Lyndon Pitter. I live in West Hartford, and I'm a personal care attendant for my brother-in-law for more than 10 years. I'm here to urge you to increase funding to the Department of Developmental Services so that we can provide the best possible care to our consumers. Honorable members, I want you to imagine something. Imagine a young man with autism living in a place where his needs aren't fully met, where what he really longs for isn't complicated treatment plan or system, but something simple: love, patience, and compassion. His family was new to this country, trying to rebuild their lives while struggling just to get by. They carry the quiet shame of knowing they cannot provide the 24-hour care their son needs. That young man is my brother-in-law. And as his family struggled, I made a decision that changed everything about my life. I gave up my career, I gave up my benefits, I gave up my financial security and future I had planned for. I brought him into our home and became his primary caregiver. I surrounded him with family, stability, and love. And today, he is thriving. But the joy of seeing him flourish has come with a very heavy price. Every day, I live with the anxiety and frustration and fear. I earn near poverty wage. I have no retirement savings. By choosing to care for a family member, I have put my own family's stability at risk. Sometimes it feels like Connecticut is punishing compassion instead of supporting it. My experience forces me to ask, where is the value placed on those who care for the most vulnerable among us? Why should caregivers have to sacrifice their own security, living with the constant fear about how they will survive in the future, simply because they choose to help someone else live with dignity? Caregivers like me should not have to wake up every day worrying about whether we can make it. We deserve stability. We deserve wages that actually cover the cost of living. We deserve access to retirement plans so that we can face our own future with dignity when we can no longer work. And this isn't about me. Our entire care force is at risk in Connecticut. People are leaving this field every day, choosing jobs with better pay and less stress. We are watching a mass exodus from this workforce that hold our care system together.
Mr. Pitter, can you please wrap up your testimony?
Yes, that has to change. We must support caregivers before more people leave, before more family struggles, before more vulnerable individuals lose the care they depend on. It's time to recognize the value of this work, and the time to act is now. Thank you very much for listening.
Thank you, and have a great evening.
You too.
We are moving on to Simon Wells.
Good evening, Representative Belton and members of the Appropriations Committee. Thanks for your time today. I have already submitted testimony, but I'd like to kind of just pull up some themes that I've picked up today. So my name is Simon Wells. I'm Chief of Staff at Horizons. We're a non-profit in South Wyndham. We serve people with intellectual and developmental disabilities where they live, learn, work, and play. So first, the good news. I think the general tone of today was a little more positive than last year. Last year was very much doom and gloom. And so I attribute that to the increases that occurred. And I think certainly for Horizons, we've been able to get a little bit of a footing with our staffing. Since August, we've hired 34 new hires, and that's made a meaningful impact. We're still understaffed. We still have employees who work overtime, considerable amounts, but we are in a better place. And so as a general theme, I think it's a step in the right direction what happened last year. Certainly support the bill, and we're looking for additional funding to make nonprofits whole. There's been decades of flat funding, and it's been very harsh on nonprofits who are obviously very efficient with their resources. They do quality work. They really serve the citizens of Connecticut and provide a service that often the state doesn't provide. And the state's been getting this service on the cheap for many years, and I think it's really time that Connecticut steps up and makes sure that all nonprofits are receiving the funding that they need to be able to be successful. We've heard about individuals who have complex needs, who are not getting the support they need, or they're having a revolving door of employees as people leave because they're attracted to higher paying positions. And I think the sort of general theme here is that we are ready. Nonprofits are ready to do the work. We're ready to serve the citizens of Connecticut. We just need the right resources to do that. And part of that is making sure that we can attract a viable and resilient workforce. And then we can start pecking away at these wait lists and the underserved, not just for folks in my profession, but all of the nonprofits you've heard today. So I do urge this committee to continue to support nonprofits, give us the resources that we need to be successful. We've got committed teams. We're ready to do the work. We just need the resources to make the magic happen. Thank you all for your time today.
Thank you. Have a good night.
You as well.
Next, we have Barry Simon.
Good evening. Thank you for the opportunity to testify on the governor's budget. I'm here to both thank you and to request increases that are desperately needed. The state can afford to save for a rainy day, pay down debt, and fund essential services for Connecticut residents. As the president and CEO of Oak Hill, I am proud to be here, which is the state's largest purchasing service provider. When we are fully staffed, we employ nearly 1,700 talented and dedicated staff and almost 150 programs throughout the state. We provide holistic and responsive care, but we cannot do this without our staff. We contract with almost all state human service agencies and are especially recognized as a DDS provider. But chronic underfunding has forced us to close 20 programs in 10 years. Group home and day programs that are no longer there, 200 jobs that no longer exist. We currently have 300 vacant positions. Beds in group homes sit empty. Classrooms remain underutilized because we cannot staff them. Adults and children with desperate for needs of services are stuck at home or on wait lists and unnecessarily using emergency services. We employ RNs, OTs, PTs, behaviorists, teachers, paras, direct support professionals, and social workers. The state sets our rates for pay for our unionized staff, which was $17.25 an hour. Although this past year the legislature provided some additional funding, which was welcome, it still did not move adequately, give a COLA for our staff. 1.4%, 2%, 3.4%, depending on the program, does not come close to covering the rising costs of living in Connecticut. Ironically, the governor said in his opening address that Connecticut and the economy do better when people have money in their pocket. Well, we're asking for inclusion in this message of opportunity and hope of living in a state where all people are created equal. But unfortunately, that's unless you work for a nonprofit. Investing in organizations like Oak Hill is not just about fairness, it's also about good economic development. Every dollar we receive helps stimulate local economies. It lifts up our employees, local businesses, and services that we provide, and we can get people access to services. Please think about where our services stand in terms of the values and priorities represented by the budget. Our stagnant rates have cemented poverty for much of our workforce. when other issues have become ignored for decades, such as the pension liability or teachers' retirement, they seem to get addressed with significant prioritization. This issue needs that same kind of attention and prioritization. We are a unionized agency, but we have not been able to settle our contract because the state did not honor the deal that it made with the union. Without fair funding,
Mary, can
strike
you please
actions
wrap
will
up your
continue.
testimony?
Our elected officials know what needs to be done, and we hear all the time how important our services are. Now we need action to match the words. Please support increasing funding for community nonprofits. Thank you.
Thank you and have a good night. We are moving on to our last speaker for the evening, Jacqueline.
Good evening, everyone. Thank you for the opportunity to testify. I am here to request that you index nonprofit rates to the consumer price index structure in order to more equitably fund a workforce that has been overlooked for a significant amount of time. During my 8 years at Oak Hill School, I have experienced the power of our mission to set the standard in empowering students and their families. I've worked with countless families who, only since joining our program, can confidently say that their child loves going to school. These families also reap the benefits of our functional life skills programming as their children become more independent at home. And this happens because our dedicated staff are committed to teaching and practicing skills in authentic settings while providing individualized instruction and support for every student, whether it be in the classroom or community. Although the value that our staff bring to Oak Hill cannot be measured, we know that current wages are not enough and nowhere near a living wage. The state refunds unionized workers' wages at $17.25 per hour, just 29 cents above minimum wage. Our employees start at $18.50 per hour, pushing Oak Hill into a deficit to pay a skilled workforce just above the bare minimum. The cost of inflation has not been factored into wage reimbursement since 2007, despite the cost of living increasing by over 50% since then. Our students present with complex needs that require innovative, attuned care from highly trained and exceptionally competent staff. Our employees must draw on their wide range of skills to assist students with academic activities, emotional regulation, community instruction, and recreational activities. At any given moment, our employees must use additional skills to de-escalate dysregulated students and could be subject to intense behaviors that include physical aggression, verbal outbursts, and elopement. They truly serve our student population, providing whatever is needed to support growth and regulation. To attract and retain this caliber of staffing, wages need to reflect the value it brings to our program and to the lives of our students. With 7 classroom locations and about 160 students, adequate staffing is crucial to our vitality as a program and agency. Since the current wage and reimbursement rate fall well below the value of the role, we are facing a chronic staffing shortage. Students who need Oak Hill School are left waiting for placement. Our enrollment capacity is stifled because staffing is required before classrooms can expand. We currently have over 300 job vacancies. Please remember we are not able to raise taxes or raise our rates to cover costs and this does not address the cost of living adjustment for our staff. Filling the hundreds of vacancies by offering wages that reflect the cost of living in 2026 and the skills required to maintain a successful program, that we will foster economic development. Every dollar we receive will help stimulate local economies. It will uplift our current employees. It will support local businesses, and it will expand our services so that people on our waiting list can get what they need. Thank you for your time.
Thank you, Jacqueline. Have a good night.
Thanks, you too.
And thank you to all of my colleagues online. This concludes our public hearing. Bye.
Night, everybody. Be safe.